Hola, buenos días.
Good morning. First of all, I'd like to apologise for these few minutes of delay. We're just waiting for everyone to collect their badges, and we'd like to welcome the distinguished guests, colleagues, friends. It's an honour and a privilege for the Universidad San Jorge to welcome you to this first Running Science International Congress organised by us together with PODE. This is going to be highlighting different national and international studies with a scientific and practical basis in the world of running. Our objective as an educational entity is to promote the knowledge of these areas, promote collaboration between different disciplines, between different experts, and offer, of course, practical solutions to improve performance and reduce injuries among runners. Over these 2 days, we'll have the opportunity to hear from renowned speakers, and I'm sure that their knowledge and their experiences will provide us with a comprehensive and up-to-date view of the advances in research on running and biomechanics. This conference is therefore not just a platform for learning, it's also an opportunity to establish valuable and durable connections in the professional sphere. We have over 150 professionals here from different disciplines across the world. And we also have here today 30 students from the BEEP Erasmus program, another 30 students from different universities across Europe who have chosen us and specifically this conference to meet, to strengthen and promote this area in the different educational institutions that make up the European network of podiatry. And thank you so much to you for being here today. I'd also like to thank all of our sponsors and collaborators who have made this event possible. And as you can imagine, without their support, we wouldn't be able to do this. It's fundamental, their support, and to promote research as well. Of course, we'd like to thank members of the organising committee, the scientific committee, for working extremely long days, taking care of every single detail so that this can move forward and be what we're all wanting from today. And lastly, I just want to wish you all the best, to enjoy this as much as you can, to participate in all of the workshops and sessions, and to share your ideas and knowledge. I'm sure that together we can advance in the understanding and application of all of the processes involved in running to benefit all of us who practice running. So once again, a very warm welcome to the city of Zaragoza, to the Universidad San Jorge, and to the first Running Science Congress, and I hope you enjoy these next 2 days. Thank you very much.
Buenos días.
Good morning, everyone. First of all, I'd like to introduce myself. I'm Luis Alberto. I'm the director of the Masters in Sports, and we're collaborating with the organization of this first international congress on running science. And I'd like to follow up on what Mappy mentioned and say, I give you a warm welcome as well to this congress, to the university, and also for the health sciences faculty. It's a real honor to be able to hold this congress. Last year we did have a preliminary congress about the science of running, where we can integrate different professions and different areas of study, and which I think can have a really significant impact in the next few years, because, as you know, just in Spain there are millions of runners, and there aren't so many runners forums where we can talk about the discipline of running and talk about all of these different factors that can affect running, from training to nutrition or to injury prevention, including biomechanics and podiatry. So I'm not going to talk for too long, and once again I'd like to apologise for the slight delay in starting today. We are really pleased to have been received so well by international and national speakers who have also joined in on this Congress, and we hope that we will continue this in the future. We hope that you will enjoy the talks that we're going to be holding, that we're going to be hearing today and tomorrow. And without further ado, I'd like to welcome you and pass you over to our organizer, Luis Enrique Roche, to give a few words. Thank you. Good morning, colleagues of this profession, of the scientific field. And just a few years ago, I woke up one night and I thought, there's no Congress on running. And I started to search online, and there were absolutely no conferences specialized in this topic. I looked back in time, there weren't any at all. It was about 6 or 7 in the morning. I sent a WhatsApp to Tonio, my right hand in research, and I said, listen, I've had this idea. And he said, well, that's a good idea. And then I mentioned this to Victor Soto, who had been a thesis director with various colleagues at WhatsApp calls. It's a good idea, you know. And so we started off with this idea, which has materialized almost 3 years later. We did a pilot trial with a kind of dissemination there. We saw it was really well received, and today, this year, we decided to do this on a more professional level, and we hope to repeat it in future as well. We looked for the best speakers internationally and nationally in running science, and we found Kempode, and some of its integrators were, you know, we were aiming at them to have them as speakers, and they also offered to co-organize the event and to have this meeting on running science. So we thought it was a fantastic idea, and that's why we have a much more international environment here. We've got students from Belgium, from Portugal, Romania, France, representatives from Malta, the Netherlands. I'm sure I'm missing out some countries. Finland, I think, as well. I'm sure I've forgotten some countries, but we have over 10 countries represented here today, so thank you so much for making this effort to be here. Thanks to Empoder for helping us. Thanks to the University San Jorge for supporting this idea, because sometimes when you offer up this idea, they take you as somewhat of an idiot. You know, why are we going to do a conference just on running? Yeah, there are so many professionals interested as well as runners interested in this field. And thank you so much to the sponsors. I'll try not to leave out any. Ortomecanica, Fresco, STT, Motion Balance, Rondom, Tarsos, Podotech 3D. They've all helped with their financial means to help this Congress, and I have to say that without them, this Congress wouldn't be taking place. So thank you, and thanks to the collaborators who have helped us to disseminate this. The Zaragoza Marathon, Aragonese Federation of Athletics, the Professional Association of Physios, the Professional Association of Podiatrists, COLEF Running Zaragoza, the Aragonese Federation of Triathlon, and thank you to the whole organising committee, scientific committee, and to a great extent to the research group UNLOP, who have borne a great part of the organisational process. And of course, thanks to you as well, because you've certainly sacrificed 2 days of work in your clinic, 2 days of work in your classes, if you're students. And so I hope that these 2 days that we're here will be able to compensate that, not only financial effort, but also that time effort that you've sacrificed to come here to Zaragoza. And I hope that Zaragoza gives you a warm welcome and that you'll also enjoy the city, not just the Congress. So without further ado, let's begin with the first round table, and thank you to everyone.
Bueno,
Well, the Congress is based on several areas. One of these is health and society. Another one is physiology, training, and sports performance. And then we have another of the specific aspects, which is footwear, and this is one of the more interesting topics. And we've also got biomechanics.
First roundtable, so I would invite to the scenario to Kevin Deschamps and Yves Lescure, please, if you can. So first of all, I would like to present Kevin Deschamps. So Kevin is probably one of the most highlighted podiatrists now in biomechanics, in food biomechanics in Europe, but I could say in the world. So it's a great honor for us to have it here. He's podiatrist in Leuven, Leuven University.
And Leonardo da Vinci.
In Leuven Leonardo da Vinci University, and he's, as I told you, one of the most proficient podiatrists now in Europe and probably in the world. So it's a great honor and pleasure for us to have it here. So please, Kevin. You have to pass with it.
Yes, thank you for this introduction, Luis. Also from my side, I would like to thank the organization for this brilliant conference, I think. We do know that it's a lot of efforts that it takes for organizing such a conference, so I think we should also congratulate those people who are behind this. And I will start indeed with a lecture today on food biomechanics. And I will hope to give you a good overview of this in about 20 minutes. At least if the technology is working. It will be 21 minutes, 22.
Sorry about the inconvenience, but the presentation broke. So we are changing the order. So now it's not Kevin Deschamps, as you can imagine. Okay. So now I want to present Yves Lescure. He's also a highlighted podiatrist from Lyon. He organized the last year the last EMPODE meeting, and I can say that it was completely a success. And he's going to talk about the biomechanical strategies in order to improve running stride. So, sorry, we are going to show the first presentation, and I hope everything starts now. And I'm sorry for the inconvenience.
Perfect.
Okay,
Great. Thank you.
Over.
Thank you, Luis. Hello, everybody. I'm Yves Lescure. I'm a French podiatrist. I'm from Lyon and from Paris too. I'm very happy to be there, and I would like to thank all the organization to welcome me and to welcome as a member of EMPODE. Thank you very much for all the organization to welcome the EMPODE Congress inside this amazing Congress. Today, I'm going to talk to you about biomechanical strategies to improve running stride, okay, and the different type of intervention. But this presentation is linked to an article which is in the review in scientific review. So we're now waiting for news for the review, and I'm going to try to explain what we've done in this study. But before, we're gonna have to talk about running injuries, because it's the main topic of the Congress: running stride, running injuries. What is important to remember for running injuries, that it's very common. That overuse injuries includes a lot of knee pathology, knee injuries like patellofemoral pain syndrome, iliotibial bend syndrome, and running-related injuries is management. Running-related injuries management is a big topic in the literature. Okay. So here you can see a kind of graph that representing that knee pathology is a big part of running injuries, like almost 40% of running injuries. So it's very important for podiatrists, physiotherapists to consider knee injuries, knee biomechanics, and lower limb biomechanics. So we're going to talk about how to manage first running injury today. What's is said in the literature about the running injury management. So, as a podiatrist, when you have to manage a running injury, especially a knee running injury, there's different points to consider, but we are going to summarize it in 3 points. First, there's the running load management. We're going to talk about this, the muscular reinforcement, and the biomechanic change the biomechanic stride that you can change. This is three things that we have to focus in order to manage running injuries. Even if it's not really the main subject of my presentation, it's very important to talk about running load management. You cannot forget about this when you have a runner suffering about any injury, knee or ankle or anything about injury. Running load management has been demonstrated, especially by Esculier in 2017, that it's a very good tool to manage injuries, and sometimes even better if you do a good education to your running your runner patients. If you do a good education about running load management, it's a kind of you prevent him from injury, and you can manage his injuries. Okay, with different key points around running load management, and most of the two main points of this load management is two simple things: that you have to ask him to decrease duration of each session and increase training frequency. It means that you can have, for example, you can have an injury for example, for a runner who's running 20 kilometers per week, for example, running 2 times 10 kilometers, and is suffering every 8 kilometers. If you ask him to run like 3 times or 4 times 5 kilometers, is doing the same volume of running, but maybe it's a good way in order him to run without any pain. That can be a real option. And once you get that the good point of the load, the adapted load of this running situation, the goal after is to increase gradually according to symptoms. So my advice is to really have a look at it because it's very important. There's other points that can be considered, but those main 2 points, those key points, are very important. Remember this: decrease duration and increase frequency is a very good tool to manage running injuries, especially knee injuries. Another thing very described in the literature is the muscular reinforcement. Okay, it has been described in the literature a lot. It's maybe the best treatment today proposed in the literature, but with 2 things to consider. The first is that running reinforcement doesn't change running biomechanics. Okay, it allows to relieve pain, but it doesn't change the biomechanics. And the second point that we have to consider in running reinforcement is that there's a high rate of relapse, and maybe this high rate of relapse is linked to the fact that you don't change the biomechanics. So the third point is change the biomechanics. This is the third point, and this is what I'm going to sorry, to describe a little bit more. What are the ways to change biomechanics? First, why do we want to change the biomechanics traits? The goal of this is to unload the injured site. We don't change biomechanics to change biomechanics. We change biomechanics in order to unload a site and an injured site to relieve pressure on the joint or relieve tension on the tendon, for example, in order that you don't have pain anymore. So this is the goal when you have to change biomechanics. You have to really consider which site you want to unload. It's very important, okay? To change biomechanics, we can consider different ways to change this, and I'm going to summarize 3 ways to change running biomechanics. The first is the footwear. The running shoes are a tool today that we really can use to influence the load on the lower limbs and the biomechanics. It's very important. There's a lot of characteristics in the footwear that influence the running stride and the load on the joints. But the most described and the most proven characteristic that has an influence on the running stride and running and the load of the joint in the running biomechanics is the heel-to-toe drop of the shoes. Okay, remember the heel-to-toe drop is the thickness difference between the forefoot and the heel part of the soles. So it goes mainly from 0 to 12. It depends from the brand, but you can find today different type of shoes with from 0 to 12 millimeters from heel to toe drop. So what we know about this characteristic and the influence on the lower limbs biomechanics is that when you have a high heel to toe drop, you, for example, on the knee biomechanics, you increase the knee flexion, the peak knee flexion, and then you increase the knee extension moment, which increase for example, for the patellofemoral stress is increased with a high drop. Okay, when you go from 0 to 10, you have a big increase. For example, it's been shown, you have a big increase of patellofemoral stress. Okay, and when you low the heel to toe drop, you decrease the patellofemoral pressure, but you increase the sagittal ankle moments. So it's important to consider that type of interventions change the biomechanics, but transfer the load. Okay, the goal when you have a patient with a pain anywhere, ankle, knee, or even a low back pain or something like this, okay, it's to unload this site, but you have always to take care about the site you're going to overload. So it's something that we can play with the heel to toe drop but we have to play with this very carefully in order to treat the pathology, but not create with side effects another one. Okay. Another way today. I'm going to do it. Okay. Another way to change the biomechanics strides, the stride of biomechanics, today is what we call the running retraining. Is the kind of way to improve the way you run, and there's different type of running technique. Okay, the running technique is something that influence the running stride. It's very important to know that, and you can change it as you can change the way a basketball player is doing a shot, for example. You can change the stride of a runner in order to manage injuries. There's different type of running technique. The first maybe consider running retraining change was to go from rear foot to forefoot, okay, which has been very well described in the literature like the past 15 years. And the consequences of that type of running retraining is that you transfer the load, for example, from the knee to the ankle. So it can be an option, but it's an option with some side effects. So it's something that you can use, but take care of the side effects on when you do that type of running retraining. The most described today, and maybe the most safe running retraining that has been described in the literature and that you really have to consider is the cadence, okay? And we know that today that increased step rate or increased the cadence done biomechanical effects on the hip, for example. Some articles showed that you can decrease hip adduction, you decrease knee flexion, and you decrease, for example, knee extension moment, which is a good thing for the management of running injuries. You can see on this, I don't know if you can see this, you have on the left side someone running around at 160 step per minute, and on the other side, the right side, is running at 175 step per running. And what you see is that the length of the stride is shorter, and it means that you're going to have a less range of motion of lower limbs joints, which seems to be good to relieve some pain, especially for the knee. The good thing to consider, and we'll talk about it more later, is that it seems that type of running retraining today have only good effects and no side effects compared to the rear foot from forefoot strike. Okay, increasing cadence have been showing that you can have a good clinical outcome for knee pathology without the risk of having ankle pathology, side effects, or things like this. So it's really something to consider. The literature said that to have good results, you have to go from 7.5 to 10% of increase of step rate. But anyway, every time you have someone that has a low step rate, it's a good option. Maybe sometimes we have to start by this to increase the step rate. And well, as I said, increased cadence may be useful to lower limb sagittal knee moments without increasing ankle moments. So it's very different from rear foot to forefoot running retraining. This is really the main point with no side effects. It means that when we do rear foot to forefoot, sometimes we relieve the pain on the knee, but you have pain on Achilles. And it's not the goal when you manage injuries, okay? So another way to change biomechanics is the foot orthosis, okay? It's our job to make foot orthosis, okay? Foot orthosis are described in the literature with a lot of controversy situation. What we know today is that we have some effects. Some authors show that you have some improvement on patellofemoral syndrome or iliotibial bend syndrome. Some don't find the same result. What we know is that the mechanism is still unclear. We don't know exactly what happens when you put foot autosis. And the reason of the in-clear mechanism and the in-clear results that we can have clinically is that there's a wide variety of foot autosis used in the literature, so it's difficult to make literature review and systematic review to really understand how mechanically foot autosis works. So let's go back to the main subject of what I want to present to you. Is a study we made in collaboration with the University of Malaga, where I'm a PhD student, and I'd like to thank my guide, Gabriel Giron, about this. And this article that we were waiting for news are the main objective to analyze combined effects. We've seen before isolated effects of each intervention, so we wanted to see if we combine interventions, what's the result on kinematic of the lower limb, okay? So for this, we had three tools. One shoes with 5 millimeter drops, heel-to-toe drop, which is the NUSA from a certain brand, okay? We had another tool that was to increase the step rate of 10%, and one other tool was the foot autosis that I'm going to describe a little bit later. So for this, we recruited 19 LCE runners. You can see the inclusion criteria, the exclusion criteria. The main thing that we asked to of those LCE runners, and it was very easy to have this, we wanted them to have a rear foot strike. Okay, it was very important, and that they used to run with shoes of 10 millimeters drop. Okay, this was the main inclusion criteria, except that they have to be a runner 2 times a week, and there's no injuries during the past 12 months, and you can see the characteristics of the age, the weight, and the height. So the first condition we wanted to compare, the baseline condition, was the natural way of the runners to run. It means with their rear foot strike and with the rear foot strike and with no modification. We want to measure the baseline situation, which is going to be called C1, with the way they used to run. Okay, and then we compare four types of interventions to this baseline. Okay, the first thing we want to compare to C1 was a full intervention of changing the heel to drop, increase the step rate, and put foot autosis. Okay, this is the combined. We wanted to see the combined effect of those three interventions. We had these three and other interventions which combine heel-to-toe drop decrease from 5 millimeters and foot autosis. We had the C4 condition with combined heel-to-toe drop decrease and increase of step rate or cadence. And we wanted to see only what happened with only on C5 with the cadence only, okay, with an increase of the cadence only, okay? Okay, let's have a look quickly at the foot autosis we use. It's an inversion foot autosis, and the main thing to know about this foot autosis is that it's a full-length medial wedge with a 4-foot slope in order to have a full-length action during all the stance phase. So let's talk now about the result we have. C2, it means the combined effects of heel-to-toe drop decrease, increased step rate, and foot autosis show an increase ankle dorsiflexion at foot strike. Oh, sorry, just to say that. Sorry about that. Okay. Okay. So what our main criteria, our biomechanical criteria, the outcome measure we want to look at it was the knee flexion and the hip adduction, okay? But also ankle dorsiflexion, more to see if we had bad side effects on the ankle. But the main criteria we wanted to analyze was peak knee flexion and hip adduction. So let's go back to the result to see that what is very interesting with the combined effect, the combined intervention of shoes, step rate, and foot autosis was that it increased the knee flexion at foot strike, okay, significantly, okay, and it decreased the peak knee flexion during the stance phase. So it's very interesting to have both of this. A lot of intervention decrease one or the other, but these combined interventions play a role on the two different situations of the knee at foot strike and at the peak during the stance phase. So it's considered like something very interesting to unload, especially the anterior knee problem like patellofemoral plate syndrome, and even it's very interesting for the iliotibial bend syndrome. Another thing that was not significant, but a good trend toward was a slight reduction of hip adduction. So you can see here what happened on the dorsiflexion and the significant increase of ankle dorsiflexion at foot strike, and then here that it increased knee flexion at foot strike and the peak knee flexion during the stance phase. The third condition was the running shoes heel to drop of 5 plus the foot orthosis. And then we only observe a significant result in the increase of the ankle dorsiflexion at foot strike, but showed limited impact on knee and hip biomechanics. The fourth condition, the C4, was combined heel to toe drop plus increase of the step rate. And then we have very interesting results around this, because we find again a little bit less than C2, but good significant result on knee flexion at foot strike, and good significant result to decrease the peak knee flexion. And then the C5, the cadence alone, the increase of the step rate, was very interesting to observe compared to C1 and compared to the other, because it was the most consistent effect of reducing peak knee flexion. They are cadence only has a better effect than all the combination of all the intervention on peak knee flexion, but nothing at foot strike. So we can consider that the full intervention that combine increased cadence, decreased heel to toe drop, and foot orthosis can show us the best results and the best effects on most criteria, especially on knee kinematics at foot strike and at the peak during the stance phase. Okay, for C4, it's the only significant result on peak ankle dorsiflexion, and C5 is very the increase of the cadence is very interesting on peak knee flexion. With the same thing I said in the introduction, is that when you increase the cadence, you have a good effect on peak knee flexion, and you have no effect on ankle. So it's good, because it means that it's an intervention that can have can allow you to unload knee pathologies, knee injuries, or knee biomechanics without overload the ankle. So it's very something to consider. So combining intervention can be considered to help to prevent or manage injuries, especially knee pathologies. That's one of the conclusions. We have to talk about the poor biomechanical benefits for foot orthosis combined to the shoes, to the heel to toe drop. It's very necessary to have future study to explore biomechanical effects on runners with knee pathologies, because the problem here was we had only healthy runners, and we can consider that maybe the problem and why we have no biomechanical influence on the running stride in healthy runner, it's just because they don't need this. As they're healthy, they don't need to be improved by a material thing like foot orthosis. We showed before in the French review that when you have, for example, anterior knee pain runners, you have more peak hip adduction, so foot orthosis can decrease this hip adduction. But if you have not a high peak hip adduction, the foot orthosis seems to don't act on this, which can be logical. So for the future, for this type of intervention, more studies are needed, and especially with clinical follow-up and knee injuries. To explain this, if you look at this simple video, we can really understand that on the right side, you can see hip adduction, with, which is like a dynamic knee valgus on the right side. And you can see that on the left side, we have a good alignment. So it's really easy to understand that the same foot orthosis on those both people won't have the same biomechanical action. Okay? Just an example to explain what I wanted to say. As I said, other evaluation. Another thing is that maybe the problem with the knowledge about foot orthosis today, we have to find good criteria, good evaluation criteria, and maybe kinematics is not enough to understand really what happens when we use foot orthosis. Kinetics is probably something that we have to explore, and for the knee pathology, for example, maybe knee extension moments is really a kinetic criteria that need to be explored, and this is what I can tell you today. Okay, thank you very much for your attention. I really like to thank again all the organization to welcome the EMPOLE Congress. Thank you, especially Luis, for the collaboration, and thank you for welcoming us. Thank you very much.
So, if you want to stay there, so yeah. So now we will try in a second attempt with Kevin. This is Kevin again. So sorry for the inconvenience with the PowerPoint, but now it's time to Kevin. So please enjoy.
I hope so. Yes. So welcome everyone again, and let's start with the lecture on foot biomechanics. Yeah, when you have to talk about foot biomechanics, your life gets a little bit complicated because we have, as also mentioned by Yves, we have different types of running strategies, strike strategies, let's say. So we have to put forward to this and then have a look at what kind of impact this can have. And I think we cannot neglect it. So throughout my presentation, I will try to give you a glance on what are the differences in those biomechanics, because I think it's quite relevant. And if we would only focus on one type of striking index, well, I think we will have a lot of questions at the end of the presentation. So I will try to counter this a little bit also. Here you have some indication. I don't think I have to really explain you what is a striking index. We have a classification. And one of the classifications that can be used is one in which, well, okay, we look at the location of your center of pressure or your gate line, where it is located at your initial contact. And here it's one of them where it's classified into 3 regions. Typically, your foot is divided into 3 proportional regions, and then depending on the location of the center of pressure at initial contact, you have your classification. I will continue with this on the center of pressure because it gives you a good summary metric on how the pressure is distributed and how this distribution changes underneath the foot. Indeed, and we have some studies about this. This is for heel striking, for example, where we have a good idea how big well, the displacement in the medial lateral direction it is. You will see here that on the left side, and sorry, but the pointer is not working apparently, but on the left side you will see that they divided the foot into 2, with the yellow axis on the right corner, so you have a medial and a lateral part of your foot, and the, well, displacement of the center of pressure along this axis, you will see it on the left side. So you see typically that it's also converted to a relative metric. They take the relative forefoot width, so you have some indications. And typically you see that it is about a displacement of 2 centimeters, more or less, for an adult foot. Okay, if you look at the left side. On the right side, okay, you can imagine that the location of the center of pressure around heel contact, it will be around 10% of your foot length, okay, if you have a heel striking index, okay. But obviously, like for example, as illustrated by Yves also, yeah, your geometry of your shoe and the sole of your, the geometry of your sole of your shoe can influence that, for example, for sure. They also looked in the past, and afterwards there have been other studies also about ultimately how does it look, this pressure distribution, and do we have a lot of heterogeneity or not? Well, in fact, in human beings, if you look, you can have some heterogeneity, but it's not endless. Okay, you can classify this. And this is one of the examples for running. Again, running with the heel striking index. You do see those four patterns who are coming back. I think that the images speak for themselves, but you will see here that this classification is typically oriented towards the distribution in your forefoot, yeah, around the 5 metatarsals, and then also your hallux. Ultimately, you can imagine that this is some kind of an approach where you do want to link this probably to pathologies or a higher risk of developing pathologies like stress fractures or other. But this is the main idea in many cases where you go to this kind of classification. Is it for performance? I do think that here it's more related to injury prevention, that is the bigger picture at which we are looking at. We can talk a lot about what is driving this plantar pressure distribution. There are multiple factors, intrinsic and extrinsic factors. We won't go to them because we only have 20 minutes. But for example, your forefoot morphotype will be, in some cases, a very important factor. In other cases, it won't be. There will be other elements coming into play. Your soft tissue characteristics, but also obviously extrinsic factors like the surface on which you are running or the shoe wear that you are wearing. Shifting a little bit now to another domain like kinematics. Yves has already looked into some of the kinematic variables for the lower limb. I will only focus on the foot, because it's a major topic of this presentation. And here again, we have to look into a more simplified way to the foot, in this way that we have multiple articulations, and we have some big challenges to model the kinematics or even the kinetic behavior of specific joints. So there are always some kind of simplifications that are done, and probably in many cases oversimplifications, but still I will give you some insight based on the literature. Okay. Probably the reference paper that will be often used, and I think I'm using it for sure, is that it's a publication by Wolf almost 20 years ago now. It's the in vivo bone study, where we have probably the best reference so far for indeed both during walking and running, the capturing of the individual bones through running. Okay. I don't have to explain what is the challenge in here when you want to capture that, but they did it in vivo with bone pins. Okay, it were basically the 5 researchers which were under the research. Okay, here you see. Okay, under local anesthetics, obviously, etc. Okay, so this is a summary table of those biomechanics. And specifically the kinematics. What you will see is that, I have a little laser there, but won't work on the television. So on the left side, you have the joint. They have excluded here the ankle joint, so the tibio-talar joint and the subtalar joint, okay? But you have an overview of the other functional segments or units that they are talking here. In the middle, you have the anatomical plane, and then you have two conditions. You have your walking condition and your running condition. Okay, because one of the purposes or the hypothesis here was that, okay, is there a difference in range of motion between those two conditions? Okay, if you are walking barefoot or running barefoot. Okay. Well, basically, if you look at those numbers, the range of motion here in those data, you will observe two things. Is that one might expect, or that would be my expectation at least, is that you would see an increase in range of motion in those joints during running. Okay. Well, in fact, this is only reported for two of those variables, those in green. For all the other ones, you see at least stabilization or the same, okay, or even a decrease. Okay, and a substantial decrease, for example, if you look at the talonavicular joint, for example, in the transverse plane, okay, it's a reduction by 50%. Okay, so where you see some differences or big differences for the lower limb, like the knee, the ankle, and the hip, where you have an increase in that range of motion during running, in many cases, depends also on your cadence, obviously, it's not the case here during running. We have no data for a differentiation between forefoot striking or heel striking. We don't have this in this study. Since we have had an important revolution, I think, in both in the hardware as well in the software context of 3D motion capturing systems, okay, we have seen the last 2-3 decades now substantial evolution in trying to capture that kinematic behavior in an in vivo way and in a non-invasive way. Okay, typically with skin markers. Yeah, that's one approach. We do see also that there's now indeed a tendency to go to markerless systems. But here for the foot, let's stick to the skin marker-based analysis. We have seen the appearance of more than 40 models, okay, in the literature. Okay, and the driving elements behind those models, it's typically from a professional background, from a theoretical background, some hypotheses that are driven here. Some of them are really also based on the study on 2008 from Wolf on the in vivo bone study, okay, where they had also some recommendations about which segments are being considered or can be considered as a functional unit, okay, which have then been used for those kind of multi-segment foot models. Okay, what I will present you today is some data collected through the Rizzoli foot model, okay, which you see here on the left side in red. The data that I'm presenting are collected from young university students, yeah, so healthy people, many cases, let's call them healthy, not drunk normally, or they shouldn't be at the time of the running cycles that we have collected. And we asked them to run in two kind of conditions. Okay, we were asking them to run with a heel strike pattern and also with a forefoot striking pattern. Yeah, you have to know that we didn't, by purpose, selected them on which type of running strategy they were using in daily life. Okay, where they by baseline they were forefoot runners, etc. We didn't do that. Let's be clear. Okay, we just recruited them throughout the faculty. Obviously, you see here those outputs where in your running cycle, more or less your first 30% will be your stance phase, yeah, where you see the blue line, and then the rest is the swing phase, obviously. Okay. Well, when you compare those two striking indexes, okay, you will see indeed in the first 10% a big difference. Okay. That's typically because that's what would everyone expect, okay? But this is the first appreciation that we have here, that the biggest difference, obviously, at the landing is different at the ankle, okay? Moving forward to the subtalar joint, okay, we call it the subtalar joint, or it's the relationship between your calcaneus and your tibia here, so it's not fully the subtalar joint. And each time you will see also here on the bottom some statistical analysis that is done, okay? So it's called statistical parametric mapping, where in time you will have an indication of differences in those graphs, okay? So you see here on the positive it's your inversion or your supination, then your eversion on the negative side, okay? Well, we do see some differences indeed. At initial contact, okay, because you have to keep in mind that the skin markers remained in place when they were running, okay, so that's the repeated measure design that we had here, okay, and the conditions were also counterbalanced, okay, but you had also a more inverted position through between 10 and 25% of your running cycle, okay, with that forefoot running. We were only looking from a statistical viewpoint on these differences, but obviously we started to see also other phenomena in our data. Okay? We had much more variability in this subtalar joint kinematics for the heel strike index. Okay? The band is much bigger. Okay? Those were not the hypotheses that we were testing here, let's be clear. It's purely an observation. Yeah? If you continue now and you look at the tibia kinematics in the transverse plane, so your internal and external rotation, okay, the same population again, we do see here again around the first 5% of your gait cycle, that external rotated position of the tibia, which is higher, okay? But obviously, afterwards, you do see, probably, we didn't test it from a statistical viewpoint, okay? The angular velocity is here much bigger, okay? In your forefoot running, okay? Throughout, from an externally rotated position towards an more internally rotated position, okay? Again, here, the green band is smaller, okay, where you compare it to the red one, okay, but this was not our hypothesis. If you now go to the mid-tarsal joint, yeah, well, you see that we didn't see significant differences here, okay. On the global viewpoint, it would be the same, but here we did see just the altered aspect, that we had much more variability now, okay, in that forefoot running, okay. You see the green band, which is much bigger, okay. Well, as I said, we didn't select them on if they were forefoot runners or rear foot runners, okay, or strikers, but that's what we observed here, and the pattern were quite similar. Here we have another approach where basically it's more a functional interpretation here, where you have the kinematics, okay, or the intersegmental angle between your forefoot and your calcaneus, okay. It's more a functional angle, let's say, because it represents somehow, the function you can have between those two segments and throughout your windlass mechanism and the plantar fascia, okay, through running. We didn't see significant differences here, but you can see some well, interesting findings around a more inversion of your forefoot, okay, when you land on the forefoot, okay. But ultimately, during push-off, from 20% on, between 20 and 30%, you do see that eversion of the forefoot, where you activate that windlass mechanism throughout your toes, and especially also your hallux, obviously. This is a hallux. We didn't see big differences in the hallux kinematics in both cases. You do need some 60 to 70 degrees of dorsiflexion somehow, and that was quite similar. Okay, knowing this, would like to take you more towards now the moments and the power, okay? And we have had in the past a number of publications, okay, where probably the foot was segmented as one rigid segment, yeah, like the Helen Hayes model and others that are used in gait analysis. And we had also always a thought that there would be some kind of misinterpretation in one or the other side. Well, and we had a look at this. So what do you see here? This is the plug-in gait model that you see in red. And then you have on the green side, the green graphs, are the tibiotalar kinematics or your rear foot kinematics, okay, that you're capturing in the sagittal plane if you consider it by taking into account only the calcaneus and not the whole foot, okay. And on the kinematic data, you will see, well, especially differences in your push-off phase, okay, where you see clearly, and that's on the right side on the top, is that from a statistical viewpoint, at least, you have an impact on your angular velocity, which is overestimated here with the plug-in gait model, okay. But obviously, if you push this towards your power calculation, if you have your moments and your angular velocity, you will have your power. You do see that you have an overestimation of your power, of your ankle, okay? So that's one of the reasons where, okay, we have to take into consideration that probably a multi-segmented approach would be more appropriate, okay? And pushing it a little bit further also is trying to combine this information and going towards an extension of it towards a multi-segmented kinetic model, we call it, where we try to model the kinetic behavior of those joints now, okay? We are typically doing this with a setup where you combine the pressure plate on top of a force plate. In this case, they are custom made. The force plate is custom made. It has the same dimensions, okay? In order to have, well, a proportional distribution of your shear forces among the different segments of your foot model, okay, based on your vertical ground traction force that you collect with your pressure data, okay? So that's the basic idea here, okay? In order to have, well, a center of pressure calculated per segment instead of having one segment or one center of pressure, sorry. What is the output of it? Here you have a summary. On the left side, you will see what is typically collected with a plug-in gait model, yeah? The ankle power that you have during heel strike running, okay? If you look to the right side now, you will have the segmented approach. And first of all, you have the rear foot power, where you see that, okay, you have the similar pattern, but obviously your power absorption, yeah, and your power generation is somehow a little bit overestimated here, okay, in this heel striking. We do know from where it's coming from, okay, we saw it earlier, that's one aspect, okay. But you also have more insight now on the other joints, if I can call it like this, for the time being. It's intersegmental angles, okay? But for example, for your midfoot or your Chopard joint, you do see that that joint has up to 3 watts of power absorption, watts per kilo absorption, okay? And up to more or less the same 3 to 4 watts per kilo generation, okay? So this ratio here between power absorption and generation is somehow 1, more or less, okay? You could call it, some call it an energy neutral, okay, midfoot behavior where, so it can be from a pathomechanical reasoning perspective interesting to look at, okay, do you have energy neutral midfoot kinetics or not, okay? Or do you have more power absorption than generation? On the Lisfranc joint, which is the 5 metatarsals here, you do see, or we don't see at all, power absorption. It's very, very limited, okay? You have to know that we don't have a differentiation here between individual metatarsals, let's be clear. The 1st and the 5th metatarsal, we don't segment it in a separate way. It's considered as one rigid segment, those 5 metatarsals, okay? So, but here you do see that the power absorption is very, very limited. Okay. I can tell you that I'm affiliated to an orthopedic department in several orthopedic conditions like acquired flat foot, etc. You do see differences in those Lisfranc joint, okay, where you have more power absorption, for example, and those studies will be coming out soon. But you have Lisfranc, the Lisfranc joint is providing you considerable power generation, okay? We will come back to it with your extrinsic foot muscles later on, okay? That goes up to 1 to 1.5 watts per kilogram. And then the toes, okay? The toes are providing a lot of power absorption, okay? And one would estimate that they contribute a lot to power generation, your toes, okay? But you do see that it's up to 2 to 3 watts per kilogram power absorption first, okay? So having that flexibility, okay, in the toes is quite crucial, okay, for your power absorption, okay? Afterwards, regarding power generation, you will see that it's quite limited, okay? You do see some power generation in the last 10-20%, obviously, okay? But we will be linking that further on to, well, the role of intrinsic and extrinsic foot muscles. Well, this is the comparison with the same data that we had collected with the university students, okay? Where we compared now also when they are running, okay, and with a forefoot or a rear foot striking pattern, and we compare it with the plug-in gait data. Switching to forefoot running, you do see a massive increase in your power absorption at your rear foot, indeed. Yeah, okay, it will not be a surprise for you, okay, which relates really to or thinking about the role of your soleus and your gastrocnemius, eccentric work here. Your power generation remains the same, ultimately. But you will see that this ratio in power absorption and generation for your ankle is quite different, the ratio, okay? For Chopard joint, okay, you will see that there's more a shift because obviously you land on the forefoot. Your location of your center of force is more anterior, so you will have increased moment and also this, the power, okay, which is increased here and more earlier. But it's not, it's somehow bottomed out here up to 2 watts, okay? It's getting earlier, okay, but it's not massively increasing, okay? And your ratio stays the same. For your Lisfranc joint, we see some, you see that's quite variable in the beginning there, in green, the first 10%, there's more variation there, but ultimately the power generation remains and the absorption is very, very limited. Regarding the toes, you have some temporal shift a little bit earlier, but again, the biggest differences are not at the toes. Okay, I would like to end with the muscles, because we had the pressure distribution or the forces, we had the kinematics and the kinetics. Looking more into detail to these, well, the muscle activities that we have here, what you have here is the extrinsic foot muscles first, and be aware of the fact that the first percentage is first the swing phase here, okay, and it's the last part of the graphs that is the stance phase, so it's some kind of a little different representation here. But we do know which muscles here in green, we will have them where they have a more eccentric work, okay, and where they will have their concentric work from the work already from 2004. This brings us to the role of the intrinsic foot muscles, which have been really poorly studied in the past, underexplored, I think. We do see a lot of efforts now, and I think there's a lot of evidence that's growing that we have to look into those intrinsic foot muscles. You have them here, the synthesis of those foot muscles, yeah, and you will see that about 40% of those foot muscles are oriented into the first ray action, okay, and the medial arch. But for example, you will also have your flexor hallucis longus and your quadratus plantae in their combined function. They will also have a big impact on your biomechanics, okay. We are having more and more information on those intrinsic foot muscles, yeah. They are unipinnate or bipinnate muscles. The muscle action and the force action is really along the tendon, okay. We do know also that they are multi-segmented, okay, those muscles, and we will come back to it later on. But they are quite small. You are talking, like for example, your abductor hallucis, it's about a thickness of 1.5 centimeters. It's quite small, okay? It's clear that it will not have the capacity as other extrinsic foot muscles, okay? Let's be clear, and so the role will be more on stiffening the toes during running and providing a stiffening of the metatarsals than on really producing power generation. A study that I want to bring under your attention here, a recent study from the group from Luke Kelly, where they tried to look into the action of those intrinsic foot muscles and taking into consideration the fact that if you are in a loaded condition or not, and if you are walking or running. Okay. Ultimately, the thought here is that when you want to activate your intrinsic foot muscles, you will need to be up to more than 50% of your body weight. If you are seated like this, it will be quite hard unless you have a very good selectivity of your muscles, but otherwise it will be quite hard to activate those muscles. Okay. So what they did here is you are in a loaded condition on the left side, yeah. So where you had the patient be sitting and you had a force actuator which was pushing down with a specific, depending on the body weight of the person, obviously. And in that static condition, they were looking at the deformation of the arch height. Okay. And what they did in particular, that they had two conditions here. They had a condition with a tibial nerve block, so they blocked the activation of specific muscles, okay, with this tibial nerve block, and you had the resting condition without nerve block. Okay. In trying to isolate that function, because obviously it's quite difficult to do this for intrinsic foot muscles. Well, what did they observe? They observed, okay, well, an increased or a decrease, sorry, deformation of your medial arch, okay, in a resting position when compared to your tibial nerve block. So with the tibial nerve block, you had more deformation of your medial arch, okay, which is providing you insight into the role of those intrinsic foot muscles in controlling the deformation of your arch. On the right side, you will see that they looked into this during running now, okay, so they had also that tibial nerve block, yeah. Those subjects, and they did see that the stiffness of the toes increased with this nerve block. Okay, so you do see that that role, okay, is clearly different during sitting and during a dynamic condition like running. Here you see the a part of a cadaver, okay, of the muscle biopsy. And you do see that, well, it's a multi-segmented muscles, most of them, okay? So the action lines of those muscles, well, they are controlled, okay? Or they are under a specific neuromotor control, okay? And it will help us in, indeed, providing stability and the small movements of specific orientation of our movement. And we call it typically a functional differentiation, okay? The muscle spindle density, for example, also, if you compare your extrinsic foot muscles with your intrinsic foot muscles, there's a big difference. On the right side, you will have your intrinsic foot muscles. Well, the muscle spindle density is much higher, okay, and that also tells us about the role for proprioception and sensory feedback. Finally, to conclude, because I only have 20 minutes, as I said, but I do think we have a lot of physiotherapists in the room, and I think also for you, knowing that we have to have a really good, clear view on those intrinsic foot muscles, we have to integrate them in our rehab programs, in our performance programs, okay? There is more and more evidence. I just illustrated one here, a prospective randomized controlled trial conducted 4 years ago, but they really reported a decrease of your running-related injuries about 2.4 times, okay, if you apply an 8-week intensive program of foot core strengthening. I will call it like this now, foot core strengthening, but also maintaining this for 12 months. Let's be clear, it's just not only keeping it for 8 weeks, but afterwards also keeping it into doing this on a regular basis. And this decreases quite impressively your running-related injuries, so, and the appearance of them. So, and with that, I would like to conclude and thank you for your attention.
So, thank you for your presentations. They were brilliant, so I enjoyed a lot. So, if there's any question in the room, si hay alguna pregunta en la sala, my colleague Carlos will give you the microphone. So, if anyone wants to ask something, ¿hay alguna pregunta en la sala?
We can go.
Ariel?
Hi, both. So it's a very interesting question and presentation. So the question is for Yves. So you showed that the two videos between one to run with without shoes for roads and one with shoes. In the social media, I use this type of picture or the videos to determine that it's better to run or not with barefoot or type of barefoot footwear. Maybe can you clarify what is your opinion about this option?
About barefoot running?
Barefoot or
about barefoot running or with shoe running?
To thinking in the kinematics on the kinetics movement, because maybe at the end the stress of the joint is not is the problem. So maybe it's the kinetics concepts of this. It both can respond your opinion about it. Okay.
About barefoot. Okay. Actually, what the opinion and what we can find in literature about barefoot, it's always easier when you have as a podiatrist when you have an injured runner. Okay, because it's very easy to read the literature and say that for knee problem, you know that going from shoes with, I don't know, like 6, 8, 10 millimeters drop to barefoot, you know that you're going to have less knee extension moment and less peak knee flexion, which is good for patellofemoral pain syndrome, iliotibial bend, it's okay. But you know that doing this, you're going to transfer the load from the knee to the ankle. So, so when you have a knee injury, that can be an option, but you have to know that you need a big period of transition to adapt your ankle, if your ankle is able to be adapted to this. If it's a goal, if the goal is to treat the knee problem, you have to do it progressively, going from like 10, then 5 millimeters, and then maybe 0, and running to barefoot. Why not? But it's a good option because you have a knee problem. To me, and for the literature, if you have an ankle problem or foot problem, it's not a good option because you're going to overload your ankle. You're going to so this is quite easy when you have an injured people. It's different when you have healthy people that say, okay, I'd like to run barefoot. Okay, why? Okay, because I'm free. You know what? Okay, but okay, why not? Okay, it can be an option, but you have to take the time to adapt to the new stress you're going to have on the foot and the ankle. To me, it's just a question of time. And if you have some past injury of Achilles tendon, of fasciitis, or thing like this, I think it's not a good option. So this is my point of view. I don't know, Kevin, what you think about this, but
I think, I think you're referring to a personalized approach. We have a quite heterogeneous population often, if they are injured or not. We are often looking at biomechanical characterization of multiple variables. Indeed, we have some information, but if you look then at more conditions like stress fractures, for example, you would probably adapt your strategy and your re-education strategy and rehabilitation strategy, also on offloading, for example. So yeah, I think it's pointing towards a personalized approach for many people, where you do see in sports, yeah, we do need it. Even also, yeah, including sleep, psychological factors, etc., rest, etc. So their nutrition. But from the biomechanical perspective, we have that, yeah, I think a personalized approach also, where well reflecting on your strategy and talking with your patient about different options that you have. And also include like those foot core exercises can also help you in optimizing your stress distribution among your joints, okay? And a little bit, yeah, a staged approach, yeah, that's what, and the load management.
And maybe sometimes you can mix. So you can have a part of your training load barefoot, okay, a little part at the beginning, and the other part with shoes, in order to get some stronger intrinsic muscle. For example, it showed that running barefoot make it stronger, so it can be an option too.
We do also see, for example, an increasing interest in yeah, the pathologies for women, for example, menopausal, postmenopausal women, etc. So we have specific points of attention there also, because you have an hormonal disbalance, etc. So we do need particular aspects that should be covered also for this population. So, yeah.
Okay. Any question? Alberto?
All right, thank you. Thank you for your presentation, Professor Deschamps. I have a little question about strengthening intrinsic foot muscles. With extrinsic muscles, we have the possibility to test them on strength with using a dynamometer or something like that. Do you have some practical tips for testing strength of intrinsic foot muscles, so we can know as a podiatrist if you have loss of strength or if it's quite good at the moment and you have a lot of possibilities to increase or not? So I'd like to have your insight on that, how to test them on strength.
Yeah, well, it's difficult to isolate the intrinsic from the extrinsic. What you will have typically is that the position from which you start is that your ankle will be in a more plantar flex position to exclude as much as possible the length ratio of your extrinsic foot muscles. So that's one thing that typically is done, okay, because that's what it can be easily done, is that your starting position of your patient and the alignment of his ankle joint, you put it in plantar flexion. For the rest, the isolation of it, some suggest to have specific guidelines to the people, okay, for, okay, don't avoid that type of activities, that you feel it, for example, for your tibialis posterior or the flexor hallucis. But it is quite complicated. We do know from EMG analysis that there is additional activation of those muscles, for sure, okay. How much they contribute, it's quite difficult to estimate. And we do know that, for example, neuromuscular electrostimulation, 1 or 2 sessions of specific muscles can optimize the recruitment already of your intrinsic foot muscles, because you start already at baseline in many conditions that purely the recruitment of those muscles is very difficult. So that's why you start activating your extrinsic foot muscles. So if you want to isolate them better, okay, you might think of, for example, having 1 or 2 sessions of electrostimulation, but because this has been shown to optimize really your selectivity of your intrinsic foot muscles. You just have to be the negative side also, is that the fact that you do this, it's an intervention, and you start to altering the force capacity of that muscle also, okay, because, but it's an idea of doing it once or twice, and then, because then the people have a better control over their intrinsic foot muscles. That's, yeah, a little bit the complicated condition in which we have, yeah.
All right, thank you.
Hi, Kevin. Diego Jaén from the University of Innsbruck. Thank you very much for your very nice presentation. I have a very applied question about foot core strength training. is there really a difference between dedicating a session to strengthen the foot core muscles, or can you just do your strength training barefoot or minimalist shoes?
Yeah, well, if you look at the literature, it started with McKeon almost 10 years ago, which were pointing together with Fourchet, François Fourchet, and others, pointing towards the foot core again. And we had a lot of attention towards looking at the intrinsic foot muscles and trying to have specific strength exercises for those intrinsic foot muscles and really do it in an isolated way. But then you see now that it's quite complicated to do this in an isolated way, and so you do see now they are typically call it foot core strengthening 2.0, for example, where you have an integrated approach in your strength condition that you would be doing in general, let's say, okay, even it's in a personalized way, and where you include specific exercises among a squat, okay, with additional lifts, okay, because that's what you will have to do. We need to go up to not just your body weight, okay, but increase your weight up to 130, 150% body weight in order to, more even accelerate it with or optimize your recruitment with your neuromuscular electrostimulation. You do see that especially the group in Switzerland is focusing more on those kind of approaches in an applied way, in foot core strengthening exercises together with the other programs that they are doing. Yeah.
Thank you.
Hello, Kevin and Yves. I'm Alberto from USJ. I have two questions, one from Kevin and one from Yves. First, Kevin, during the program that you made for 8 weeks, if I remember, did you measure with any kind of measurement the strength of the foot or changes of in the muscles? Or did you do any measurement?
Yeah. First of all, it was not my study. Okay?
Your study?
Yeah. It was not my study. It was in Brazil.
Ah, it was in Brazil.
Okay, but no problem. Okay, it's a study.
Okay.
Yeah.
Did they measure, or did they measure anything?
To my opinion, they didn't measure the direct measure of strength. They didn't include it, but I'm not fully sure. Okay, because there has been 2 or 3 papers about it. In this paper that I presented here, but there may be in one or the other paper that the same group, because it was a quite big study. Okay, it might be that there they had some references towards some kind of direct measures of strength. No indirect measures like ultrasound, like thickness or cross-sectional area. I don't think they have provided this, but direct measures probably, yeah.
Okay. And do you think that it will be useful to measure the cross-sectional area after the?
We have now 2 PhDs running on this, and we did see now in symptomatic flat feet, for example, it's a 10-week intervention, okay, with neuromuscular electrostimulation, done in our faculty, so 3 times a week. So patients are coming to our faculty. It's a well-controlled condition, let's say. We do see an increase of about 10 to 15% after 10 weeks, about hypertrophy, and also about 20% of foot strength, okay, of toe flexion. We do see this, yeah. And it is not on the abductor that we saw it on the flexor hallucis and the quadratus, which is, in this case, yeah.
Okay, thank you. And for Yves, did you find when you reduce the cadence that is an increase on hip, how do you say in English, sorry, on hip peak force? So let's say that there is more increase in the joint of the hip when you decrease the cadence?
When you decrease the cadence?
So when you decrease the cadence, it's better for the knee, no? For the
when you increase the cadence.
When you increase, sorry.
When you increase the cadence, when you increase the step rate, okay, you unload the knee.
The knee.
Yes.
But on the hip, do you find?
On the hip, I think the literature said that you unload too. You're not overload.
Okay.
Yeah.
Okay.
This is the kind of magical situation about step rate, increasing step rate. Today, what in the literature, you only have good effects and no bad side effects. You know, because actually you reduce all the stride. You reduce the length stride, and then you reduce all the range of motion of the lower limb joints. So then there's no overload of the hip.
Hay una última pregunta en el fondo.
Another question on the back, the last question on the back. So two more questions, two last questions.
Last question.
Hello, my name is Roberto Catalan. I would like to ask what's the variation of the drop and the intensity of the exercise, in case there's any kind of variation.
Drop make change in activity intensity. In activity intensity, and the other question, la segunda.
¿Y cómo varía, digamos, con?
And how would you do it regarding different types of food, or the dorsiflexion, with feet with shortened back part, or?
Answer to the drop changing. Taking in account the ankle dorsiflexion mobility. So when you select the change of drop, if you take in mind also the ankle mobility. He hecho una interpretación, ¿vale? De la pregunta. Perdón. So he wants to know how the changing drop make change in intensity, in activity intensity.
Okay.
And also if you take in account the ankle mobility when you you have seen this change.
Okay. Usually, when you have patients, that's what you mean, not in the study. When you have patients, when you ask for him to...
Dice si preguntas en pacientes o en el estudio en general. Preguntas en pacientes en general. In patients in general.
In patient, when you change something in a runner situation, you have to download the activity intensity. It's to adapt anyway, because you know that when you're going to make a change, especially drop, you know that you get transfer loads. Okay, it's going from knee to ankle. So the best way to adapt is to reduce activity for a moment and then increase progressively.
Cuando hay que hacer un cambio en el paciente, siempre tiene que adaptar la intensidad bajando la intensidad para poder generar una adaptación. Entonces, si va a cambiar el drop, también va a bajar la intensidad de entrenamiento para adaptar eso.
Okay. And about the ankle mobility, sure. If you have because of if you have a lack of mobility of ankle, it's going to be maybe more difficult, or you have more tension of all the gastrocnemius and Achilles tendon if you download the drop. But when you are guided by the injuries, it's more easy. That's why I think something I didn't say. That's why I think when a runner is healthy, there's no need to change. Because we know that we have a lot of running injuries. There's a lot of rates of injuries. So what I say to my runners, sometimes you have in private practice, you have runners coming. Okay, do I need some insoles? Do I need to change something? Okay, if you're good, if you feel good, and you can run like 40 kilometers a week, please don't change anything. It's that you have your own adaptation. If you want to improve performance or thing, maybe you can change things. But about injury, it's a very good thing to feel well. So don't change anything. This is my position in private practice. Sometimes you have some people, even if they have a little too much pronation, if they are a little knee valgus, why change something? Why? You feel good. Okay, so don't change anything. This is my position in my private practice.
Okay. Última pregunta, si hay, por favor.
Yes, thank you very much, Jos van Hendrikken from KU Leuven. I have a question for both of you. It's about knowing who are the better responders to interventions. So if you are intervening by doing foot muscle strengthening, for example, or by changes in food strike. Do we know anything whether there are certain people who respond better to that and other people who respond less, for example, based on foot posture index or any other parameters?
Well, yeah, indeed, and it's also coming back to the question asked by the previous person. We have, to my thought, some insight, Jos, about this. We have a study on responders and non-responders with footwear and foot orthotics, for example, looking at the knee adduction moment, for example, where sub-analysis has shown that the responders were those with a normal flexibility of the ankle, for example, okay, a normal mobility of the ankle. And the sub-analysis highlighted, which was here, the non-responders, about 33% of the group, okay, where the knee adduction moment was not altered or was even increased, okay, based on the fact that they were hypomobile, classified as hypomobile. So we have some insight on this. This is now for the ankle mobility aspect. I think taking into account other aspects like the mobility will play a big role. I think it's one of the studies that I know. Maybe there are other ones also, but those responders and non-responders.
Any concern?
Oh, no,
No. Okay.
it's perfect.
So let's move now to the coffee break. So we have planned 1 hour of coffee break, but if it doesn't matter to you, it's 40 minutes, so just to win 20 minutes now. You have coffee break out in this floor, but also please try to go to the first floor, so to the ground floor, because there's also coffee and there's also brands there, so sponsors there. So try to visit also there, also them. Thank you.
Tjoh, het is hot, hè, met de zon.
Hola, vamos a continuar. Bien, como digo, para continuar vamos a ir con la segunda de las mesas, en las que vamos a hablar de últimas tecnologías e inteligencia artificial aplicada al mundo del running. Para ello contamos con dos ponentes de excepción. Inicialmente tenemos al profesor Jos van Rentegem, de la Universidad de Leuven.
We have Jos van Rentegem, who is from the University of Leuven, who is one of the main scientific producers in biomechanics with over 20 years of experience, principally in biomechanical analysis and in the monitoring of musculoskeletal load. In today's talk, Jos will be talking about the latest trends and latest technology in the assessment of motion analysis. So, Josh, please go ahead.
Okay, I hope you can hear me. Good. Thank you very much, everyone, and thank you for the organizers to invite me here. I will shift the focus. We had the focus this morning with two very good speakers about the foot, and I will shift now the focus a little bit towards the whole lower extremity. So I will focus on that. But what I will focus on in particular is obviously the role of motion analysis. And this is a very rapidly advancing field. At the moment, we go super fast with this. And so I will run, think about the pun, it's about a running science. I will run over some of the developments that have been going on and try from a scientific perspective, help practitioners, help people who work in the field to maybe get some overview about what the role of motion analysis can be. Now, when I present, I tend to use the golden circle principle, which is asking the right questions. And the first question, when we start talking about something, we should ask is, why are we doing something? The second one will be how we do it. And the last question is what we do. Most people in this room probably have most interest in the what question. How can I measure motion analysis? How can I use that in my practice? And what should I do to do that? But I'll start with the why. First of all, why do we do motion analysis? Well, we have three reasons typically in the field. The first reason is to improve performance. We want to make sure that people can perform better. The second reason is to prevent that they get injured. Yeah, to make sure that if someone is doing sports, they can do it injury-free so that they can, at the same time, also keep improving their performance. And the third one is typically to recover from injury. So when you have an injury, to come back from injury and go back to safe, healthy sports. And so these three reasons are why we might be using at some point motion analysis. Now, when we use motion analysis, we typically think about a camera of some kind or a device of some kind. It measures something and expresses that as a particular measure. It could be a peak knee flexion or something, or maybe a curve, a profile of something. And that should then inform the practitioner about what to do next, how to intervene with their patients or with their athletes. Now, let's just go to the how question now. So how do we do this? How do we go about doing that? And if you think about motion analysis, there's probably three types of information that we want to gather. The first type of information would be spatiotemporal information. Now, I don't have the time to go into detail about this, but you can imagine that the typical relationships between step rate, for example, cadence, which was discussed already this morning, but also how we support ourselves, how long do we keep contact with the floor, how long do we fly, do we bounce, etc. And so there's a very nice paper by the colleagues in the Netherlands, which actually described some critical factors related to what we used to call the duty factor. The duty factor is the relationship between how much time do you spend flying and how much time do you actually spend on the ground when you are running. And there's a very nice paper there identifying the relationship between duty factor and cadence and how that might be categorized into different styles of running. And for certain reasons, you might want to have a lower duty factor, yeah, longer flight time. That means someone is more bouncy in that case. In performance measures, quite often this will be considered a positive thing. But for injury prevention, you might want to go to a more sticky behavior, which is a higher duty factor, where you are less bouncy and maybe are therefore also reducing your loads on the system. As I said, I can't go into detail, but that's one aspect of what you might measure. And so we do research about these things. For example, how can you increase step frequency? Is that possible to do it at all running speeds? And is it possible to therefore, by reducing or increasing step frequency, to also reduce the loads on the system? And the loads on the system, that means the actual loads inside the system. So we have done a study where we can go into the lab, we measure people biomechanically, we use cameras, we use an instrumented force platform in the treadmill, and we calculate all sorts of things, such as, for example, the patellar tendon force. Now, in practice, we're going to get there. Can we do that? Well, in practice, this is much more difficult. Here you can see, for example, that the patellar tendon force, the faster you run, the higher it gets. Okay, normal. You would expect that if you go run faster, that the loads increase. But also, if you increase your step frequency, so if you increase from the yellow, which is habitual, and you go to 10% faster step rate, 10% higher cadence, then you will actually see that the load will drop. Yeah. We have to be careful though, because if you increase your step frequency, what also happens is that you increase the number of steps over the same amount of distance. So if you have more times loading, even though it's lesser loading, if you have it more times, the cumulative load might still be the same. So there's quite some things to keep into account. Now, that's just an example of a study that we would do that interacts with spatiotemporal parameters of the running. So if we can measure those through motion analysis, that would be sometimes very useful. Another thing we can do is look at kinematics. And kinematics, we have here a typical presentation of kinematics. This is a paper, for example, where they looked at how changes in kinematics can explain changes in performance of running. And so this paper looked at to which extent changes or variation in certain parameters, kinematic parameters, joint angles, segmental angles, can explain differences between individuals in terms of running economy, in terms of anaerobic thresholds, and in terms of their season's best performance on an equivalent of 10K. Yeah? So they did all that, and it's a very in-depth study, lab-based study, but you can see that by evaluating kinematics, we can potentially help people to become better in performing. So that's kinematic measurements that we might want to get. The next one, which we discussed already in the previous session as well, is kinetic measurements. This is where it gets a bit more edgy, a bit more tricky, because to measure those becomes very difficult. The easiest measure of kinetics is typically the ground reaction force. And you will see many papers on that where people run over a ground reaction force, or nowadays run on a treadmill with force platforms in the treadmill. And so you can get many steps and many easy informations on how they land and how they propel themselves. There's different peaks that you can see. The rate of the peak, reaching the peak, can be calculated. So these are things that have been associated with injury risk, have been associated with performance, and we might want to measure. But ultimately, and I've taken this image from a website, what we really want to know is not just the forces that are acting on the body, but also the forces that are inside the body, because that's ultimately where we will get injured. As I mentioned about the patellar tendon force before, you have many forces acting there, and it was very nicely explained this morning already that if you reduce the load in one part of the system, you have to be careful because you might be increasing the load on another part of the system. And so this is where kinetic analyses become very useful to identify, for example, what we call compensation mechanisms. Compensation mechanisms can be between legs, which you might have an asymmetry in running. If you have had an injury, that happens a lot. You have an unknown asymmetry between your legs, but also within legs. And this was explained very nicely this morning, that if you reduce the load at the knee, for example, you might be shifting the load towards the ankle. But also for a joint, we have to understand that the joints are musculoskeletal tissues that are interacting with each other. And so we might have loading of the cartilage, which is the forces, the contact forces in the joints, or we might have loading on the muscle tendon units, which could be muscles or could be the tendons that are typically catching a lot of the impact loads and therefore are vulnerable to overload injuries. So the kinetics, I would say, is probably the magical thing that everyone might want to get to eventually, because that's where you can really go towards preventing injury. And more importantly, remember the third goal of doing this is also rehabilitation. If you have one structure that is having problems, what you might want to do is you might want to reduce the stress on that structure, but still keep doing what you want to do. That means you might want your runner to still keep running, but just having some intervention that reduces temporarily the stress on that structure. And that's something that is the holy grail of I would say, rehabilitation. If you achieve that, then that's something that is great. Maybe one example of how to achieve that, if you have a knee injury, then you might want to avoid the load on the knee for that time, or if you have a patellar tendon injury, for example, you might want to avoid the load on that due to impact. So you can do running on an anti-gravity treadmill or in a swimming pool, which means that you reduce the impact loading, but you still allow physiological charging of loading on a regular basis, so the athlete doesn't actually have a detraining effect on all aspects, but just reduces the load on the specific tissue. Now, when we go into those load measurements, I mentioned you guys are all waiting for me to tell you what is the way to measure these things. We did an overview on how you could measure things that are tissue-related loads, so the actual real tissue loads, that's on the left of this slide, or where we tend to measure whole body loads, and that's where you can see, for example, the ground reaction force. Now, there's one thing that you see on this slide here, namely, there's a current lack of field-based tissue or structural load metrics, things that you can measure in the lab. You can still see that we can measure tissue stresses and strains in the lab, but in the field, we can't do that. So this is the gap that we still have at the moment, but which is rapidly being filled in, despite the fact that maybe the science is just lagging behind. So let's go to the what. What do we do to measure motion? Well, we need to go back in history there, and we start with probably the founder of motion analysis, which is Edward Maybridge, who started doing this. Now, obviously, we've gone a long way from that, but to be honest, all the way till the 80s, and even the 90s, I would say, we were stuck with that kind of approach. We video measured with a video, and then we actually digitized on the video each frame. I might not appear very old, but I'm actually that old that my PhD was done digitizing high-speed videos on frame-by-frame basis. I wasted half of my PhD doing that, basically. That's how we used to work. But then obviously we know that this has moved on towards very advanced systems, and probably the biggest breakthrough has been the development of optoelectronic systems. We all know them. I'm not going to start naming any of the manufacturers here, but we put markers physically on the body, and then we can try to reconstruct the skeleton with that. And so this is where we get to now. This is still our gold standard measurement. Combine the motion capture with forces, you can measure kinetics, you can really do fantastic things. But it really is a lab-based environment, and it is very time-consuming. It's time-consuming to test, that means to collect your information, because you need to get the people marked up. It's very time-consuming, and also the processing of the data is very time-consuming. Let alone the analysis of these very complex curves, etc., also can be very challenging. So how can we get away from that? And at the moment, there's two trends to get away from that. One trend is to go to the IMU-based assessments. And IMU-based assessments have some real great advantage. So what you mean is you put an IMU on the segments that you have an interest, maybe on all of the segments, or maybe on just a few if you have only a localized interest. And you can wear that anywhere, which is fantastic. But it comes with issues, magnetic fields, etc., that come to play with your data and that actually interfere. But that's one avenue that we go. So I'll go into that into a bit more detail. The second avenue is markerless motion capture. So I'll also afterwards going into a bit of that detail as well. So let's think about this here. So this is actually sprinting. You can imagine that if you have to install cameras around a sprint track, it would cost a fortune to do that well. And obviously now you can let the person just go around a 400-meter track and you can actually get kinematic outputs from that. Yeah. Now the question is, does it really work well? Is it really good? And is it as good as the gold standard? This is what many people have questioned. And there's some studies around that, too much to put into this talk, but maybe one of them to mention is here. Okay, this is a systematic review and meta-analysis. And the conclusion is that currently IMU measurements of running, gait, spatiotemporal parameters are good using this kind of system. But if you really go to the kinematics in terms of joint angles, because that's what you've got, there are some issues and they need to be looked at with caution. Yeah, so that's something that is an issue there. Another thing also with these IMUs is that the frame rate at which they can pass on information might not necessarily always be high enough to do proper running kinematics, because running is a fast movement. You might have an interest in some very rapid changes in movement during running, and so that's where some of the systems have high capacity, but then you need to think that maybe they are limited compared to other systems. Okay? Now, it still only means you have only kinematics now. You're out of the lab, great, but you have no kinetics. So is it possible from only measuring these IMU-based kinematics to maybe estimate or calculate the kinetics? And so can we estimate forces, for example? From only the kinematics, knowing that the person, when they are running, each time they make contact with the floor, there is that ground reaction force, which is very typical. So could we predict it from how they land and how they run? Could we predict the ground reaction force to then go to the kinetics information? And so there's a good paper by Anxi Lau that's reviewed that. Again, way too much to cover within this presentation, but maybe some key take-home ideas. The more sensors, the better prediction we get of ground reaction force. So that means that most likely every segment you want to put IMUs on to get a real good indication of the ground reaction force. Most studies, however, are only able to predict the vertical ground reaction force. That means the vertical component. Already this morning, Kevin touched on that the shear component can be very important as well. And also the point of application is important to calculate inverse dynamics and calculate your joint-related loads. And that's where most studies are failing from that perspective. So that's where it struggles at the moment to get to. The absolute ground reaction force is also an issue. So differences in ground reaction forces are probably detectable and so can maybe be estimated, but the absolute ground reaction force is an issue. And what people have also done is, rather than using physics-based estimations, to use artificial neural networks, for example, artificial intelligence now more so. And so that's where people have also realized that that can have a good estimate, but it tends to be very good to be trained within a subject. So the error, if you have training your neural network between subjects, actually gets substantial and therefore might not make it very useful. But only have one participant and you can train your network on many steps, for example, for that participant, you can actually train and get to better estimate maybe the forces that the person is generating. So that was IMU based. The second trend of now is the markerless motion capture. Most likely all of you will have come across that at some point. And I have to explain there's two types of markerless. I call Markerless 1.0 is a type where you basically have a person, the left image, that you want to get the kinematics of. You first detect the hull, that means the circumference around the shape of that person in the volume. You try to detect that, and then you fit segments in that if you have that volume from different cameras. And then once you got the segments, you can try to fit the joints between the segments, and you can then ultimately get towards those musculoskeletal models. Now, honestly, that approach is probably bleeding a dead end at the moment because of the other approach being much more promising, particularly the fact that this approach is very difficult in an environment where the contrast between the individual moving and the environment is not so high. Yeah. So the next approach is Markerless 2.0, I call it, is using deep learning algorithms. And what that does is, first of all, you have an image of a person running, for example, and then you basically apply a manual label of the anatomical reference points that you normally would put a marker on. So you have a person who says, oh, that's where I think the ankle joint is, this is where I think the knee joint is, and you can go into as much detail as you want. And then what you do is you feed this into a Gen AI, so you feed it into the typical ChatGPT engine, so to speak, where you actually try to train an algorithm to do that for you based on vision, computation vision technology, and you keep training until it gets better and better and better. And so there are now commercial projects as well as scientific projects where people are doing that. Now, this is a great technology, and to be honest, the number of studies that are popping out now on the validity and the reliability, it's crazy. In the last 2 years, I think it has gone from 5 studies that had been published on it. I think there's now maybe already 50 studies on it that you could say that are high quality. So this is really going very rapidly. Let's take some take-home messages about that maybe. So, how valid is it? This is the first thing that people want to know if they are doing lab-based, research-based studies, because obviously they want to know if I measured something in the past with my marker-based system, can I do it now with my markerless system? And so that's where overall it seems to have a good construct validity, overall seems to be very positive, but the pelvis kinematics seem to be a bit troublesome still, and so people are working on that to try and see if they can get that better, but I think that will be a limitation always for the system. So if you are really interested in pelvic movement, which sometimes can be very relevant, then that might be an issue. And ankle kinetics, that's if you combine this information with force measurements, then ankle kinetics can also be quite tricky, particularly if it's not in the sagittal plane. Reliability is also important. That's if you are using it in clinic, you want to know, can I do a measurement today of my patient? And if I do a measurement in 3 weeks, do I actually get a value that is changed based on the change of that individual and not based on measurement error? And so generally, the ICCs, the intra-class correlation coefficients, which are calculated to estimate reliability, test-retest reliability, for example, seem to be pretty acceptable for this system. Frontal and transverse plane kinematics tend to be a bit questionable, particularly transverse plane kinematics. So if you have an interest in that, then be careful. The error that you get in these systems, the measurement error at the moment, is greater when you actually go to faster running. And I can simply explain that. If you run faster, you have more wobbly masses that are moving relative to your segments, okay? I can now see you visualize all my wobbly masses going up and down, yeah? And actually that error of wobbly mass increases. The training of these algorithms is done based on a static image. And so from a static image, it's very difficult to estimate the relative movement of wobbly masses and clothing to the skeleton. So therefore, the error is still there based on the training that was done. But this is improving. This will most likely get better. And what I would always advise you is go and check the minimal detectable change if you look at reliability studies. Because the ICC can look very promising, and the conclusion of a paper can be, oh yes, this is reliable, we can use it, but you really want to go to the minimal detectable changes. If you have your patient and you want to see certain changes, that value, minimal detectable change, should be considerably smaller than the change that you are interested in. If you are interested in a very small change, then you should keep in mind that maybe the minimal detectable change might not be good enough to actually detect that. Yeah? Now, can we get from markerless motion capture to not measuring the forces, but estimating the forces? And this is where some of you may have already seen that Stanford University came up with a fantastic innovative application called OpenCap. And that's basically two cameras, two synchronized, typically it's iOS cameras that they use. They measure the kinematics. They push the data through a special pipeline of analysis, and they can actually estimate kinetics, not only the ground reaction forces, but also joint moments, and even further, they can estimate muscle contractile forces and tendon forces, which then really opens up a new field and domain for people working in the clinic, for example. And so what they, for example, have already done is some validations of this. And initially, it seems to look promising because here, for example, you can see that their estimated peak knee abduction moment, purely based on this very rapid measurement of two cameras, actually relates well with what they would measure in the lab if they would do it with the gold standard values. However, it looks good. Be careful, again, if you really want to use this, you would have to get an idea of minimal detectable change for that parameter, not minimal detectable change for the kinematics, you see, because that parameter will have most likely a much larger error because of the estimation factor compared to your kinematics. But I would say the future is definitely looking promising. And now, obviously, many of you have lost me and said, I'm not doing any of that because that costs me a fortune to get all these cameras and all these kind of things. I want to have a sensor, which is a very simple sensor, a very easy measurement, maybe one camera or maybe one thing. So let's just go into that a little bit, what we have there. And what we tend to do is we have a technology like a certain sensor that we have. And then we identify whether with that sensor we can estimate something that typically you could measure in a lab situation. Think about the knee abduction moment, think about any type of kinetics or a knee flexion angle, which is sometimes relevant. Can we measure that using a sensor? And from all the sensors, I think the ones for running that probably have the most promise are sensors that are either mounted on the pelvis, on the ankle or on the shin, I would say, or on the shoe. Those are the ones that probably in running have been used most often and are most kind of considered as useful sensors to try and do that. But what do you do then? Well, you will measure a signal, which is typically an accelerometry signal. It's an acceleration that you measure. And then you try to see if that is associated, some statistical measure of that, for example, a peak value or an average or a rate of change or something, if that is associated with your parameter of interest, your kinetic parameter or your kinematic parameter, or maybe your spatiotemporal parameters. And so this is where you then see now many papers coming out with that, because obviously this is very relevant if you have some sensor. I'm going to explain you just one here. So this is one where colleagues from our university, for example, have looked at a single sensor mounted on the pelvis. How can we estimate potentially cumulative load on the body? And so what they identified was that accelerometer-based data is better to do that than GPS-based data. Now, is that important? That in itself is a side factor, but what is important here is to see, okay, how do they quantify whether if it's good or not? And so this was the graph that they plot in the paper, which is fantastic because it gives you a really good idea about the relationship between the impact acceleration that was detected by the sensor and the actual ground reaction force peak, active peak in this case, the second peak in the ground reaction force. And they see that there's a really nice correlation. It's a very strong correlation there. But keep in mind, though, that if that's the case, that might be great, the question that you should still ask is, does it truly allow me to measure someone now, measure someone in 4-8 weeks, like the training program we had before, and then detect a change for that individual? That change will likely be quite small. And if you see the correlation around about the middle there, you see that actually the same impact acceleration value can have about, if you look at the scale on the vertical axis, it can have about 1 G difference, or 1 Newton per kilogram difference in that case. So that's a lot. That's actually, for an individual runner, way more than you could expect by any intervention. Yeah, that runner would have to start running on their hands rather than on their feet, so to speak, to be able to achieve that. And so this is where we have to be quite critical of the papers that come out about that, if the signal from that accelerometer can truly help us detect certain aspects. And so we're seeing lots of papers coming out on this, which is great. We just need to hopefully see more papers also coming out on how good the actual device is in detecting minimal detectable changes, as I mentioned before. Yeah. Maybe one last thing that I would like to finish on, because I don't know how what I'm doing. I'm a bit late already, so I need to really wrap up. Maybe one last thing is the future. How does the future look for motion capture? Well, the future, this is one example of where the future might be. It's a study where they looked at using these augmented reality glasses. And what they do is actually use the glasses, which have sensors in them, to collect motion data, and then actually visualize the data afterwards. And so you can see that maybe in the future, rather than using cameras, we might be able to do motion capture just by using virtual glasses, putting them on and actually doing that. So we might be laughing now, but I'm pretty sure that in 10, 20 years' time, people might be doing that, and we then might look back and think, what were we doing with all those cameras? So I'm going to end by 3 take-home messages. Start from evidence-based clinical reasoning. Why do I do something, and how am I want to achieve that? In clinic or on-field objective biomechanical running analysis is on its way. It's coming. Obviously, if we go outside, the manufacturers of these systems will say that it's here, it's now available, but I think from a scientific perspective, we still have some way to go, but it is on its way, it is getting there, and I think most importantly, clinical experience as well as critical scientific thinking always should go hand in hand, and so if it's in the same person, that's great, but I think most of the time it should be collaborative efforts between multiple individuals. Thank you very much.
Bien, muchas gracias, Jos, por tu intervención.
Thank you very much, Jos, for your speech, for your conference. Now we're moving on to Luis Roche. He's a doctor in biomedicine, a professor in the degree of physiotherapy in the universities of San Jorge, and one of the main people about this topic in Spain, and he will be talking about the artificial intelligence in the running biomechanics. Good morning, can you hear me?
Imaginan.
Can you imagine that your patients and your students get inside the room? They are just standing like that in a room with cameras. They are standing in this position, and where TV is asking them, please put your foot in this box. And then it says, please walk and step on that red tile. Now move on to the blue tile. Now hop on the treadmill. We're going to start running. We're going to make a test when we are increasing the mobility. And whenever they are done, it tells them, please take your report, biomechanics report. And then it's useful for the physiotherapist, the doctor, or whoever, with a recommended diagnosis or recommended exercises or recommended treatment. Do you think that we are far away from that? We're not that far away from that. I've already spoken a little bit about the future. We're no more than 5 or 10 years away from these concepts. that's the idea or the concept behind the research we are doing in our research group. The motivation of my research for the last 10 years. The way of assessing where we can gather data in a structured way. And that's the way we thought about the lab, which is downstairs. We will talk about the protocol, but there's a 3D body scan, a specific scan of the foot, the analysis of the plantar pressures, kinematics, everything with a fully structured analysis. It's taking some 2 hours, which may seem a lot, but we are taking or gathering lots of variables. And so we do different tests, and we are gathering more than 1,000 variables in less than 2 hours. This is using marker-based technology. And as Josh said, it takes lots of time because we put some 60 markers on the body. But we are evolving. We will talk about this later. What's the first step? To have a report coming out of a printer and telling us what's going on with the patient or the treatment we can perform on the patient. The first thing is, of course, to assess the patient. Is the assessment. Everyone can be assessing in a different way, so that's impossible. It makes it impossible to create a common database to generate knowledge. So the first thing we did was to create the working methodology, and we started from a non-structured or unstructured medical record, where we can write down the thoughts of the patient, like I have pain here, or it's more painful in the morning or in the evening. So we can just record that with just a voice recording to feed the AI. And after that, we move on to a clinical morphostructural assessment. The last few years, it has been done with clinical trials like the FPI, or just measuring with the length of the limbs or the position of the hip. And so we've also added 3D scans, foot scans or full body scans. So this would be the protocol we are using. This is the 3D foot scan we've done. So it's a full scan of the foot, and it's giving us the results. We have several collaboration projects using AI based in numbers or based on the image recognition or point recognition, and so we're going to be working with them. There's also a body scan with different technologies. We are checking the ones we want the most or we don't want to use as well. Alberto Rubio is the one leading this segment, where we take the ultrasounds of different parts of the body, like the Achilles or the fascia, the soleum. And so we measure different transversal sections because we want to know the way they are relationing with themselves and with these structures. We do an analysis of the footprint in statics. And so that's why I added here to instrument the patient or not, because we are gathering data from different markers. And so we instrument the patient, and from that we do a test, and we see the patient walking and running. And so we use the kinematics, the cinematics, and the kinetics as well, the 2D analysis with the OpenCab, motion metrics, Optogate, with photocells barriers. And all of this is integrated because, as Joe said, one of the problems we have is that not all sensors, even though they are measuring the same variables, they are not measuring them equally. So we need to know the relationship between the different sensors and to know the standard one. Our group has already published more than 15 assessments to know which are the relationships and how we can correct them. Here we have some of the examples. This would be a basic video analysis, what you can do with Kinovea or with 2DMA, which is a technology automatizing the 2D. This is with photometrics without markers. the girl in the images that has markers, but you also do them without markers. We also have OpenCap, as for example Joe said, you can just use a couple of iPhones, and with just 2 cameras you can use that. We obtain, this is our images of our lab, and so we have 3D analysis or biometrics without any kind of markers, and then we can check the graphs. And so it makes an automatization of the pipelines, and this is done automatically without having deep knowledge of the tool. Then we have Optogate, Vicon, RunScribe. This Vicon would be 3D metrics. We have the full body and from 10 to 22 kilometers per hour, and from 2 to 5 kilometers per hour while they are walking. So to know if individuals are moving between the normal parameters or not. So we have the strength kinetics, we can check the power as well. And after we've done the registration or the assessment, the problem we had was to have a methodology. Now we have them, we have the data, and so from the moment they come in until they leave, they have the same protocol. We have the same protocol for everybody. And so the problem would be, how do we extract that data? And that was a big question mark. So what we do is, from all the systems we use, we generate structure reports that are always identical. So we always calculate the same variables for each individual with the same processing. That leads us to having the same variables in under 2 hours, as I mentioned before. And this all moves to the third step, how we use an AI-assisted diagnosis. What we are working on right now is this idea, this basic idea. On the lower part, we have the reports of each one of the different assessments we have performed. With these reports, we create the first layer of artificial intelligence. So we have a special diagnosis, and so we can give it the RunScribe report, and the assessor, this assessment is going to tell us if the cadence is increased or decreased or whatever. And so this can be applied to each one of the sensors, and this can lead to the same diagnoser. So it connects all the data from the different diagnoses to create one diagnosis to this record. So we can show a few tests, and it can be 80% or 90% the same information as a professional diagnosis of a medical diagnosis done by a person. So this would be also the food scan. So to leave the people doing the assessment outside. And so when we have all the diagnoses, we need to move on to the treatment column. So one of our ideas for the future, because we have already started with a few of them, is to have trained GPTs regarding the different biomechanic alterations. So one would be specialized in sports medicine treatment, another one would be specialized in podology or orthotics. How can we do the 3D CAD or CAM? So we can leave the designer outside the picture, and so we can just have the assessment and give the information on how we want this to be done automatically. So we need to know how to make these decisions, which is the previous step, and also to give some orientation for the trainers. So finally, we have this GPT integrated treatment, which is reviewing the different treatments, so to know the differences, because one of the reports can be saying flex, or the other one can be saying don't flex. So in order to see these differences, we gather all of them together, And so we finally have this treatment, and in the final one would be generation by AI-based generation. The last part would be this recommendation, the shoe recommendations. These treatment GPTs would have sub-GPTs because there should be some shoe characteristics selection with the GPT or the shoe match in order to choose the best or the most adequate shoe for them. So this is a test from RunScribe. I'll just say, make me a report in English. I upload a file from the last running in RunScribe, and the system will automatically tell me what's within the norm, with outside of it as well. So it creates a report. Just like in politics, at least if it's green, it's good. If it's red, it's bad. It's outside the normal range. So it's giving us the different parameters, what's increased, what's decreased. And then I tell him, please make an exercise suggestion to improve health and performance. So we would have another GPT for training, for improvement. So in order to improve the pronation, for example, these are the strategies. So it says, okay, perfect. So the goal would be to reduce stride length, the overstriding. You can do running drills twice a week before the runs, or the different plyometrics, things like that. So we still need to upload the report. But we are right now using technology based on just one sensor. But I can assure you that most of the decisions made, I would fully agree with them. This would be another example with a posture report. When we have reformatum, flexion, hip rotations, things like that. So I ask him I ask it to make a report of the patient, and so we have these answers. So just having one sensor, but it would be segmented in the structure we already have. He's an expert in labs. He has many years of experience in the lab, and he's seen lots of technologies, how they are born, how they die. So, you know, I'm getting older as well, and I have the experience on the clinical as well. So we need quick decision-making, fast decision-making. So for me, to just go into a room, do a body scan, a foot scan, add 2 sensors on the foot and the pelvis, on the hips, and to do a markerless with any of the options that we have available right now, and have it structure. And just once we finish the test, I have some semi-automatized reports so that I can make decisions. That's impressive. It's going to give us suggestions, but of course, the therapist will always have the final word. So this would be helpful to accelerate our analysis, to just do this in 15, 20, 30 minutes instead of 2 hours. And also to improve our diagnosis abilities. This is where I see the future. And of course, the more technological development, the easier would be for data processing. And as long as we know more about these technologies, AI-based technologies, it would be easier, of course, to find the curves on a foot or in a column, things like that. So this is what's going to be increasing, but the technological development is already here. If there are any engineers here, I'm sure they will be able to connect all these ideas. So from here, I just want to say thank you for your attention that you put up with me. So I thank you again for being present here. Thank you.
Hacer una pregunta rápida. Vamos a hacer una pregunta rápida por si hay algo en la sala y movemos por acelerar un poquito.
¿Funciona? Sí. Bien, como vamos un poco justos de...
Okay, since we're running behind a little bit, we're going to limit this question-answer session. We're going to have 2 or 3 questions at most, and then Jos and Luis will be able to answer any questions that you might have during the break. So if anyone has any questions, please go ahead.
Luis, para Luis la pregunta.
Sí.
Entendiendo que eso como clínico nos ahorraría mucho tiempo, ¿no? ¿No crees que al final...
Do you think that in the end you would miss that clinical point from the health professional and there would be a lot of intrusion when it comes to providing diagnoses and treatments? Because being so simple, this could lead to a depersonalization of the professional staff and the patient. I would kind of turn that around. I would say that you're not going to be spending an hour giving instructions to the patients. You're not going to be spending half an hour giving, processing data, but you can be spending that time speaking to the patient, going into more depth into their clinical history. And I think that anybody here today and anyone who is earning money based on the time that they're working, then you might be able to see 3 patients instead of spending more time with them. So I think that this is technology. It's not going to necessarily do things better or faster, but here in front of you, you have one of the main podiatrists, Angela Larrubia, who, how many patients have you seen? 35,000 patients. I can assure you that there will be no AI that has more intuition than he does. He will be the preferential one, regardless of the systems available. And there will be more competition, that's for certain, but there will be competition in the lowest rank of the table.
Hola, muy buenas. La pregunta es para...
Hi, the question is for Luis. How does the AI work? Is it based on data from PanMed, or is it your instructions that feed into it? We offered this information. We've seen hundreds of patients, and we're training based on those diagnosis data. So part of that is trained based on our knowledge exclusively. And the decision-making, or the subsequent decision-making, the suggestions and so on, are suggestions based on experiences. We've done some of the tests based on decision-making that we used with our own patients, but most of them are expert opinions. These could be also trained using, using, of course, data protection aspects and so on, which restrict things. The therapeutic aspect is just that, and we're talking here about this issue of the concept. These are things that could be done, and the diagnosis part is the part that we are implementing. Okay, thank you.
¿Alguna pregunta más? Una última.
Any other questions? Any last question?
Talk. My question would be for Jos, and thank you for a great talk. I enjoyed it a lot. So I am very interested in shoe technology and the implementation of this into in physiology and also in mechanics. And one of our main challenges is trying to explain the high variability we see between athletes. I don't know if you have had any work or experience with shoe technology, with carbon fiber plate shoes, and how biomechanical variables and ground reaction forces could explain potentially the variability in the response to the benefit of these shoes, because in our lab we are going a bit crazy about this, and the biomechanical limitation is that we are mostly specialists in physiology and not biomechanics, and I'm just wondering if you had any experience.
Thank you. Thank you very much. Excellent question. First of all, I'm not a running biomechanics expert. I call myself a biomechanics expert. There's a lot of work that has been done on these kind of aspects. For example, in the context of Oscar Pistorius in the days, the prosthesis runner, basically, and how that can improve and potentially not improve. And so a lot of that work has been done in Cologne University in Germany, and they've also worked on some of the shoes which have these carbon plates and the possible benefits. Now, you have to always keep in mind, there's a very good paper on that. I know that Ben Onig was a co-author, but I can't remember the name of the first author. Where they identified that the benefits in terms of responsiveness are only with those individuals who are really at the higher level of running. So the highest level of runners will benefit to that, but other people probably will not. And I think the basic explanation to that problem of not responding to it is, I think, the compliance of the tendons. That there's a very subtle interference between your tendons and in terms of storage and reutilization of energy and that carbon plate. And that has to be attuned perfectly. And I think that the carbon plate can only give a certain amount. It can't give a lot. And then you need to have really expert runners who probably can deal with that, and where their body mass relative to their actual tendon stiffness is sufficiently low compared to other recreational runners, which might not have that very low BMI almost, you could say, to be able to interact well with these carbon plates. So that's one of the main things that people have suggested so far. But surely there's more things to it. Ben Onig has published a really nice paper on footwear and how we tend to, or how we should select footwear. And one aspect is also comfort filter. So if you run with these carbon plates, the comfort of the shoe that you are using when running, to some people will be comfortable and others not. And that's a very multifactorial thing.
Thank you.
Okay.
Pues damos por terminada esta segunda mesa.
Well, we'll close this second round table and we'll start with the next one. Thank you very much to all of you.
Hola, hola.
Hello, everyone.
Bueno, vamos a continuar.
Okay, let's continue now with a round table about physiology on ultra distance and trail running. We've got two experts here. The first who's going to be speaking is Diego Jaén. He is a professor at the University of Innsbruck in Austria. He has published over 50 articles in the last 5 or 6 years on performance and on trail running, and also studies on stiffness in running. He trains triathletes and trail runners, and yesterday went for a run. And if anybody wants to join us tomorrow morning, then if you're lucky enough, you might be able to catch him. Thank you, Diego.
Bueno, lo primero. First thing first, thank you very much to the University San Jorge. Thank you very much, Toño. Thank you very much, Alberto. Thanks, Luis. You're not here. Yeah, I always was the last one in the group. Yeah, and it's very nice to be back here. Universidad San Jorge will be for always home. Unlock will be for always home. And sorry, it touched me. Yeah, so we are here to talk about trail running. Trail running is also within the scope of running and running science. And in the last 3 years, I'm involved, so like quite deep into trail running. We have the perfect condition in Innsbruck to do that. It's very easy, very sports city. Everyone is involved in something, so you just check your hands and then you get participants. So as you can see here, the total number of participants increased trail running increasing. Yeah, it doesn't. So trail running popularity increased in the last 20 years exponentially. Yeah, for sure, until COVID came to our life, yeah, and then stopped. But lucky enough, trail running is coming back to its single track. You have here the distribution of participants per distance. Yeah, as you can see here, there is a shift to longer distances. You have 50K, marathon, half marathon, 10K, and 5K. And as you can see there, the shift to longer distances is increasing after and after and after. Yeah. It seems that trail running is in our nature, yeah, or at least it was, yeah, and we have the perfect conditions in our body to do that, yeah, for longer distances, because we are highly resistant to fatigue, just because we have plenty of fibers type 1, okay, and we have also a very efficient system to thermoregulate ourselves. Yeah. It seems also that trail running resembles what we did before in order to get food. We didn't go to the supermarket and we exchange money against food, but we just hunt until the gazelle was just boring. Yeah. So if we would be able to hunt a gazelle after 4 kilometers, just going not all out, yeah, but has a maximal effort, okay? But if we alternate work on running, as we do in trail running, so we would it would be more efficient, it would cost less, okay, for systems, okay? And then we will be able to get the gazelle after approximately 16 kilometers. That's trail running, okay? Good. I will just skip this, yeah, because it's not relevant for the talk. And let's start talking about the differences between road runners and trail runners. Here, in the image, you see 2 marathoners, but you can identify who's a road runner and who's a trail runner. So, and easily, yeah? So, trail runners, because of the ups and downs after or over 40 kilometers, they develop some adaptations and year after year, yeah? And you can see that in road runners, where the course is mostly flat, okay, the adaptations are different, yeah? But let's see graphically. So, in Paris, the course was said to be, so the profile, the altitude profile was, yeah, demanding, okay? And then, but we have here a peak, 183 meters, a second peak, 172 meters. But if we go to a very well-known worldwide marathon, in this case, sorry, the COM, yeah, it's important, Strava, you are all in Strava? Not, just look for it and just register. So the COM for the marathon is held by Tamira Tola in Paris, yeah? If we have a look at Segama, and Segama is Segama, okay, the altitude profile is quite different, even though we have the same length, yeah? So now you can connect dots, and you see why, or you can infer why, the legs of a marathoner in trail running are like those before, and the legs in a road runner are like we saw before, yeah? And here we have also some peaks, but yeah, Arats, very well-known peak in Segama. Here, marathoners already completed 1,500 meters elevation gain, not bad, okay? Aizkorri, positive elevation gain, 2,035. Agetegi, positive elevation gain after half marathon, yeah, a bit more, 2,159 meters of elevation gain. And they still need to run, just only 20 kilometers, something like that, okay? Then, here, the COM, for sure, yeah, that's what clear, is held by Kilian Jornet, yeah? Good. If we have a look at the profile, or the power profile, or force velocity profile, we see that, so in a solid line, what you see is the profile of trail runners. In a dotted line, you see the profile of a road runner. So, what you see here clearly, with a significant difference, is that trail runners are more powerful than road runners. Yeah, you have all the absolute values there and the relative values for isometric knee extension. Okay. But if we have a look at how many hours, how many kilometers per week, and so on, all the resistance training, endurance training that they do, road runners seem to train more than trail runners. Yeah. So you find, or it was found, that significant differences exist between the time that they spend on resistance training, the time that they spend, I mean, road runners, in running training, so weekly volume, endurance training, and the total training as an amount, yeah, as a total. So you see that for cross, stand, for road runners and cycles, you have the trail runners, and the differences are quite clear. Then, in a paper that we published, it was for it was a Merry Christmas present. It was in December, yeah. And all the authors are here, so we collaborate together, and we just analyze the differences between road runners and trail runners in terms of tendons. I'm not talking about tendons. I'm just talking about the differences, okay? Because we have a whole session about tendons. So, patella tendon, we don't have, or we didn't find any significant difference, but for Achilles tendon, we found highly significant differences. Yeah. So, what this was for the total amount. Yeah. But if we isolate, you can think, yeah, but maybe weekly volume or elevation gain influenced the other. Yeah. Then we also thought that, and then we isolated each variable, okay, in order to just analyze if weekly volume influences or elevation gain influences as well. Yeah. So, and what we found here is that weekly volume. So, because I don't have the description of the participants here, but there were differences, significant differences in volume for trail runners and road runners. Trail runners completed way more kilometers per week, and they completed way more elevation gain per week than road runners for our study. Okay, and then what we found is what you see here. So weekly volume has a significant influence on the morphology of the Achilles tendon. So you see that thickness, there is a significant difference in thickness, cross-sectional area, and also when we normalize cross-sectional area per body weight. Okay? And the same was found when we analyzed isolated elevation gain per week. So we just took an elevation gain as the variable of interest together with the morphology of the tendon, and then we found that cross-sectional area in absolute values and thickness normalized by body weight are different between road and trail runners. Okay. Then, in a paper that we have under review right now, we also try to determine the correlation between the morphology of the tendon and different time trials. In this case, 9 minutes and 3 minutes. Not maximal because you fainted, okay, or you can faint, but submaximal, let's say, okay. And we took as performance indicators the variables that you see on the screen, and we compare those time trials on the track and on the trails. Yeah, and what we saw is that for normalized patella cross-sectional area in the track, we found a correlation between power, running power, the power that you generate while running, the same way that you generate while cycling. Okay, and also the distance they were able to cover in the 9 minutes and ground contact time. We have already talked about ground contact time. Yeah, so we found those 3 significant correlations for the track. But when we took the trail runners, because they were all highly trained trail runners, and we put them on the natural setting, the trails, the correlation were more and higher. Yeah? In this case, we found correlation for all the variables, okay? And most of them are quite clear. Yeah, as you can see there, all of them are significant correlations. Meaning that the bigger the tendon, the better the performance. Yeah. Then, when we went to the shorter time trial, the 3-minute running bout, we also found significant correlation for trail runners on the trail for all the variables. Yeah. Then, there are some limiting performance factors in trail running, okay, as you can see here, but at the end of the day, the real limiting factor in trail running and for trail runners is muscle damage. Okay, and it's been reported that the stronger you are, the less muscle damage occurs in your fibers. Yeah. Then, just let's have a look here. I don't know if there's any trail running fan here, but this was in the Golden Style Series for half marathon. Half marathon is a bit longer than in road runners for trail runners. Okay, it's a thing that they have. They just want to run always long. Yeah. Then, and this is the very end of the race, just coming to the finish line, and after 27 kilometers, they were able to run for their life. Yeah, so just sprint till the end. So, and this is the battle between the first and the second. So it's a battle to win. Yeah, it's a battle for winning the contest. Yeah. Okay? Then, marathon, Transgran Canaria, 1 month ago. Just coming to the finish line. Spoiler, he did it. Yeah, Pac-Man. Yeah. And this is also seen in ultramarathon. So after more than 70 kilometers, more than 3,000 meter elevation gain. And here they are not battling for the first and second position, but for the 5th position. It's also seen. And that was last year in Transvulcania in La Palma. Yeah, he tried, but he just, the head was faster than the legs. Yeah. So then, after seeing that, this is just 3 examples, but this happens over and over again. I just ask myself, hey, what's happening here, and why, and how? So, what drives third race on trail running and muscular performance? And then, I said, maybe a way to analyze that is just by analyzing the role of lower body maximal neuromuscular performance into short time trials. Yeah, in this case, 9 and 3-minute time trials. Then we carry out another study because things that we do, sorry, and with highly trained trail runners with experience of 7 years till here we have from advanced level to elite. Okay, so with a NITRA performance index, this is the way the International Trail Running Association quantifies the level of the athletes, and so the level is maximal is or elite is 900. Yeah, so the mean value is 759. Okay, you have here the weekly volume around 100 kilometers per week, weekly elevation gain 2,500, strength training sessions 2, 1, and when you ask what kind of strength training you do, we just do. Can you help me? Yeah, balancing exercises and that's all. Yeah, I do this and this and this. Sorry, this is not strength training. Yeah, so most of them they don't do real strength training. Yeah, but let's take it for granted. Okay, 2, 1. Yeah, and so curiously, even though they don't train, and I can tell you that we have seen elite trail runners doing a half back squat with a very poor technique. Very poor means worse. Okay, so you're thinking something, think worse. Okay, and then they were able to lift 2 times the body weight. Yeah, even though they don't know how to grab a bar. Okay, so that means something. Yeah, at least that they are strong. Then here you have the trail runners that we had in the study. Okay, from advanced to elite. Then we have a nice representation of trail runners. Yeah, in levels. Yeah. Then we established a 3-day protocol. First day we estimated the 1 repetition maximum with a linear encoder, yeah, also based on velocity. The second day, we calculated the 30, 40, 50, 60 till 90% of 1 RM, and we determined the load velocity relationship variables. Okay, that means we took, I'll show you now. So with though with that relationship variables, also load velocity relationship variables, we calculated maximal, or we took those variables in order to describe maximal neuromuscular capacity, where you have here the graph of, or the plot of load velocity relationships. Okay, what you have there is A line, L0 stands for maximal load, V0 maximal velocity, A line maximal power. Yeah, and this is the area under the line. This is how you calculate maximal power. Then we calculated all those variables, as you can see in the screen, and we also measure mean propulsive velocity. That means they went down, okay, easily at their own pace, but they needed to go upwards as fast as they can without jumping. Okay, what we did here was a half squat. For a half squat, you measure till the knees at 90 degrees, okay, and then from there they go up as fast as they can. And that mean propulsive velocity, we use it in order to, or as an indicator of strength deficit, meaning that the faster you leave the bar, the lower your strength deficit is for each particular percentage of your 1RM. Then, for the day 3, we analyzed the trial running variables. Okay, we did 2 time trials, separated by a 30-minute break, where they could just walk, jogging, or just talk to me because I was there for every single trial. Yeah, and he's taller. Okay, sorry, it's just technology. Okay, and this is where it was completed. So it's a trail composed of fine gravel together with sand. So it's a multi-use track where you can find that in a park, and you walk, you run. There are people always with their bikes and so on. Yeah. And then the running variables that we consider for the study was, as indicators of performance, was distance, RPE, yeah, the rate of perceived exertion from 0 to 10. Okay. As you can see, both of them are quite exhausting. Okay. Speed, ground contact time, cadence, and leg stiffness for both trials. Okay. And then we just carry out a correlation analysis. And what we found is that maximal power correlated positively with leg stiffness, okay? A moderate correlation for the 9 minutes and for the 3 minutes. When we analyze mean propulsive velocity, what we found, is that for the 60 and 70% of 1RM, we also found moderate correlations for leg stiffness. In the 9 and in the 3 minutes, we found those moderate correlations from 50% of 1RM to 80% of 1RM measuring mean propulsive velocity. Then, what? So, the key findings that we have in this study, if we analyze maximal power together with leg stiffness, is that we found a positive correlation between maximal power and leg stiffness for both short time trials, okay? Meaning that greatly lower body strength enhances leg stiffness and therefore improves running efficiency. And strength deficit, mean power velocity during the half squat, and leg stiffness also positively correlated at moderate loads, okay, 60, 70% if you remember well, and if I remember well, okay, and higher loads, or wider range of loads from 50% of 1RM to 90% of 1RM during the half squat, yeah, meaning that propulsive force generation in strength training translates into better running performance. Good. Then, what's the practical implications? First thing, we can do a performance enhancement strategy, yeah, by prioritizing maximal power development, okay, and leg stiffness optimization. One comes after the other, or one comes because of the other. And we can do that by emphasizing moderate to high load strength training, okay, in order to improve those sprints, yeah, just coming to the finish line. And that also has a competitive relevance, yeah, due to the increased professionalization of trail running. This strength training is required because of the level is getting better and better and better after year, again, even after every competition. And in this case, that neuromuscular and mechanical capacities, mean propulsive velocity as a mechanical capacity, can provide a competitive advantage, yeah? Especially in those running for your life sprints, yeah, to the finish line. Then, just 4 take-home messages, and then I leave you alone, promise. Okay. So then it seems that strength power training enhances leg stiffness. Therefore, we also improve our trail running performance. Importantly, because I didn't say before, flat. Okay. Training with moderate to high loads seems to be key, okay, in order to get those adaptations. Explosive exercises optimize trail running performance, and we can get there by squat jumps, okay, heavy loads at very high velocities, especially the concentric phase, okay. And hello, yeah. And yeah, so at the end, these strength training and power training provide at the end, or may provide, a competitive advantage. So, thank you very much for your attention, and yeah, thank you. Me siento aquí, güey.
Muchas gracias, Diego.
Thank you very much, Diego. I found really interesting to hear about the limiting factors, about neuromuscular power, the stiffness for trail running versus road running. And among these factors, you also mentioned aspects like heat, for example, about heat. And about this, we have Borja Muñiz. He's a professor in the University of Zaragoza in the degree of physical and preparation, and he has more than 50 indexed papers in the last few years regarding performance, physiology, and I think you're also going to talk about different limiting factors for performance. Maybe not so much about trail, but we can discuss about this later. So the floor is yours, Borja, whenever you want. Yes.
Bueno, muchas gracias.
Thank you very much. I will be speaking in Spanish. So I will be making the translator's work now in the opposite direction. So I'm going to be talking about thermal distress, and I've added the surname, let's say, of technological innovations because I'm going to be focusing specifically on the implementation and the use of new technologies in this case, especially focusing on thermal distress. Given the topic of the session, which was a bit more focused on trail running, I have done some research with current studies about thermal regulation in trail running, but I've not found lots of things. I will be speaking about technology, as I said, and I want to say that there's no conflict of interest apart from the passion I feel for science or just the scientific hypothesis. So I would like to start with the contextualization of this topic about thermal regulation in animals, and then more specifically in humans. This is basically how human beings storage heat, because we have mechanisms to produce heat and to lose heat. I don't know who mentioned this, maybe I just make this up drinking coffee, but the human beings have lots of ways to produce heat, but we are not so efficient in order to use the energy, because only 20% of the total amount of energy that we produce is used for work. 80% is stored as heat. So the more we work, the more heat we store. This leads to some kind of controversy, so we will be talking about this. And so in order to liberate heat, to release heat, there are a few things, because in this case it's minimal, especially in warm days with lots of radiation. Whenever we are doing these exercises, so when there's convection with wind, this is a way to release heat, and the goal basically is to reduce the internal heat that we have inside our body to keep on working out. And so this is done with low percentages of humidity. This is another barrier we need to overcome. And then the main way to store heat is in the muscles. So this is a graph of the temperature on cycling, the time trial cycling, and the en route cycling. So the heat peaks are higher in time trials, because even though it takes way less time, it's way more intense. So due to our lack of efficiency, of muscle efficiency, we are having this contractile muscle is approximately 20%, this efficiency. So there are peaks of high intensity. Moreover, we need to take into account that our body is usually around 37 degrees Celsius on average, and the range is not that big. We have from the 27 degrees to 42 degrees Celsius. Under 27, it would be a severe hypothermia that could lead to death, and at the same time, over 42 degrees Celsius, we will have the similar conditions or similar consequences. So the body needs to do an extra exercise in order to keep this balance, in order to survive. As I said before, this is one of the few papers I've found about trail running focused on thermoregulation. These authors gathered 9 trail runners. There was a sample of 9 trail runners and a competition of 6 days in 142 kilometers with the ambient temperature on 30 degrees and the relative humidity of 82%. So they measured the performance, hydration, the sweating, the gastrointestinal temperature, which is something that is done through a telemetric pill, if in case you are not familiar with this. And so this is in the gastrointestinal tract, and you can directly measure the internal temperature. Before this, it was the rectal temperature, which was, of course, way less comfortable. And in the end, it was also the body composition as well. And so there was an article of associations, as you can see here. People drinking the most had a lower gastrointestinal temperature, and people with the highest gastrointestinal temperature, they would lose more weight during the race. And if we see the associations with the performance, the best performance had a lower heart rate, as seems obvious. They lost less weight during the race, and there was less water loss as well, and lower temperatures as well. So once we have seen the context or the background around the scientific evidence around trail running, we need to know that, or we need to be aware that we are in an era of climate change. most part of the competitions take place during the summer, and so this makes more difficult for performance and also the health of athletes. Here you see a Scottish athlete in the last kilometer of a marathon in Australia. He was the first. His name was Callum Hawkins. And just 1 kilometer away from the finish line, this is what happened to him. The problem is not the collapse itself, as you can see on the video, is that the intervention took several minutes. No one approached him after some 6 or 7 minutes. And when an athlete collapses due to a heat stroke, there can be some irreversible problems, such as death, even death. Which is the most effective way? Is the one you can see here, is immersion in water, not really cold water, but some water between 5 or 10 degrees Celsius. But this has to be done really quick. This happened in 2018, and he performed really good in warm temperatures as well. He's really great right now, and he was the first Caucasian person, because you know how difficult it is for Caucasians with people from Africa to perform. And so, for example, this is another case. In May of 2021, 21 trail runners, died because of hypothermia. This led to strong convictions to the organizers because of this tragedy. Could this be prevented? We never know. It's really easy to talk about this after it happened, but maybe they could have taken some preventive measures so that this wouldn't take place. Which are the measures? Well, you know that we are in the wearables era, the era of wearable technologies, that you are wearing something and it's measuring something. That's the meaning, of course. These, together with the capacity of the transmitting these data in real time, this is really helpful in order to protect athletes, so in order to have a faster intervention and reduce these irreversible effects. We are moving towards an area where athletes will look more like a Formula One car rather than previous athletes or athletes in previous times. So we will talk about it later in the Q&A session, if we have time, about their use in the competitions. I had the chance to participate in different studies putting this technology into use. For example, this pill I told you about, which is connected via Bluetooth to a phone. And so we could follow the internal temperature of athletes in real time with a phone or a tablet, as long as the athlete had mobile data, internet data. This is the technology we have in order to protect athletes from heat strokes, the heart rate band, different sensors, so inertial sensors, the telematic pill, the smartwatch, which is only transmitting the data in real time, and also the skin temperature. We did a pilot study in the Paralympic and Olympic Games of Paris 2024 with these stations in order to gather the data of the temperature, general temperature and humidity, in order to implement that technology in real time in different sports. This is an example of the Tokyo 2020 Olympics, where we took just a few athletes. And what you see on the screen is what we see in real time about the pill inside the athlete. So in the 10K final in the Olympic Stadium, you can see how one of these athletes was approaching this danger zone next to hyperthermia. And at the end of that race, which took place during the night, but it was so warm nevertheless, some of the athletes were not in healthy conditions, at least visually, but also checking the temperature data. This can help the medical staff to be prepared to work in that window of opportunity of 30 minutes in order to have a more effective intervention. So we put this technology into practice in some other risky events. For example, this 10K. And this is in order to understand that, for example, low or shorter time events can be even riskier than longer time events. This one in Singapore in 2023, it was in 4 a.m. to have the quote-unquote best temperature, because it was some 27 degrees Celsius and 87% of humidity. And so the peaks only happen in the 10K, not in the half marathon. Fortunately, there were no heat strokes. But it's true that the participants were all native inhabitants from Singapore, and so they were already used to these conditions. They were not running that fast. This is a faster camera. So they are turning either orange or red whenever they are getting into this area of hyperthermia. So we can locate them perfectly, the degree of hyperthermia, and therefore, the medical staff could be paying attention in order to approach them in the different parts of the race. This is another race with a heat situation, a triathlon sprint, which took place in Hong Kong in 2024. I only have a couple of minutes, so I'm gonna go faster. So, the risk of heat stress the 15 days prior, you can see that the day which is the most on the right is the day before, and on the right you have the risk of heat stress on the race day. You can see that for a few hours the risk was really high. We applied the technology to triathletes, which is not so user-friendly right now. One of the challenges is to minimize the size so that athletes are not going to pay attention to it. It's not going to be unhelpful for them. And this is a triathlon sprint. You can see there were temperatures over 41 degrees, so you can see how difficult that was. We're also interested in hypothermia, which is also one of the main problems of long distance. This was an expedition, a mountaineering expedition, which were not used to cold because they were all from Saudi Arabia. And we moved to Norway last year to measure the internal temperature. They had 10 hours of exercise, either in cross-country skiing or with snowshoes, and they were camping in tents or in igloos. And so from 35 degrees to lower, this is hypothermia. And so against these adversities, we were in constant contact with the leading investigator. So we had mobile data, and they could take a look at the different data. So these were the main studies, the main results of the studies. So in cross-country skiing, they had higher temperatures, which is, of course, pretty logical because there's more participation of the muscles and more intensity. This is more intense. And it also protected the mountaineers better, in this case of the igloos. We also implemented this in athletes with some kind of disability in para-triathlon, for example, in the Olympic Games of 2024 with different trials, different events, for example, in cycling, in swimming, in blind football, in triathlon or athletics. And just to finish, even though we didn't talk about trail running because there's not so much information about it, but I do believe that this can be highly applied to the mountain and the mountain sports, because people living in in these kind of atmospheres with lots of changes and hostile environments, this early intervention can be allowed, and this is something that is crucial for protection and for protecting them from irreversible damages. And I end with these ethical problems of its use in competition, because there are problems about this. Just to know if any technology can be used, or who has access to the athlete's information, if this should be done, if this shouldn't be done, who is the person responsible or with the responsibility if anything happens. So with all this information, I thank you for your attention and for your invitation here. Thank you very much.
Muchas gracias, Borja. Súper interesante.
Thank you, Borja. That was really interesting.
Que siempre coinciden julio-agosto.
And also given the fact that you've done studies on the Olympics and that the Olympics always take place in the summer, obviously heat stress is always going to be an issue. We're going to have a round of questions, a fairly brief round, and then we'll move on to lunch. And we'll be coming back later at 3 o'clock. Any questions there?
Hola, muy buenos días. Bueno, enhorabuena a los dos por...
Hi, thanks. Well, congratulations to both of you. One question on trail running. You talked about the limiting factors on performance. One of these is the different concentric components and the depletion of substrates. And within this section on power, could you in some way quantify how much importance you should give to a strength component or another one? That's a really interesting question. Thank you. I'll try to give the briefest answer. So within the training and performance of trail runners, there's a predominant extrinsic one, which is downhill running. When you speak to a trail runner, they all have adaptations, they all have large tendons, strong muscles, without even having stepped foot into the gym. So I think that what we could offer a trail runner is a longer and more fruitful race. But honestly, I think that their performance isn't really going to improve significantly, though I do think that we'll be able to lengthen their sporting career. So they have to do a lot of extrinsics, because in downhill you can't go all out. You have to brake in some way. You have to contain that in some way. So that extrinsic stimulus exists. So doing repeated intervals downhill, you have that already. Could you work extrinsically at the gym? Yes, of course, and you could include that in your planning. I plan for that, but really, I plan that those efforts in the field, repeated sprints, and downhill as well, and that's all. I hope that's answered your question.
Gracias.
Thank you to both of you.
The actual temperature of the core is one aspect, but obviously we know with heat that we have dehydration issues. Do you know if there is any evidence on muscular dehydration and dysfunction during events such as trail running? Because I think if you have to do eccentric and all very heavy duty activities with your muscles, then dehydration can really have a dysfunctional role to play.
So our work with different sports. Actually, we did a pilot study in trail running in the Maratón Montañas de Benasque in implementing this technology, but we didn't assess this, and we considered that the thermal stress is highly influenced by hydration, and this is part of it. But because we as scientists are limited to monitor heat stress during a given event, but coaches, and we give the recommendations to coaches during these events, so they are aware of the influence of fluid intake. and we collect the data, but we don't assess this specifically. But I am sure it highly influences. Yes, we give recommendations, but we monitor it, but we haven't tested specifically muscle hydration. I don't know if you have any idea about this. Okay, thank you very much for the question.
Para Diego.
This one is for Diego. We talked about the trail runner compared to the road runner. We're talking about the elastic aspect, and so extrapolating normal people, not elite athletes, how can we measure if the runner needs to work more on the contractile component or more on the elastic component? I'm not sure if I've explained myself well. Yeah, that's a really good question. I can tell you how we've done it, and perhaps you could extrapolate from that. I think it's fairly straightforward, especially with the different training methods that we have at the moment, different sensors, different portable sensors that we have to record different variables in running. One really good way of doing it is, and the way we did it in our study, for example, is to analyze the variables between this strength and power and velocity. You can extrapolate the different variables. For example, look at the maximal neuromuscular capacities. These have to do with the profile of each individual, and to measure performance during running, you can use any of the ones that we've talked about. You can use RunScribe or any others that will give you different spatiotemporal variables or stiffness variables. For example, I found a positive correlation with stiffness, and in the end, stiffness, the more stiffness, the more running economy. It's not necessarily that if you have X value, then you're going to have well, some of us are more freaky than others, we're more scientific than others, but we're all in the same boat here. So to analyze the different correlations is very straightforward. Well, perhaps maybe not the first time, you don't really know how to do it, but once you've done 10 of them, they're all fairly similar. So you can analyze that, and you can do that quickly. You can do that in 3 minutes, and you have lots of variables, and we can see how they correlate. So having a rack at the clinic, it's an investment, but straight away you can compensate for that investment, and you can use RunScribe, Stride, and others. I don't have any conflict of interest. I don't work with any certain one. You can use different sensors. RunScribe offers sensors which are reliable, and using these different variables, you don't have to have thousands of variables. As Luis mentioned, we don't have to get to that stage, but with just a few and knowing how they behave, I think that would be enough. And you might need a linear encoder. Great. Any other questions? This question is for Borja. In the world of triathlons, we're seeing that lots of triathletes are preparing themselves for long distances. They train under circumstances of heat, even in saunas. And we might see the same, establishing certain doses, or what tests can we do, and if these triathletes are really doing this properly without any kind of method behind it. And when we work at altitude, we don't really know what doses to apply, and could we establish certain guidelines or recommendations within a cycle and say, well, now it's of interest to work under heat conditions? Thanks, Borja. With acclimatation strategies for heat, there are different solutions depending on the issues of each athlete. So let's say that the competition is the Ironman at Kona, and the best option is to do this 15 days before there in the specific conditions of the competition, and being able to train at the intensity that you would be doing the competition. So 2 weeks before is better than 1 week before, and also including this competitive stimulus to acclimatise in this period of time. It's not always possible to go 2 weeks before. So there are hybrid combinations there. In English, you differentiate acclimatization from acclimation. One is artificial, that's acclimation. So these could be, you know, Japanese spas over 40 degrees. So you combine the artificial ones before you travel. So if you know you can only go a week beforehand, then you could, the week prior to that week beforehand, you could be using artificial heat. And once you're there, you use the specific, you know, natural factors. And I would say that if you have certain freedom, the best way is to go there 2 weeks prior and train there. And in the same way that you have with altitude training, you have hypoxic cameras. You can't, you know, you have to be at leave high and train low with a machine. So you have to work with the new technology and use the stimulus that has offered the most evidence in terms of the artificial factors. Thanks, Borja. I don't think we have time for any more. I'd like to thank both of you, Borja and Diego, for bringing us all of this scientific evidence as top-level experts. I know you're also training athletes, top-level athletes and trail runners. I think you have a fantastic combination between the scientific and what we can use on the floor today, and it's been really enjoyable. I'll you know, take away this idea of the Formula One car, perhaps, you know, being an Asturian Fernando Alonso, perhaps in a few years we might see pit stops being obligatory during the trail running races, and also weights. You know, if you weigh less than 50, you are penalised like they did with Hamilton. That might be our future, but our present is that we're going to be doing a break now until 3 o'clock. Let me just, you know, recommend that you go for some tapas here in El Tubo. We have other restaurants here. If you want, you can also ask Alberto, who's an expert in restaurants of the area. And at 3 o'clock, we're going to be looking at sprint ability. And we'll be back here again at 3 o'clock. Thank you, everyone.
¿Vale, Elena? Hola, buenas tardes. Hola, buenas tardes.
Good evening, everyone. First of all, my name is Demetrio Lozano. I'm a professor at the Universidad San Jorge from the Valora Research Group. I'm really thankful for the invitation to be leading this roundtable. I hope you enjoy your lunch, the good tapas from Zaragoza. And now we're starting with the roundtable called Assessment of the Performance in Sprint. The first one would be GPS acceleration in team sports, and the second one would be the deficit of sprint in women's football. The first speaker is Elena Mainer Pardos, collaborator, professor at the University of San Jorge. She was born in Zaragoza. She holds 2 degrees, several masters, talking about the performance of young players in football, more than 3,000 of training and in research. She is focused in asymmetries in team sports, women's team sports. We also publish something from handball and other sports, not just football. So I'm gonna leave you with her. I'm gonna give her the floor. Then we will have a short Q&A session because we're running out of time, but I hope you enjoy the sessions. Thank you very much.
Buenas tardes a todos.
Good evening, everyone. First of all, thank you for this kind introduction, and thank you for the organizers of the conference, Luis Roche and Antonio, for thinking about Hadi and myself for this presentation. And so we are now going to be focusing on sprint. Give me a second to check if this is working. Okay. So we're going to be talking about sprint, the change of direction, functional asymmetries, and just a few words about the works or the workouts that can improve the intervention. We're going to be focusing especially in football, as Demetrio has mentioned. I will be especially focusing on women's football because it's my research line, and Hadi will also be speaking about men's football. First of all, why is sprinting key in team sports? As you can see in the videos, players, both male and female, in these sports, they are constantly moving and they are performing high intensity activities. Why? What does it make with the sprint in this activity? Well, because they have to do a high-intensity activity. Even the defensive players wanting to avoid that kind of situation, they also have to perform in these high-intensity activities. So sprints are key actions in order to try to get to have some success in order to score a goal or to avoid the scoring of a goal. In football matches, you can see that there's the play is done quicker and quicker, and in the last few years you can see that the level has increased, not only in men's football but also in women's football. The number of high-intensity sprints were going over 20 kilometers per hour, and so it's around 20 or 30 sprints per match in men's football, and in women's football is about some 10, 15. We also need to take into account that in sprints in football, there's uncertainty there. It's not like a sprint in a more pure form, such as athletics. We need to take into account other factors such as the colleagues, the field, or the atmosphere, the weather, the climate, things like that, because it makes a difference in sprints. I wanted to add a slide with the differences of what I mentioned of a more pure sprint in athletics with shorter distances, and a sprint that we can find in football. It's the same name, but I like to say that these are different realities. Because we see that the context we have is with different colleagues, different teammates, different opponents, but we have something in common, which is the ball. And it's different in athletics because we have opponents, but they are not, in this case, they are not putting a difficulty on us. And you see that football is not always done in a straight line. Sometimes it's done in a diagonal one. But when we're talking about athletics, 200 meters or 400 meters, it's always done in a straight line. Distance is also different. It's not the same thing in 60 meters in athletics, in indoor athletics, or 100 meters, but in football and soccer, it's some 5 to 30 meters, and in indoor soccer, it's even less. About decision making, well, this is a key factor because we are now starting to have some research in this topic. The cognitive factors which are really difficult to be trained, but in the last few years we've had more research about it. Even for researchers, they find it difficult to find tests to assess that. And in athletics, the main goal is to be as fast as possible, to get the best performance. And finally, we have the last aspect, which is fatigue. It's not the same to do a sprint, to perform a sprint in the second minute of the match, that at the end of the match, after 30 minutes playing, you have the pressure, you have the audience, the public there supporting or rooting against you, and you see that this is there's some kind of decreases there. And whereas in athletics you see a difference because it's just one time. I also wanted to bring some data with me, data from Norway. Both Hadi and Demetrio and myself, with other colleagues, we are working with Smeidarne, with the Tromsø University, with GPS data from the first division of women's football in Norway. They are elite players, they are elite athletes, and we've analyzed or assessed the
En cuenta los high intensity bouts, que son
the intermittents, and these are the high intensity performance. And how could we manage this high intensity performance with the GPS and a mathematics model, and anything over 20 watts per kilogram in women and in 25 watts per kilogram in men, and over a minute, that's a high intensity bound, HIB. We've also took into account the active pauses, because you know that it's really uncommon to be fully stopped in football. So this is not part of the HIB. So we filter all the data that we gathered, and we're still on this process in order to try and write the paper down. Elite women's player do HIB activities from 10 to 30 meters, and they last for some 3 to 5 seconds. And with the pauses, the active pauses are around 30 to 50 seconds, because in this case, these values are really significant because of the way we train during the week. We can train the possessions in a different way. We can adapt them to these distances, these recovering times, specifically in women's football. So it's interesting to follow this working line. And we've also seen how these HIB and pause activities are done during the game. So how do we assess sprinting in football? I've shared a few of them. A line sprint, with the photocells and putting a window at 5, at 10, 20, and 30 meters, because that's what we usually run in a game, in a match. We also try to start assessing the Kurt sprint test, the repeated sprint RSA, repeated sprint ability. It's really interesting to see the key factor of fatigue, because it's there on the field. You need to acknowledge it. So there are different tests that are repeated like 6 times, and so we can see how the time is increasing in each one of the sprints and the fatigue deficit. Some tests, you work with them, you work with a ball for them, so that's a sprint we don't usually use. And finishing with this idea of the sprints, I want to focus now on the COD, the change of direction, because this is really relevant, really significant in sports for many different reasons. When there's a change of direction, it's like we start sprinting, we take a turn, and we accelerate again in an explosive way. In football, there's some 500 to 600 change of direction per game. So you can see how many times the players, both male and female, are changing their directions. And we also need to take into account the different angles. This is also studied thanks to GPSs. Most of them are over 90 degrees change. Some others are some, for example, 45 degrees or 135 to 180 to fully change your position. And this is really significant. What's interesting about the change of direction, because when we are stopping, the weight is 3 times or 5 times our body weight, and it's on the limb, on the leg. Whenever a player is changing, is putting some 180 to 300 kilos in that leg, in that moment. And so you can think, you can all be thinking like, maybe she can get an injury. The LCA, for example. And this is happening all over and over, because we are adding lots of strength in these movements. And so a good activation of the quads or other muscles in the legs is really important to change the direction in these exercises. So these kind of exercises I will now be explaining are important to improve the capacity of the change of direction, and of course in order to reduce the risk of injury, because this is something really important in every sport. So how do we evaluate CODs? I'm going to be sharing a few tests. These are the ones we use in our research group, but there are more of them. From a VCAT, 45-degree angle, simulating the typical patterns in a football match. Then the errand in a 90-degree test, the multi-test, which is on your right. Performing these tests to the right and to the left. The 505 agility test, it's a bit longer, so there's more fatigue in there. And the 505 in this case, which is the most commonly used, to just running 5 kilometers, do a 180-degree change of direction, and then another 5 meters. So that's why there is a 505. There are different variants that are being used in the last few years. For example, in Tomás Freitas, in some other research groups, they are using them, and we found them interesting, so we are now using them. So what's the formula of the deficit of the COD? For example, we are assessing or evaluating the 505 agility test. So 5 and 5, that makes 10 meters. We take the time from this 505, we subtract the time of the 10 meters, and these seconds are the deficit of the COD. Then we calculate the percentage of the deficit of the COD, it's on the bottom part. we divide it by the linear sprint, and we multiply it by 100, and we have, for example, 24%. What does it mean? That's the time that takes an athlete to make the change of direction in a linear sprint to complete the test. So we're having a clearer, more pure result to know the time it takes them to make the change of direction. So from here, some of the latest articles we've published with this topic. For example, last year, we analyzed the differences during the season. We took women's football players from different ages, and we performed different tests on them, the 505 in this case. And so we took the deficit for the right side and from the left side. And most of them, for example, you can see that during the season, right after the pre-season in September, it's higher. This is pretty normal. There has been a period with higher loads. The body is getting back on track. And so we perform new tests in November and in February, and we can see that's the peak with the lowest levels. And of course, the lowest the levels, the better. We can see the lowest percentages with the peak of performance of our individuals, and after 8 months, of course, after 8 difficult months of hardworking months, they go higher again. It doesn't mean that all the individuals have these higher percentages of CODs. We analyze every one of them, and then we give them different workouts, personalized ones. How can we reduce these percentages of co-deficits? You have these machines of co-inertials. In the phase of stopping, this is the eccentric phase. And so these exercises, these machines, allow us to reproduce the eccentric work. I personally work with them, and the conic one is pull is the one that is the most similar to the work we are doing in the football field. Then there's another one for the hips, and it's interesting for the asymmetry works. And finally, the one with, for example, some kind of weight, dead weight burden, so this can be helpful as well. This study was published last year. We focused on adult female players, football players, and so we divided in this case, we divided the sample in different ways, and we had some of them with a higher percentage of co-deficit, and they had a higher change of direction but a lower sprint, as opposed to the ones with the lowest percentage of COD, which was the opposite way. And that was pretty shocking for us. But we're going to analyze that because it's pretty logic. The ones with the lowest percentage of co-deficit, which means low is better. The linear is done quicker, faster, but the change of direction is done slower. So in this case, what we see is that we want to know who's maintaining their speed, that speed, and who's making the most of that speed while they're changing their direction. So why the ones with a higher percentages of CODD? We see that when we measure the COD 505, they are faster. Basically, that's because their sprint is slower, and when they do the COD, they do it faster because they don't have that much of an inertia. What's better? To have faster players, even though they take a bit longer to make the change of direction than the opponents. Players with a high percentage of CODD, we're going to be working on their sprint. And the ones with the low percentage of CODD, we're going to be working on the change of direction. we leave that aside, and we're now going to be focusing about functional asymmetries. That's also one of the main lines of research, and that's pretty simple. The difference between the left and the right legs, as per power or mobility or some other things. We can use different tests, such as the ones in the image. We measure on the left ones and the left legs and the right legs, and so we measure them, and using some 5 to 7 formulas. Some of them make a difference the left leg to the right leg, and some others take into account the dominant leg versus the non-dominant leg. So we can see the asymmetry, if there's any asymmetry. What is the science saying? If there's more than a 10 to 15%, the individual has a bigger risk of suffering from an injury. We like having these data because, as I've mentioned before, injuries in team sports are pretty common. And so when we are speaking about professional sport, the club is losing money with them injured. So these variables are giving us lots of information. Also, having a high percentage of asymmetry reduces the performance in jumping or the change of direction. So in sports where the dominant leg is usually the same, and that leads to more asymmetries, for example, in sports such as tennis, always using the same arm as the dominant one, we need to take these variables into account. We've published many other things about asymmetries, and just a few words about them. The orange bars are teenagers, women, female teenagers, football players, and the red ones are adults. And this is horizontal jumping and vertical jumping. And so you can see that teenagers have more asymmetries, whereas in the change of direction, adult ones have a higher asymmetry. So you see that, for example, you can think that if they're adults, there's going to be less asymmetry, for example, but we see that's not the case. Having a higher symmetry in jumping is due to the fact that they are growing. So on a neuromuscular level, neuromuscle level, they're not fully developed. And in that, unilateral workout is done to reduce the asymmetries in teenagers. And in adults, we see that the levels are higher. There's a higher exigence or demand, and so that affects the legs, of course. These are the conclusions we reached, but of course, some of you can have different conclusions, and they can be right as well. Following the line of the changes of the asymmetry during the season, we saw that it was pretty similar as the percentage of CODD. We need to know that each test is telling us something different. The first one is a vertical jump, the second one is a horizontal jump, and the third one is assessing the change of direction, the asymmetry of the 505. Each test is telling us a different story. So it's important to not just take one test. That's why physical preparing, they perform several tests because they are lacking some information. It's not the same to have a 12% of asymmetry in one jumping test, which is not that common in football, that a 15% change of asymmetry on a change of direction, because we're having some 500 to 600 in a game. So jumping is not that important in football, but maybe maybe it is important in basketball, for example. So we need to assess it regarding the situation we're at. And just to finish, I wanted to give you a few words of the works we're doing with some of our PhD students on how we can improve these asymmetries. Of course, science is telling us about unilateral workouts, the alignment of hip, knee, and ankle. the videos I've shown you before, and in the end, of course, working the specific movements we are working on, the change of directions, the angles we are interested in that are present in our sports. And these NMTs, neuromuscular training programs, these are one of our working or researching lines, and we're fully committed to that. And the good thing about these programs is that they combine all the things I've been mentioning. The hip exercises, plyometry, change of direction. So it is like a mix. What's good about these NMT programs? For example, the communication of the nervous central system, the body stability, and things like that. So what do I mean by that? Think about a women's football player when they are going to kick the ball with the head and they fall on one leg. They're not thinking about the position of the leg where the knee is going to suffer the least. And so the good thing is automatization, to repeat all over again, and after a millionth time, the body already automatizes that. And you are thinking about what you need to be thinking about in the field and not about these other things. I don't know if you know about the FIFA 11 Plus. This has been along for over a few years. This is a world map. And we have developed other programs based on that. For example, the thesis of Alberto Rosso, who's here, we designed an NMT program for female football players. And each 3 to 4 weeks, we were adding a different variant, and we did a 40 to 20 workout. 40 seconds of workout, 20 seconds of active pause. That led us to the best results. Then the thesis of Oscar Villanueva, who's also here, we're focusing on indoor football. In this case, 17-year-olds or 18 years old for futsal, for indoor soccer. We're implementing that because it's not done yet. Our goal with these working programs is to get to everyone. We don't want to use specific materials. For example, some kind of pulleys. They can be expensive, so not everyone can afford them. And so we want to reach everyone in the population in order to improve the performance and reduce the risk of injuries. And so with futsal, we're adapting that all over the season. So we're trying to reduce the risk or the number of injuries. We're also measuring that. And at the same time, we're going to see how performance is going. So the last NMT program for women's futsal players, we included an extra week of work. And you can see the pattern in these programs is to include mobility exercises, especially to work, or we usually forget mobility, so I'm talking about myself in this case. I think it's vital to reduce the risk of injuries. So this allows to have a higher degree of mobility. And why do we include dynamic stability? It was, for example, to talk about this alignment of hip, knee, and ankle. Why do we make some workouts of strength workouts? The anterior chain. Well, to know the most typical injuries in different sports. They have, for example, in different sports, they have a higher risk of injury in the quads, for example, or in other muscles such as hamstrings, and also the change of directions as well. So these movements are thought to be on their own patterns of each one of the sports. So that's why we need to adapt them. Some of the results we had with these programs, for example, FIFA 11 Plus, we need to mention that is a work map. There's the
Nosotros que hemos implementado
the warm-up session, and so that's done in the main part, and we're we're talking about some 25 to 30 minutes. Whenever they learn what they need to do, they do it faster. But FIFA 11 Plus, it's really focused to reduce asymmetries, on reducing asymmetries. So that's to prevent injuries. Whereas the other programs we have developed with more volume of repetition of series, these are reporting positive data on the improvement of performance, both in sprint and the change of direction. So that's why we're trying to find the exercises that can be the most interesting to reduce the injuries and also to improve the performance. And finally, the take-home message, as I've been saying, well, sprints and CODs are key for these kind of sports, football, futsal. They need to be trained. We need to work on them. I've brought some variables which are new, such as the CODD percentage, the functional asymmetries, and they give us interesting data per the risk of injuries. So we need to know which things improve the different variables, because sometimes we might be doing things but they are totally useless. So in science we need to choose, we need to know how to choose the ones that are useful for us to prepare physically the students. And so that's why I'm giving you the NMT programs. It was just a quick word about it, even though there's lots of literature. This is just, I believe, an interesting proposal that you can implement with your teams. So I'm gonna give the floor to my dear friend Hadi, who's gonna be speaking about GPSs and machine learning. So I hope you enjoy his talk as well. Thank you.
Muchas gracias. Muchas gracias, Elena. Muy interesante. Voy a presentar a Hadi.
Thank you very much. That's really interesting. I'm going to introduce Hadi Nobari, who's a professor and researcher at the Ramon y Cajal University at the Polytechnic University of Madrid. He's published over 260 articles, 1 to 32, and since 2023 he has been classified among the most noteworthy 2% of scientists highlighted by the University of Stanford. He's also been involved in different articles. His research is focused on the prevention of injuries and recovery strategies. He's been teaching over 12 years now in the US, Iran, Portugal, Spain and Italy. And he's participated in over 70 conferences. So as a real expert, it's a real honor for us to have him here in Zaragoza whenever you like. Hadi.
Can you hear me? Yeah? So, good afternoon, ladies and gentlemen. I see someone are sleeping because it's the night time. Do you want to do some exercise and start to speak? Please stand up. Please, yeah, stand up. It's nap time, so we need to move your body to a little. The circulation of the blood samples is going to your brain, yeah? So we get started our communication. That's fantastic. Please have a seat. Please have a seat. Now the circulation, at least for 30 minutes, is good to reach out to your brain. So I really appreciate the Congress managers and our colleagues. It's an honor to me today to speak about the performance maintenance regarding the GPS with big data. So have you ever used any type of GPS in any sports? So one of them, the most important things in our revolution sports is technology. So let's get started with that introduction to go ahead. I put these pictures and I really appreciate Elena's explanation about the different interventions. That is one of them, the most important for us as a sports science, to see how we can optimize performance, prevention injury, and recovery through the different training. And I appreciate the managing the Congress, because in the morning, the technology and AI workshops, they spoke very well about the motion captures with the view of the kinematic and kinetics, okay? So today, we are going to speak about the variables technology or sensors, that means the GPS with focus with the big data. So we are going to speak about what is the monitoring, how can help monitoring with big data through the optimizing performance, reducing the injury, and then we will review some articles regarding that, the monitoring in each steps, what we are going to look. In the morning in the technology and the AI, they say why, how, what. So, but for us, we say, what happened? What did happen? What will happen? And all of these, how can help for us to make decisions to do better training in any intermediate sports or also another sports. So, the technology regulations, one of them, the most interesting view for this. Each regulations take 50 years to reach out the best moment. From the beginning with the waters started, and after 50 years, the technology was in the top performance. Electricity is the same. Internet was the same. Now is the technology, okay, with big data. But there is one difference in the internet revolutions between data technology and information technology. Before was IT. We have a lot of experts, we have a lot of masters, we have a lot of people expert in IT. That's why a lot of companies grow up with that, because IT say, I have, you don't have. So when you need, you have to call me. So that's why Amazon, Alibaba, every day bigger than the yesterday. But data technology say, I don't have. You have, but I have the expert. So when you need, you have to call me. This is the difference of the data technology and IT, DT versus IT. So we have a lot of experts in the IT, but the data technology is in the beginning of the journey to grow up. So we will see with the data to see, okay, where we are exactly in these 50 years that each revolution is going on. So, my questions, we are coming back in the first questions that I asked. Have you ever done the practicals? Maybe there are a lot of people have the knowledge and big data, they are taking a lot of data, but without the experience and data to combine each others, we can't reach out to be creative and make decisions to do good practice to our teams and get the best performance. So, before to starting again to another introductions, okay, big data, we say, okay, is important. Technology is important. AI is important. But if we don't know the fundamental informations like motion captures, like the different simple questions that you can ask your athletes and take data from their feeling and see their training loads, okay? And also the wellness, GPS, and then we can reach out to the AI. That's why I put these pictures. So my paint is not very well, so this is the tree, okay? So this tree has a lot of knowledge, another tree has without knowledge. So to get the decisions, we need to have all these informations. So we are going in the monitoring, just focus in the GPS, in the second options. So what is the GPS? Global Position Systems that we heard a lot, the satellites of the navigations of the networks through the beach or different fields that gathering data from the athletes. How getting the data? We have one center, so based on the beach that you are using, they have to at least 4 satellites to monitor in each athlete, each field, front of the goalkeepers, in the middle, third middle, and another front of the goalkeepers. The most important things for the technology in GPS, we want to monitor the movement, okay? Only in external load today we are speaking. We don't speak about the internal load, heart rate variability, no. We are just focusing today, speak about the all movement that through the GPS we can take and to see how is the performance, how we can prevent the injury, how we can prevent the neuromuscular fatigues. So, the evaluations. We are coming back in the beginning of our discuss. Look at these articles that published in 2015. The articles, as a systematic review articles, reviewed all GPS technology that used in the publications. The first article started in 2001. In 2001, it was only one publication regarding GPS technology. In 2015, we had only 75. So after 2015, in 2003, another articles reviewed. Until 2022 and 3, it's increased more than 500. I'm sure right now more than 1,000 articles at least in the GPS state, focusing GPS data only for analyzing, get the decisions, or see how is the connection with the non-linear, non-contact injuries. And also the journals is increasing, and they are every year interesting more about to see how is going on in the sports. So at the same time, all governments, one of them, the main policies of them, to increase invest of the technology sports. You look at this. This is the example from USA. Until 2028, they aims is to increasing $36 billion. In 2020, it was only 11, 3 multiple more. That's why is important. So, monitoring. To start to see the monitoring, the first we have to know what is the training load, what is the workloads, okay? We have different variables in workloads. One of them, the workloads, is training loads. Another is acute workloads. Training loads you can estimate with questionnaires that we are not focusing for that. We are focusing in external loads. Based on what they did it, multiple the times of the training will be 1 training loads of the athletes. To reaching out to the acute workload, to acute load, need to multiple how many training we did, multiple training load of every sessions. It's this acute load showed the fatigue of the athletes per week for us. This sentence is important. The second variables that we monitor, it's chronic workload. For getting and to knowing how we can evaluate and assess the chronic workload, we need at least 4 weeks monitor the athletics or team, any players. So the average of the previous 4 weeks of the acute workload will be chronic workload. This showed the athletics fitness. So we have 1 now fitness, 1 fatigue, and 1 fitness. So it's coming fitness fatigue models, okay? 2 variables. Another important and interesting variables. Acute chronic workload ratio. We have different types of the formula to reaching out these variables. The means, the general means is this: acute workload divide chronic workload. That means you need at least 3 or 4 weeks monitor, because in the beginning you have acute workload, but you don't have workload, okay? Because the workload is the meaning, the average of the 4 previous weeks. So we have coupled and uncoupled formulas that it's now, usually we use the uncoupled, that using with the acute workload divided the chronic workload. So when you divide this, you reach out one number, okay? So this number, we have slide to see this number, why is important. Also, we have training monotony and training strength and performance readiness and so on. So in acute workload ratio, why for us is important, we have a lot of criticism about these formulas, and we have a lot of comments. But the beginning, we have to have patterns to move. If you don't have the patterns, how you can monitor your players? So when you divide and find out the results of the acute workload of your players or your team, individualized for any players, if it's less than 0.80, it means you didn't have enough load in previous weeks for your athletes. It's between the 80 to 1.30 showed you have the good load. When it's increasing, we say, okay, you have to be careful, because based on the previous articles, we see when it's increasing, acute workload ratio has connection and relationship with non-contact injury. As I said before, because of the traditional statistical analysis, a lot of articles has big mistakes, because they used to do this with traditional analysis, with normal analysis, okay, with correlation, with regression. But in the big data, you will have the big mistake, error standard in this analysis. That's why there are a lot of criticism about this. So, after to knowing the different type of the workload variables, we are going to see different types of the publications with which aims and how can help. The first, what happened? The only that we are looking in those articles. Your team did the match, your team did the training through the weeks, every week. You have the GPS, you're taking the data, more than 80 variables for each players. So imagine 7 days training with 30 players, how many data you have, okay? So with the traditional analysis, you can't reach out very good results, but with machine learning, with Python, you could reach out fastly and better results. And the second type, what did happen? Okay, we monitor the teams, and we have, okay, we lost, we got the injury in the 3rd weeks, 1 player in lateral. In the second types of the our investigations, we are looking to see maybe you should have some connect between the, when you increase the load and you take 1 or 2 players with non-contact injury. They jump and when go down, they have the injury. So we are looking for that in the second types of the monitoring. In the third, that is the most hot topics right now, what will happen? We predict the times, the loads. Those 3 stages can help for us. How can we make better performance, optimal recovery, and get decisions to make decisions to do the training? So the first type of the articles. This is one of them, the articles that we did it a few years ago with our colleagues at University of San Jorge. In these articles, we monitored GPS data, Y-squad, technical, tactical data to analyze these home match, away match, based on the results, okay, what is going on. In the results, we show, for example, we have find some interesting results. The more sprints has connection with the win. The more distance running has connection with the win. At the same time, one of them, the key result, defensive action key to win, while the another teams has a lot of pass each others. Regarding that, we published one article that is not here. We analyzed it, the performance of the all teams of the championship of the World Cups in Qatar, to see the defensive like pass is better or high pressing. We see the high pressing teams has 70 percentage more possibility to win. So what we are looking to win. The key of the first type of the articles, how help us to make a decisions. This is one take-home message. Another type of the first type of the analyzing. We did this analyzing for Turkish national teams about the prolonged paused, how is effect. They had in their leagues 2 paused, 1 paused because of the World Championships, and the second one it was because of the earthquake in Turkey. Okay? So we analyzed the data to see the effect of the different brick, how can help or no, or how can affect to the performance of players. The results was so interesting. The results of the GPS was so interesting. We find out high total distance, high sprint in breakdown of the championships. At the same time, when it was because of the earthquake, they had less performance. So it's showing when you have plan and when you don't have plan, how is effect to the players' performance. At the same time, in this article, we look the total distance of the team performance. So we see each team has less than 105 kilometers running in match. They probably going to lose. This can be different in each league. This is the only league, Turkish leagues. And also we find out the significant correlations between total distance, high sprints, accelerations that was with match outcomes. That is, again, it's coming back to show why Elena was explaining us HSR, high-speed running, change of direction, for us important to increase performance, and we will see why it's important to prevent, to reduce the injury. So this is the take-home message in these articles, that high intensity is key for training in high levels. Structure plans for team sports to be aware when you have some breaks is also important, and showing the total distance of the team sports as well as is important. There is another article that we do. We monitored neuromuscular fatigue after the match. We had the counter momentum assessment. then they did the match. We had the GPS. We monitored all players. And after that, we had per 24 hours, 1 counter moment jumps for all players to see the neuromuscular fatigues. We have found out interesting results about this. In 24 and 48 hours after the neuromuscular fatigue was in the peak. So the results. We need to take care about the recovery in the beginning to optimizing performance. And the second, we didn't find any correlations between external load and neuromuscular fatigues. When we don't find out any significant, it's not always bad. Sometimes it's good because it showed this is very individual. The fatigue for any players could individual. So we need to monitor after the match individually every players. We can't recommend for all players the same recovery. So the second time, what did happen? In this type of articles, we are looking with external load to see non-contact injuries. One of them, the articles that is published, we did in strength and conditioning journals. We, through the 1 sessions, monitored all training and matches, and we had all external loads and all non-contact injuries based on the types, based on the days that they couldn't come back to the training, return to place. So this was the key metrics. So what we did different types. Even we did traditional analysis, what we did different with the R. We did odds ratio and relative risks, and we divided the data based on when they have high load and when they have low loads. Okay? To see in which times we have more possibility to see the non-contact injuries. And also we consider another important analysis, the position distributions. It means in the analysis with the R, we wanted to see when they got the injury until the next injury. This also we consider based on the external loads. And the results showed the metabolic power average and accelerometric, the metabolic power one variables that calculate in GPS based on the acceleration and declarations data. So we find out in different in acceleration zones and different declaration zones correlation with non-contact injuries. And also we find out the odds ratio when it's high. They have high loads. For multiple has more possibility to taking injury. So the take-home message, the importance for us to monitor in the GPS more accelerometry GPS data like metabolic power, body load, acceleration, and declaration different zones. The third one, the third type of the articles that we are looking that is so interesting and now is very hot topics. What will happen? Prediction injury. This article published in December in BMG, one of them the best journals, and it's the one scoping review that reviewed all articles regarding using GPS data with machine learning. Okay? In machine learning, we have different variables like area under curve, accuracy, recall. So in each one, when we assess the machine learning, we find out the percentage. So this percentage for us is important. Why? Let me to show you. Okay, I think that this is not the same values, but here you can see AUC, when it's more than 0.9, the prediction is fantastic. These articles showed the forest random analysis and XG both analyzing the most typical analyzing to find out the best prediction of the injury for your players. They are only 37 articles find out that they used machine learning to predict, that there is only 3 articles showed the under AUC, area under curves, it's more than 0.9. That is the best predictions. The only 3 articles around the world. Through the 37 articles, we have a lot of gaps because each one, they recorded the injury with different types. They didn't have clinical any assessment. So we have a lot of, even based on these articles, we have a lot of gap that we must to look in the future to find which is the best way to predict. Recently we published one article in last month. It's about the prediction football injury with the machine learnings. That through the one season's football leagues, that is interesting, we find out in declarations AUC more than 0.90, exactly 91, okay? This is the 4th article in the world find the predictions. So we'll see the future. As I said, we have a lot of limitations in these regards, but it's very important and very accuracy versus the traditional ways. So here you can see in the AUC figures that each variables, even another variables also showed us good accuracy, showed good area under curves, but the most important for us was declaration, and I'm going to connect with the Elena explanation. Did you remember she was saying that in the different types of training to using the inversion and go back to do. This is one training that the declarations that is connecting with the injuries in the field. So that's why she was recommending and she's looking for that, okay? And where is coming? It's coming from monitoring. Monitoring help us to find where we have injury, where we predict, and we do the training for that, okay? So, lastly, that to see and to know why it's important to know different type of the GPS when you use it's valid or not valid. We did one review article, systematic review articles, and we looked different articles, okay, to comparing with a standard gold evaluation like radars to see which hertz of the GPS has valid in high intensity running, because you take the GPS, you go, but the data should be valid. That's why we did these articles. So we find out between 33 or 4, if I say correctly, only 16 GPS can do assessed with validations, and 12 was a very less reliability. So every GPS less than 5 hertz has big error to assess the high intensity and change of directions. These two take-home message for these articles. So finally, to take home message of you about this talking, big data and machine learning can help us to take decisions, to help us the prediction injury, to help us the prevent injury based on what we can do through the trainings. However, we have a lot of limitations in clinically based on the definition of the injury. We have big limitations in gathering data because almost of the study that they did, it's only one teams. We need like GPS in the first type. For example, we did for La Liga, all teams. We need to do the study with one leagues, all teams through one season to find out the more prediction data for getting the decisions to how it's going on for your teams. Thank you so much, and I really appreciate your times because I know this is the nap time and sometimes we need to move in the Congress. I really appreciate it.
A ver si conectan los micros, sí. A continuación vamos a hacer algún...
Okay, let's have just a few questions. I have prepared a few questions just in case. Hi, good evening. My question is for Elena. I was pretty surprised when you talk about the loads assessment, about the 11 mg, about the strength, with all the different stages, talking about the jump, even if that jump is slow, that strength platform can give you some data about data about the asymmetry. I think it's understandable that they don't jump with two legs that much in football, but I just brought this part about the sprint, but we always assess the CMG and horizontal jump as well. We always assess that. Because our goal is always to go to the field, to the pitch. The lab is great, but we are using tests that anyone can use. Because usually these expensive articles are not available. For example, the strength platform or my lab ones. It's amazing. It's a really impressive tool that we can take to the pitch. And in the papers we are publishing, of course, we take jumps into account because they have a lot of correlation with the acceleration phase. And we measure both unilateral and bilateral ones because we can measure the strength with both legs, but we also measure the ones with just one leg about asymmetry, to talk about the symmetries and so on. So yeah, we always measure them.
Muy bien. Bueno, hay una cosa interesante que quería comentar.
Something interesting that I wanted to share is that in many of the studies that we've done, Elena, when we talk about unilateral exercises, we recommend them to start with the non-dominant leg. We always assess the dominant leg versus the non-dominant leg to see the characteristics of that individual. But this is something interesting or significant to take into account. Why did we decide it like that? It's true that with the intervention programs we have, we usually start with the non-dominant leg in the exercises. From the PhD thesis from Oliver Gonzalez Koch and so on, they performed a study with an eccentric working activity with 3 intervention groups. The first one would be starting with the dominant leg, and it was everything in an unilateral work. The second group would be starting with the non-dominant leg, and the third group would be starting with the dominant leg, but with twice the same workload. And they observed that the intervention groups that started with the non-dominant legs, they had better results in the performance, and they also reduced the asymmetries. So based on science and the papers that are significant, are important, and doing things differently, we try to adopt them in our way of working because we are basing ourselves on science, and we think that's for the best, of course. I will send that to you later. In the next slide, maybe it's not Yeah, but we had a QR code with all the quotes from the different articles or papers, so I will be sending to you anyway. Any other questions or any comments to Hadi? You have mentioned several machine learning methods, but you mentioned the one with random forest or XGBoost.
For machine learning in the injury, no? In the injury
Yeah.
Injury
Based
prevention.
on the results of the systematic review that recently published, more than 60% of the articles that they predict, they use to XGBoost and forest randoms. So it's coming from the three models. So this is the most relevant, that it's connecting with non-linear regressions between interactions that they have in the external load in GPS with non-contact injury. However, as I said in the last slides, we have big limitations with how is the definition of the injuries. So we need more teams to monitor through the more leaks to see the more accuracy data. So I hope, and the clinical assessment. This is the another that we need to improve in these directions. And I strongly recommend you, if you are in the physiotherapy, I think most of them directions, so to move in this direction, because clinical evidence has the big gap between that and our works. I think it will be very interesting for them to improve in that sections, studies and research, and also will help in the team works.
Thank you. Thank you very much. Bueno,
I believe this was pretty interesting. The team sports have their own special characteristics, and of course, it's really difficult. We still need a lot of work to do to get to these answers. Thank you, Hadi. Thank you, Elena. We'll be having a short pause until 4:30 p.m. The next roundtable will be talking about nutrition and mental capacities. So thank you so much, and I'll see you in a few minutes.
Thank you so much, Temel.
no, thank you.
Hola, buenas tardes. Vamos a continuar con la...
Good afternoon, good evening. We're going to continue with the next roundtable. We're going to be talking about psychological and nutritional factors within the running. I'm going to start by introducing Fernando Jimeno, doctor working in the University of Zaragoza, professor, and specialized in psychology of sports. Someone really passionate about mountain sports and trail running and everything regarding running, so he's going to take the floor. But will you introduce her? Okay, I'll do it after. Yeah. So, good evening, everyone. I'm really pleased to be here with you all. I hope the ones at the end of the audience can really see what's on the screen, and if not, please ask the organization to give you something to watch. So again, thank you for the organization of this conference and everything you are building right now. It's really interesting. You know, whenever you go to a conference, the important part is after the conference, after the people you've met. So we don't have so much time, so I'm gonna ask my colleagues to warn me when I have 5 minutes left. So I was chatting with my colleague Sayoa. I think we're gonna coordinate perfectly in our speeches, and we're really looking forward to the questions after this panel. So in order to start, psychological aspects in running, in sports science. Two key aspects: sports performance, how the psychological aspects are part of this performance in sports, in a good execution, but also in a good outcome. A good outcome, it doesn't mean a success. It's the result of sports performance and mental health. That's success. The long distance runners, for example, which are the most common ones, are to be successful in these two aspects. Regarding the psychological aspects, the key ones in the competition sports in general and in running specifically. The strategy we've always followed in different sciences is to observe in reality the phenomena we're interested in. As per psychological aspects, and a strategy we've followed in psychology is to observe and follow and ask in successful athletes what helps them to be successful from the psychological point of view. So we have really renowned athletes saying that the mental aspect is key, that they train this mental aspect. And they also mention this imaging or imagining something, things regarding focus, self-esteem, concepts we all know, but they share them after an intense work on themselves. Some of them identify this as important as a planning of physical training, and that there should be a mental training as well. And some of them, they already do this. That's one side of the coin, but the other one would be really successful athletes such as the one on the images. They have dared to speak up about the difficulties they've had as elite sports people, sports athletes, the problems they've had, for example, about other topics, about gender equality, which has been really helpful to know and give solutions in order to improve the sports practice in all kinds of sports, not just in running. The athlete on the left mentioned that she has been dealing with depression since she was 16, and all the problems she had during her sports activity, and the athlete on the right said that in order to prepare for different sports events, she needed to actively work with a therapist in order to face the competition. This renowned athlete mentioned the severe problem she had with anxiety, and she talked about something which would be the thing we want to hear the least in our clinical practice, which is the word suicide. The suicide related to anxiety disorders and other kinds of disorders, such as disorders related to depression or eating disorders, specifically anorexia. We can mention them afterwards if you want. That's why it's key to work in sports for people to get the best results in sports, but also to get to the latest years of their life, in the latest stages, with both good mental and physical health. This was a study from 2007, and just something I want to mention. Who was born in 1989? Okay, good, great. So you already know what I'm going to mention. In 1989, the Medicine Center for Sports from the regional government of Aragon, which is not as the high intensity or high performance sports center in Sant Cugat, Sayoa, the doctors go there and they give the prognosis or things like that with only physical tests. What about the mental part? And in 1989, they started working the mental part as well. So whenever they go to a center for medicine of sports, so that they can receive some kind of feedback with or regarding the mental aspects, psychological aspects. So this was done with the interviews from the doctors in order to assess or help the trainers, the coaches. And right now, this is the most the used tool in Spanish in terms of sports performance. In that paper, there were already significant data indicating the influence of some psychological aspects in order to get the sports success in athletes who didn't suffer from injuries or who recovered better from injuries. And the athletes who had a longer working or competing phase or stage rather than those who retired earlier. And we have these key topics on the screen. You know that any questionnaires with variables or scales or different graphs, these are the key topics. Something else for people interested in researching. One way to do science is through research, empirical research, that can help us understand and know the reality, and from there to start planning different alternatives. So Michael Mahoney's psychological terms he's one of the key psychologists in the US in sports psychology, and with his tool, what they did was to identify key aspects in sports athletes who have won medals or in Olympic Games or in world championships, and they took it from there and they adapted that to the Spanish population. So that's why they have 5 stages with 55 different items. So we've always filled in some kind of personality questionnaire, and they're always a result of a multi-factorial factorial analysis, and so how they are organized in different factors. These 5 different scales or levels are indicated by several sports Spanish athletes. The first 2 ones are related to anxiety and stress. There's no coincidence to knowing that these 2 aspects are key, or are actually the key for an athlete to have mental health and to have success. The first one is the perception of, or self-perception of stress control with the implicit variables, with everything related to cognitive anxiety or somatic anxiety. It's not the same to the lack of control of stress for low trust, a low confidence of your own capacity, for having these intrusive thoughts saying like, I'm not capable of doing something, things like that, than the lack of control of stress because you are not able to focus. For example, in resistance runners, the management of the focus with association tasks or dissociation tasks, things that have to do with me versus me pay attention to something or anything else but me. You are now focusing on something really specific, but sometimes focusing is helping us to the thing we're doing, but some others it's quite the opposite way. So this part of psychological training as well. From the warm-up, the test, the effort crisis, things like that. This has to do with the perception of the stress control. The second one would be pressure, the influence of the assessment of performance, how an athlete absorbs and handles criticism or the negative perception of these thoughts like, I'm not doing well, I'm not getting to my goals, I'm not fulfilling my goals, things like that. The third one would be motivation. These are divided into basic motivation, for example, looking forward to something on the long term, but the daily motivation is like how I'm preparing, how I am enjoying in the short term. They are both key, they are both fundamental. Some of them can have a really basic motivation in the long term, they are looking forward to something, but they lack or they have problems with the daily motivation. Fourth, we have the mental abilities. We have some of them there, and that's, let's say, the toolkit of all the strategies that the athlete has to deal with. For example, the analysis of the competition and how that analysis has an impact on different trainings in order to have a better understanding in the performance of the competition, things like that. Everything related to the internal management, imagination. Sports athletes, they usually do this, and we do this with quality, or sometimes it's not productive at all. It's the other way around, because they try to imagine thinking about the past, and that leads to anxiety. Anxiety about the things we are imagining. And finally is the team cohesion, and that's something fundamental for both team and individual sports. You have your colleagues you usually work with, you have your coach, everything related to the interpersonal relationships, how it's key for mental health in sports and sports performance. That red part, what does it mean? That the fact that psychological aspects are in a high value is not always good. Sometimes it's really, damaging in this case. For example, the physiological aspects, they don't always have to be at the same level, like self-confidence. It has to be high at the end of the season, right like when we are at the end of the most important competition of the season. By the way, a low self-confidence at the beginning of the season, it's more interesting in order to promote the implication of the athlete. It's really good that in some aspects don't have a high value. When we're focusing on the technification sports, one of the things that we are usually afraid of when we have these kind of athletes to have low marks in the two first things and high values in the motivation scales. That's something risky in technification sports. Let's move on to the mental health part, the lack of mental health in this case. This is part of the International Olympic Committee. It's part of a document with a toolkit helping with mental health problems. The IOC itself acknowledges that there are some keys with conduct problems with a really high prevalence in competition athletes. You have some data there. Of course, anxiety and depression was something that we would think we're going to find, but then, for example, eating disorders or substance abuse, this is something with a really high prevalence. This is so important to understand right now to face these topics. Hopefully, we will have more time to walk around this. Sleep disorders, things like that. Papers or studies, the ones on the bottom, they have to do with resistance running, where the prevalence values are really important. The addiction to the exercise, for example, depression, anxiety, eating disorders. But addiction to exercise, what's the problem? What happens if I haven't trained for a long time? How am I feeling? What do I do to train? We can also discuss this topic. Why is this happening? That would be the paper with the cheat sheet, we would say. If I am an athlete, in order to prevent what we don't want to happen, and what I need to do in order to work. How do I want to plan my psychological training with athletes? Of course, I'm not going to be going all over it. I'm not going to be reading everything out loud. But for example, the phenomena of injuries. How an athlete who wants to keep living from their sport throughout life, how they are going to deal with the different injuries throughout their life. How an athlete after sports failures, how they are dealing with them, the technical staff, their families, their social support, things like that, that are going to explain how we are reaching to these situations. For example, the impact or the obsession about their own image in social media, for example. This is going to lead to some conduct disorders. This is the positive note. Sayoa, I wanted to mention this. 2 athletes. One of them said that I believe that in order to run faster, I had to weight less. That led me to ignore physical and mental alert signals. And in this case, the fear to weight more was bigger than the desire to be healthy. And I understand right now that the performance and the healthcare are not against the balance, food balance. And the second one would say, if I gained some weight, I was punished, for example, things like that. So finally, in particular with the psychological aspects and integral or comprehensive training, the technical training aspects that have to do with nutrition, psychological aspects, that comprehensive toolkit, let's say. It's not just about training. And with all of that, to really pay attention to the different signals that may appear, both the how, for example, some athletes can be exhausted, both physically and mentally, and how they are not going to feel in good conditions, nor in regarding physical terms or mental terms. And we may have lots of problems. Of course, we also need to take into account the professional support. The newer generations, let's say, we don't understand working in sports without working with a team and with different teams. And finally, this balance between life and sport, things that have to be integrated. Thank you very much.
Bueno, Fernando, muchas gracias.
Well, Fernando, thank you so much. Now it's Sayoa's turn, nutritionist from Carreus Sant Cugat. 25 years working in this area, in this field of sport. She also knows very well the different aspects of nutrition, health, and eating disorders. She works at the High Performance Centre in Sant Cugat. Okay, what is Red S? How many of you know about this triad, this athletes triad? How many of you know this term? 1, 2, 3, 4. A few more hands have been raised. Well, the concept of the triad in athletes is a nomenclature which arose in 1992 through the Professional Association of Sports Medicine in the US, where different concepts were associated, which were to encounter an eating disorder associated to a problem with bones and even osteoporosis. In 2014, the International Olympic Committee nominated that phrase, which is the energy deficit syndrome associated to the athlete. What this means is that the athlete is consuming a lower level of energy consumption than their daily life requires. What this means is that, well, certain parameters were established where the availability of this had to cover their daily energy consumption, less what they were, expending in terms of their energy and exercise, as well as the fat-free mass. So here we have this diagram where their weight is based on an energy deficiency which is maintained over less than 30 calories per kilo over a long time. This means that this could lead to a physiopathology that could lead to this energy deficit. If this athlete isn't basing what they do on this traffic light system, 30 to 45 calories per kilo of lean mass, they might see some issues, but if it's more or less controlled, they could maintain this. The ideal is to be between the green and yellow, depending on the different kinds of objectives that we have.
Damos la energía, porque todo el mundo habla de energía, pero real.
So why do we need energy? Everybody talks about energy, but what does it help us with? This energy helps us with the whole basis of our basal metabolism. And I'd like to really highlight this and emphasize this, because often we relate the calories that we ingest as a kind of reward. We ingest that when we've done sports, but if we aren't training one day or we haven't done as much as we wanted to do, then we kind of withdraw when it comes to eating. We might not eat so much because we don't feel we deserve it. And in the end, our basal metabolism, just for the act of living, what we're doing right now, sitting down here today, this requires much more than the training that we do on the track. We often say, well, I'm eating this slice of cake, I'm adding 500 calories, and we're not aware of the calories that we're using up just from using up these physiological processes that we have as human beings. So this basal metabolism, this daily activity that we have, the pace of life that we have at the moment is high, and Then we also have the training. So these three variables have to correlate with that input. This energy is going to help us first in this period of growth and development, because young people increasingly start training earlier. And even in pre-adolescence and adolescence, they've already started training, and we have to maintain good health, not just in the short term, because often we don't look ahead in 5 years ahead. We have to think of the future. So this young pre-adolescent, what are they going to do once they turn 40? Well, right now I have to take care of that young adolescent so that when they turn 40, 50, 60, they have a good quality of life. Their immune system, we need to offer them good, well-adapted training and ensure that the energy that that person has serves to have a good body composition. This doesn't mean that we have to be 90, 60, 90. Rather, we have to have a body composition that maintains me with a good level of health. Without that, we don't have the correct sports performance. So this network of energy deficiency maintained over time, what we've seen over many years, is that it leads to different consequences. Consequences which are physiological and consequences in terms of sports performance. So the physiological ones, the most common ones, could be amenorrhea, which we often see as something quite common. People come to us when they're amenorrheic, and well, they say, when I'm doing this trial, it's when I'm in my best version. They talk about this condition, which they associate with this state of performance. But seeing this as something healthy.
Déficit energético también nos influye a nivel hematológico, ¿no? Deportistas.
This also has an influence on athletes who always have low levels of iron, who are anemic, who don't manage to regain those levels of iron when their consumption isn't covering what they need. The immune system is altered, they're having one cough after another, they're always ill. And also in terms of the bones, and as I mentioned earlier, we even find 15, 16-year-olds who already have problems with their bones. So imagine the future that these kids are going to have. The hypothalamus, this axis, in the end, it's been affected by this energy deficit. It even can lead to vascular issues. And then we have an association there with issues with sleep. There are also consequences in terms of performance. So the first red flag that we might see in the consultation is, I'm tired and I can't regain energy and I can't manage, and it's Monday but I already feel like it's Saturday and I just can't. So this is where we have to raise our hands, research, look into it, find out what's happening. The risk of injury is exponentially elevated. There's a dip. Normally there's a dip in performance. There's also a lack of concentration because we need glucose for our nervous system and for our brains, and the energy deposits fall. But what does this network result in? How can we treat it? What do we know?
Pues yo creo que todos los que estamos hoy
I think that all of us here today are a bit like this iceberg that you can see in the image. So when we have an athlete, or when we're observing an athlete, we always see is the top of the iceberg. And in that top part, or what we see when they come to an appointment with us, we're seeing fatigue, injuries, problems with their bones, emotional problems, hormonal problems, heart problems. But in the end, this is where the competition starts. This is where we have to scratch under the surface, find out what is happening with that athlete, because in the end, the athlete and the person, that's just one individual. You know, I'm an athlete and I'm a person. Everything that happens to me as a person affects me directly as an athlete, and the same in reverse. So this is where we start the race. The causes that have led us to this network, first of all, the lack of knowledge. We assume that elite athletes know everything about nutrition, but that's not the case. There is a lot of lack of knowledge. An elite athlete, even an adult elite athlete, might not know what a carbohydrate is or what fats serve for, or what the use is of proteins. So and that's an issue. And then in second place, we have customized plans, and each customized training plan, for example, there might be an athlete that trains in a certain way and then they're training more intensively or at greater volumes. But if the nutritional plan is the same as it was before, then this causes an imbalance, and this is done without knowledge, or perhaps even with the objective of losing weight or improving the anthropometric data. In the end, the gurus, the people who don't talk about science, they talk about their personal lives, and they are everything but they have nothing. These are the people that have millions and millions of followers, and in the end, any kind of fake news that they disseminate will reach millions of people, and the people receive that as if it were true, because these are kind of pseudosciences, and they capture the interest of these people who are there like mummies waiting to receive what they say. We have also all these eating disorders, which are associated issues, and these are causalities. There are different aspects that end up leading to an eating disorder. Time management. I don't have time. I've seen cases like that with people, runners who have just finished school, finished university. They have half an hour for lunch because then they have to go straight to training. So, they say, what am I supposed to do? Do I go straight to training after eating? Well, sometimes I'll skip that meal, or I'll do that just to survive, but I'm not really covering the energy demands. Stress is also key. That pressure, that stress that the athlete feels for the same reasons, because in the end, we have 24 hours in a day, and sometimes we need 30 to try to cover everything we need to do in a day. And that stress that people are generating, there's a moment when the athletes then face this dip in performance and so on. And then I have to mention the whole professional team behind that athlete, because they depend on the professional team. That athlete could be being mummified or could be being directed toward this network. If I'm receiving input daily on my figure of what I can or can't do, you can't run because you're too heavy. These are sentences I've heard people say, or you can't do this until you lose more weight because you're not going to be able to reach the best version of yourself. So these are professionals that surround us, and so that energy that we associate with this deficit, where does this daily energy come from that we need? Does anybody know? Where do we get this daily energy from? From the air, out of thin air? No, we get that from food, yeah. It's the only act that we do from the moment we're born until the moment we die, and it's also linked to a huge emotional aspect. So this act of eating, which seems so straightforward, look, you're not covering your energy needs. Well, what are you lacking? 100 calories? Well, okay, 2 more plates of pasta and we can regulate that. It's much more complicated than that, because in this act of eating, there's a huge influence from many different variables. It depends on many different aspects, cognitive and emotional ones. It depends on the pressure, the moment in the season as well, because when athletes are preparing for competition, they're not just competing against themselves, against different results. They're, because everything now is on social media and everything is exposed there and their images are exposed. Nobody wants to look bad in a photo. 80 photos are taken before one is published. There are also even women who are putting makeup on to compete. So in the end, the image counts. The location or the country depends on where you are, what depends what you might eat, our tastes, family, friends, team. If in my team I have a trainer or somebody who is constantly looking at my plate while I eat, and they start to say to me, "What, are you going to eat all that?" You know, what does that say to me? Those comments, those absurd, unnecessary comments, are creating conditions for me as a person, and they're making me even think about the way that I eat. And often, when we start to work with young athletes, and suddenly they are selected to go for an important championship, national championship, and they see that they're surrounded by people who, for them, are reference people, and they start to see different dishes, and they say, "Oh, well, they're eating half as much as I do. Well, perhaps I'm mistaken. If I want to be like them, maybe I need to eat like they do." It's important that we know that often the people that we look up to aren't our best teachers, because in the end we don't know what their own internal battles are. We don't know what the internal battles are of those athletes. Our education, our home education is fundamental. That relationship that we have with food, those conversations that we have around the table, that enjoyment, that pleasure that we have in eating, and our own personal growth. And then also we have our fears and limitations. I always say that those of us who are here, we have certainly luggage on our backs, and we have certain weight to carry that may limit us or may allow us more flexibility. So we can't forget this. And why am I talking about this act of eating? Because I think it's fundamental to adapt or to try to achieve progress in this network that we've defined. When we talk about elite athletes, we conjure up these stereotypes and certain volumes of food. Here is one case of a 25-year-old man, measuring 180, 75 kilos. He came to me because he was extremely fatigued. The first question was, "Do you think you could maybe prescribe me some vitamins or tell me what proteins I should be taking?" And we started to scratch under the surface. And what we can see is that this is a guy that's doing 2 sessions of training. He eats at university, doesn't eat well, as you can see, 3 meals a day, where the meals don't reach the energy requirements that he needs. So what do we do? Patch up the issues there, or do we work on this properly? This is a pyramid which shows what I think is the ideal, the educational basis. So supplements today, well, it's really huge industrial marketing. They are completely standardized, and they're not just consumed by our athletes, but also the companies behind these products already associate these with people who want to simulate the care, that physical care that athletes have, because they associate them with care, health, and nutrition. So if an athlete is taking these supplements, then I'll do the same. How many people here are taking supplements? I'll leave it there. You don't have to answer the question, but how many people review and take a look at what they're eating every single day? We can't base our health and our performance on supplements. Our health depends on what we eat on a daily basis and what we select, what we choose to eat, and the foods we're incorporating into our diet. So we have to have a balanced diet on a daily basis. It has to be sufficient. We have to calculate the times, the number of dishes that we have, and then also use supplements as a patch-up. It could be the point of the pyramid. They should not be the basis of our pyramid. This is a graph, which is the grouse bell. In certain circumstances, we have this. There's a lot of pressure. This happens a lot. The more demands there are, I start to train more as an athlete. I start to think about many different aspects of food, or sometimes I might not change what I'm eating, although I'm training double. Then we have the ticking time bomb, which starts to switch on. I start to get to see the best version of myself. I start to improve, although there might not be improvements in my health, but I start to see different improvements, and it's when I get the best results in my sporting career. But how am I feeling in terms of health? on a physical and emotional level, and this is where things, explode, and they have to explode, because at this point in time, this athlete is a broken toy at a physical and emotional level, and often it's difficult to recover from that, and it takes a long time to recover from that, and it requires an interdisciplinary team to achieve that recovery. Here we have some graphs, because we are creating a questionnaire to diagnose these RES, this network, through different questionnaires. One of these is weight important for your exercise or sports. From 162 women, we had 112 saying yes, and with men, we had this number being 107 saying yes. It's not, the stereotype is not just with women, it's also very highly marked in men. Because in the end, social media is taking us to these stereotypes. Do you want to gain weight, lose weight? You can imagine it's the same. Women saying yes, they wanted to reduce their weight, because for men, on the other hand, it would mean increasing muscular mass. What concerns me, though, is this one. If I increase the number of hours I'm exercising, should I also increase the calories I'm eating? If you imagine, of 162 women, only 11, and of 135 men, only 9, only that number do that perfectly. With the rest, we have 118 women who sometimes, or only every so often, and the same with men, 89. And I think that this needs to make us think about what kind of situation we're living in here. So there's a question that I always ask: how would you define your relationship with food? In this image that you have here, this wasn't one that I asked athletes, it was one that I asked professional team, medical team. And we had so many different answers, all the ones you can see here, from normal to bad to regular to happy. And this is also what we apply to the sports as well. And often this is what we can apply through the pressure we apply on the athletes. So everything seems to revolve around weight, because in the end, why is it complicated to eat more? Often I'll say to them, look, here's a plate of pasta. Would you eat that for dinner? Would you eat that at lunchtime? And many athletes say, well, I'd eat maybe half. Or, well, okay, but just a third of that. And then I'll say, I'll leave you the same dish of pasta, but I'll tell you it's got no calories. Would you eat it? Yes, of course, they say. Because in the end, we're limiting the calories that we're intaking just because of weight. We need to know that performance doesn't reduce based on our weight. It doesn't reduce based on a number. We're much more than a number. We're a person, an individual. We're a technique. We're strength. We're a speed. So this focus on weight has a negative impact on our mental health, because the fact that I'm always being forced by people around me to have a certain weight, or improve the percentage of fat that I have, all this does is make me obsessed with food. There are also external practices that are dangerous, because I might associate with them to try to achieve what my team is recommending that I achieve. There's a false association between leanness and success in sport. It's also important to mention that there's a bias in selection and in opportunities, because in the end we can't just select based on body image. There are also effects in the short and long term on physical health. We can see that there's already a focus and also limitation. And above all, what we would need to do in this case, this focus on weight, we need a comprehensive focus. A comprehensive approach. I'm not going to be thinking just about my weight, but also thinking about my performance. How am I at the moment, and what is my performance like, and what is my health like? We have to compare them all together. It's not just about sports performance. So weight doesn't define performance, but obsession with weight can destroy it for us. It's really important to work on an interdisciplinary level in this respect. And why am I not talking about a multidisciplinary aspect here, because often there are athletes that have worked with multiple disciplines. They've gone through different physiologists, psychologists, traumatologists, and so on. But between all of these professionals, there's no kind of communication. So what's important and what we need to be clear on is that the athletes are not ours. They don't belong to us. We have to be in their shadow. They have to shine. It's only the athletes that have to shine. And we have to form this interdisciplinary team that communicates amongst itself to ensure that that athlete is going to succeed, and we need to meet and ensure that they can do that. So this early diagnosis is fundamental so that this network can improve, and this interdisciplinary work is fundamental. I agree with Fernando that we need to work with a team behind us. At CAR, I'm lucky enough to have that, but in the private clinic, I've also looked for that. In the end, it's about calling people up and knowing that we're not superheroes, that we can't save people on our own, but actually the most important part of our profession is to try to locate issues in time. So to conclude, the important points that we have to stick with is that there is a real lack of awareness, education not just of the athletes but also of the families, the friends, the trainers, the coaches, the whole team. And we have to invest a lot of time there working on that, in working on these professionals or working in this field. And then the whole of the evaluation and diagnosis process has to be a lot more rapid. We have to train to ensure that those evaluations, those diagnoses can be done earlier, and that these are having a huge effect on health and on performance. We're living increasingly longer, but we want to live well. So if my sporting career ends at 35 or 36 years old, how am I going to live for the rest of my life with issues with my hips, with constant fractures? Or another question I ask is, how many Olympic cycles do you want to be able to maintain as an athlete? 1, 2, or 3? So depending on the sports career that you want to have, in the end, you'll have to link that to a way of life, because training or sport isn't just about training, it's about a way of life. You have to work on all these intervention strategies, also in terms of federations, in terms of interdisciplinary teams. We have to invest a lot in research and development, and above all, we have to work on those policies at federation level, so that the very federations are the ones that are concerned about that energy impact, the energy that these athletes receive based on the training plans that they are developing. So all of this linked to that whole interdisciplinary team that we mentioned at the beginning. But above all, we have to think that eating isn't easy, it's complicated. We have to work a lot on that and educate our athletes a lot. Thank you very much.
Bueno, si hay preguntas.
Any questions? First, a question for Fernando, another one for Sayua. You mentioned the topic of attention in athletes and sports people. I train young people, young athletes, and I think this is something related to social media and how everything has to happen so quickly. So in terms of focusing, this has really changed with younger people, and the capacity of focusing, even in myself, we've seen that is decreasing. So how can we work on that in long term, and how as a society, in the times we're living, we are unable to consume things, focusing, for example, reading a book, and 3 pages after we're already disconnected. We can no longer keep on working that. So how can we revert that? How can we correct that? Well, I believe that most of your questions, such as the one from Isabella, are going to be difficult questions. So regarding focusing, paying attention, when I made that comment, what I was thinking about was that the athlete, whenever they are training, where they focus. Of course, you're not with your smartphone. But I do see that in some of the athletes I have, whenever they are disconnected from the run, they cannot refocus themselves. They cannot reconnect themselves. Okay, yes. So we'll get to that scenario, and then we will move to the social media. This is something to learn, and for sports athletes, it's important to teach them how to understand themselves. So after the competition, it's like, okay, what happened? What did we do? And you can analyze many different aspects from the many different things from the technical aspects, but some of them, one of them is going to be attention, focusing. For example, it's like, what were you thinking from the moment the start was given? Or what were you thinking before the start in each one of the segments? And I say this because depending on the coach, you have your own specialties. For example, in the coaches of the four, they divide the training in 4 parts or in 8 parts because they understand that it has to be mastered carefully. So when you teach them to understand that throughout the competition, they need to know what they are thinking, where they're focused, the physical needs, if I perceive them, how do I perceive them, the external attention, whenever I'm running, where do I put my attention? So whenever we understand what's the itinerary of the attention of an athlete, is whenever we can make a proposal saying like, do you think that this path your attention is following with the physical path that your legs are going through is something correct? And so that we can start working with them. Sometimes it can be helpful to deviate the attention and thinking outside the important parts. Something that can be useful for biomechanics, for example, whenever we are going up a hill. But also physical feelings. How not to be so demanding for the physical needs that an athlete can perceive. And that's fantastic in order to know the way you're working, how you're working, and in order to help an athlete whenever it's better to work to the inside or to the outside, whenever it's dissociative or whenever it's associative, things like that. Whenever you are competing, you know at least plan A and plan B, and maybe even plan C. My idea of the competition would be like, I'm going to try to do it this way or that way, things like that. The problems I may go through. If this happens, I do that. If the effort crisis happens before I had foreseen, what do I do? If my position is not the one I wanted. So all this plan has to do with the togetherness of the thoughts, of the plan. And it has to be there. We don't have to think about it. We just have to go with the flow. And so that's why we talk about different kinds of attention, and a good athlete is going to have some kind of protocols and routines that they are applying. They are during the competition, and having different sources of attention. For example, in that case, coaches is fundamental for you to work with them in order to present the models and the references that you believe are interesting for your athletes. I think it's key for you to teach your athletes to make the discrimination from the media models, which things are good, which things aren't that good, and that's where you have this critical sense or things like that. So, of course, we have this other topic, which are mobile phones. We need to know, or we need to decide when we are using them and when we are not, because some of the addictions in the sports is the addiction to mobile phones. There are people who are not able to just not use a screen. Some of you in this area, in this room, if you were told you cannot be using your smartphone, you would be outside. In some classes, I tell my students, I'm not going to allow any kind of smartphones because of the things we're going to do that day. So some of the students, they just don't attend that class. A question to Sayua that we could be talking about all day long, but you were talking about the consequences. For example, on the hormonal level, people doing athletics or running, some people, they are women, and on the long term, whenever they finish their sports career, they may have a plan to create a family. So this Rett syndrome can also have an impact on that. Totally. This is associated with amenorrheas, but it's associated with hormonal changes with both men and women. For example, on the bone level, on the women, after every period, but also whenever we talk about maternity, if I want to be a mother and I cannot. So we're living in the present with our competition goals, but we're not focusing on the long term. And so whenever I finish my sports career, that's when we see the problem. If I want to create a family and I cannot do that. This happens in men as well. This is not something exclusive from women, but of course, the part of growing a child, this is something specific for women, of course, but talking about testosterone, for example, this can affect testosterone and for example, the libido. This affects on the hormonal level to men as well, but there's no flags signaling that. I can go on all day if you want to.
Buenas. Yo quería conectar.
Hi, I wanted to connect both talks, prioritizing the nutritional quality of the food over the calories intake and the calories outtake. I believe this may have an implication on psychological level, but I want to know if it actually does, if we follow the thermal law of the calorie intake and the calories outtake. I'm gonna pass the floor, give the floor to Fernando afterwards, but there's an eating disorder which is not diagnosed as such, which is called orthorexia. So we have, for example, vigorexia, we have anorexia, or we have bulimia as well. But this orthorexia nervosa is something perceived in nutritional quality, and it's also really present on social media. So how many of you, there are foreigners here, but people living in Spain, how many of us were eating oats before, 15 years ago, or how many of us were eating avocados or peanut butter? So this is also about marketing. Marketing, selling perfect food, things like that. Whenever I see coconut oil at 15 euros a liter, whenever we have olive oil here in Spain. So there's a goal behind that of an over-excessive self-care. So whenever there are minimal changes and they need to eat something they don't consider healthy, they have a big problem. And that's what I usually find whenever I have sessions with my clients. People, not only with eating disorders, but people without any kind of structure of the relationship with food. What's your name, your profile? I didn't ask Isabel because I know her. My name is Alex and I'm a physiotherapist. Okay. EDs, we need to understand them on a degree level. It's not like you get to a point where you have anorexia nervosa or you have depression. It's about the different degrees. And at the beginning, you need to understand this as something natural. For example, depression or anxiety, non-clinical depression or non-clinical anxiety. What does this non-clinical thing mean? When you are training and you are really looking forward to have good results, but you don't, of course, you usually feel punished or you leave out sad. Does it mean that you have depression? Of course not. When you are going to a competition, yeah, you get nervous. Because in a competition, you may get so nervous that you throw up. Is that an anxiety disorder? Not at all. But if this is chronified, this is intensified, maybe you get to a point where it is like that. Orthorexia, for example, as was mentioned, in DSM-5, the diagnosis of mental disorders from the US Psychiatry Association, which is the reference for to diagnose these disorders. This is not there yet, but orthorexia will be present there in the end. We need to understand it as a flow, as a flux, as something natural. Coaches and the interdisciplinary team, we need to teach the athletes. Both coaches and psychologists, we promote them. Promote the fact that they eat properly, that they eat healthy fats, non-healthy fats, so that they get trained, and sometimes they become more and more interested in the food. That's not bad at all. Sometimes they go home and they are, having a fight with their parents. Like, you see, the nutritionist, she told me this or that, and so you see, Sayo is the one making problems with families. Of course, I'm joking, but you get to a point where if that becomes an obsession and you are not able to be at a place without a proper food for you, and you are not going to a place with people, going to a place where you don't think they are going to eat properly, or if you think or you believe you need to take your own food with you, that's of course a problem. So it's interesting to see to make this distinction, this differentiation. Not all dependency is an addiction, but all addictions are dependencies. Orthorexia, in this case, such as any other disorder, can be addictive whenever there's an uncontrollable behavior, thinking like, I really need to get this, which is the thing I'm depending on, or I have to reject that because I don't want that. So that's a really big problem there. With anorexia nervosa, that's also a gradual problem. Like, I'm getting interested on my image, I want to be good, but that's not bad itself, per se. To feel good, to have a good image towards other, but it's something different to have different problems with that throughout the process. I would love everyone to understand this, because without being psychologists or nutritionists, it's great that people wanting or in the sports areas, whenever we work with a professional of reference, we can just warn them, like, this doesn't look real good with this person. So this has to be done on site with the people working directly with the sports athletes. We also need to take into account that if there's not sufficient food intake or energy intake, there's not going to be sufficient coverage. We also need to talk about nutritional quality. Of course, my iron is going to be in low levels, so I won't be getting to the sufficient iron levels or calcium levels or vitamin C levels. So it's the difference between quality and quantity, of course. And something we cannot miss is pleasure. We as nutritionists, we educate, we train, we assess, but we also work on the pleasure of enjoying food, because it's something of a social relationship. We are in a country where we celebrate everything with food, and we cannot leave social life behind. My name is Alberto, I'm a physiotherapist, but my question is related to the fact that I'm a father. We were talking about prevention in injuries, in nutrition. What about the prevention in psychology? Fernando, do you consider that we should be working from the basis with young athletes training a lot? There's a really high level of demand, for example, at home or from the surroundings. Do you think psychologists should work with these athletes, or it should be managed at home with the coaches? I mean, the question from Isabel was way more difficult, but this is easy for me. So, a father who acknowledged that he's taking protein. Yeah, you know, the topic of protein is a topic of easiness. No, we don't want to. We listen, but we don't judge. I was just being funny with that. Of course, prevention on a broader level. On a broad level where the athlete and the parents from the athletes, especially young athletes in technification process, so that they can know all the different aspects that they need to take into account, the behaviors and protocols that are really related to physical health. For example, medical checks or everything related to their age. Of course, their contact with their doctors. That's normal. Regarding the prevention on psychological aspects, whenever we have the chance, we do them, and we do them in a natural way. The best prevention is not done by the psychologists on psychological levels, but then, Sayo, you can argue with me. And the best prevention is not done by the nutritionist directly with the athlete, but it's done indirectly. That's why professionals such as Sayo or myself, we are thankful for having the opportunity to have some direct contact with the parents, to talk about them, to talk about their kids, and to listen to them, basically to listen to them, to the problems they have, and to work with them. In Aragon, since 2002, there was a program that was implemented, which was called Training with Fathers and Mothers, to train with parents, to avoid problems in grassroots sports to higher levels. And I know that in many sports clubs and many federations, they promote this contact of athletes' parents with different kinds of professionals. This is really necessary. But as Sayo was mentioning before, it's not just about adding different kind of pieces. There needs to be some kind of correlation, some kind of union. We work with parents or with athletes, but we work with these athletes' parents. When are you competing? When are you training? Understanding the athletes, what are your dreams? What are your desires? When we have all of that and we can work on that in a natural way, that's the best choice. Another choice which is not as good, but if there's money to quote-unquote research on other things, is to give hundreds of questionnaires to people. Of course, on the psychological level or on the food level, nutrition level, to have this kind of risk profiles. That can be done, but it's not the best choice. The same way as by law right now, all the different companies from, I think it's some 50 or 60 employees, that they need to have an equality program, an actual equality program. There should be prevention plans to ensure the quality in sports and the prevention in these topics. Talking about the interdisciplinary topics, she was saying in this center I'm working, this is great, there are lots of professionals there, but whenever we're not in that center, what's going on? What's happening when we're not in our homes? Well, that's also possible. And something important as well, we don't always put things in social media. We don't want things to appear on social media, all these topics we are working on. But right now, in our region, whenever we know each other, because we know each other, people from nutrition, from psychology, from sports coaching, whenever the coaches, they need something, or the professionals need something, we are used to asking for help and to each other. So I want you to, until the moment the regional government implements useful things, I hope all of us working can know each other in conferences such as this one. And, for example, suicide, to avoid that, because we get to that point, because they are broken toys. Yes. Thank you, Father. Thanks to you. And so regarding protein, yeah, it has its own point. Yeah, don't worry. What do you think about supplementation? And if some situations it's necessary because of the requirements of the athlete, of the person, sometimes it's stigmatized in some sectors. What do you think about supplements in general? I believe that whenever someone's coming to my clinic and they're kind of broken, I always use this metaphor. You are like a broken car. The rear view mirror is broken, the windows are broken as well, the paint is, really bad as well. So we can just do some, some vitamins. So we cover everything regarding micronutrients. If you use proteins, you don't have to eat this. Or we can start repairing from the bottom and step by step. I am for repairing because it's educating, and in the end is an autonomy and self-management in the future. So while we are educating this person, they are losing some fears. They are leaving the fears behind. And I don't work alone. I work with psychologists and with an interdisciplinary team. And so there's this fear in our society, which is to have carbohydrates. So this is kind of carbo fears. If I eat this, I'm going to gain weight. And they have mixed ultra-processed food with other food which is rich in carbohydrates. And so we have associated proteins with a visual effect of having great muscles. So what do people want? To gain weight or to gain muscle? So the people, they choose protein. But we need to know that carbohydrates, they don't have just a function of regarding energy, but they also have important functions on hormones, on the brain level, everything related to the hormones, regulating the desire to eat, men's hormones as well. Proteins are necessary as well, they do. But when we are training, we are not consuming protein. They are helpful to repair muscles and things like that, but they are usually covered. And if there's a lack of protein, it's minimal. But the main problem is to diets associated with the lack of carbohydrates. And that's where we have the most problems with. So it's like, how can we imagine our dishes, our plates? When we're talking to parents, you see that parents, in the end, in our centers, some athletes are just living there, and some others, they have dinner and have breakfast at home with their parents. And one of the questions that the parents make is like, my son or my daughter, do they need to eat carbohydrates at dinner? It's like, what do you want for your kid? Because this is associated to gaining weight, and it's like, it's not necessary. Or my kid has more problems with the fatigue than with the need of food. So of course, we need to eat protein, we need to eat carbohydrates, and we need to eat fats as well. WHO is defining healthy feeding with a complete system of balanced use of or intake of carbohydrates, of fats, of proteins, etc. Okay, thank you very much, Fernando and Sayoa. We now have a short break with the commercial brands. So we're back at 6:30. Thank you very much.
sea, si te gastas medio millón,
Estamos ya.
dure 8 años. Perdón.
Hola, buenas.
Hi, good afternoon. Good evening almost. We're going to start now with the last session of today. I hope that you still have a bit of energy left to listen to us, and if you'd like at the end as well to ask some questions. We've talked today about physical activity a lot, but sport is a lot more than just physical activity. And from a social perspective, this has become a phenomenon. And we're going to be speaking specifically about this social aspect. Running events are events that, improve our health, promote good health, promote well-being, but they're also social catalysts and events that change cities in the case of certain races, and even villages and towns in the case of other races that take place in rural areas. We also have to think about the names of these trials to understand as well the social implications that they might have. So, for example, we have the Rodi Half Marathon, Ibercaja Half Marathon, City of Zaragoza. So we have Half Marathon and City of Zaragoza that we understand. We also have Rodi and Ibercaja, which are brand names that are there. Or we have Manfilter, the Marathon of Zaragoza, just to talk about some of the races that we have here. And then, there are people there that have an interest in their names being featured alongside the name of that race. So to understand what the social impact is better, and not just of running, but we have 3 people here who are very important with different profiles, and I think complementary profiles to talk about this matter. The physical activity, what transcends from that this becomes a cultural phenomenon and a social phenomenon, and also what can make people aspire to having a better quality of life. I'll introduce each of our speakers and the topic as well. So I'll start off here on my left. We have Belén Bardají, who is in charge of sponsorship at Ibercaja, one of these entities that adds their name to the name of one of the races. As head of this department of sponsorship, she coordinates the activities with the corporations, with different brand sponsorship, and she has had an important career in terms of linking companies or activities with sports, not just in popular races or elite races, but with sports clubs, with popular sports as well. And these are many different elements that interweave. And aside from her position in this entity, the role that she performs is really important when it comes to generating synergies between public administration, sports clubs, and other operators that are within that system. So it's not just about handing over the money, which would be the easiest thing to do. Well, yeah, in part, yeah. Well, if you have that money, it's easy, let's say. And also, you can understand that a bank has money. You would think that they would have money, each to their own extent. And what I wanted to ask you, Belén, was, well, first, if you'd like to explain what Ibercaja is. I understand that most of us here will know of Ibercaja, but also what does a financial institution such as yours pursue with these sponsorships? What makes you invest in these events related to running? Ibercaja is a financial group operating across Spain. We have over 800 branches, 1.7 million clients. To give you some figures, what perhaps isn't as well known, we are almost 165 years old, and within our DNA, from our origins, we have tried to help to develop the areas that we have offices in from an economic and social viewpoint. So we have a purpose, which is to help people to build the history, the story of their lives, because that will be our story too. That's how we materialize our purpose. And so why do we work in this field of sponsorship? And just to summarize, sponsorship works on 3 different areas for brands. It works on the perspective of notoriety, of business, and of emotions. So sponsorship helps you to make brands tangible. It allows you to reach your target audience. They can see you, feel you much closer. And so for notoriety, and to give you some data, we work with a consultancy that works on measuring the return on sponsorship. And what we find is that brands that sponsor sports events is that it means that your brand is the first to be mentioned in that sector in 6 basic points, which is a lot, because, for example, those who know of a sponsor and those who don't, your notoriety can go from 6 points to a score of 25. So this shows us how it can build the notoriety of a brand. And then also working on business, we can work directly there. We can help with sponsorship with a business directly. We can sponsor you, and then you're therefore a client of mine. That's one aspect, but that it goes beyond that. People who are seeing that brand, there's a Nielsen study which says that sales by brands that sponsor sports events increase on average 15% annually. So obviously this gives you a high percentage in terms of business. And lastly, and not least important, and in fact I would say it's most important, it's the emotional connection that the brands generate that sponsor sports events with customers, with society, and that's extremely important. And there's an important data here which indicates that 78% of people who have seen that a brand sponsors a sports event, they have a much more positive idea of that brand afterwards. Or with the study I mentioned, with the consultant that we use, they've told us that it increases returns by 14%. So sponsorship has many virtues in the 3 different foundations, and it's one of the few forms of making your brand more tangible, that you can see it, that you can touch it, and you can reach certain audiences that otherwise are difficult to reach. And through sports sponsorships, which are so positive for everyone in terms of practicing sports and encouraging the practice of sports, we have a lot of grassroots sports, and promoting all of that goes very much in hand with that purpose that we have of developing economically and socially. Thank you. Well, just to kick off, I think that's a really good starting point. Our next guest, our next speaker here is David Constante, who is the director of Running Zaragoza. It's a bit more complicated than just a running shoe shop. He's also the technical director of the half marathon, of the marathon, and many other races. And he has an extensive background in the organization of running events, but he's also somebody who disseminates topics of running, and every single week he participates in the Vivir program, Living program, every 2 Saturdays. It's a program on Cadena Ser radio channel here in Aragon. If you want to listen to the podcasts, you can listen to that. It's called Pies para que os quiero. And he's there every week. And what this means is that the media is interested in this, and there are increasing numbers of newsletters, blogs, not of people who are fans of running, but of professional journalists who dedicate their time to talking about this. And I'd like to ask you, first of all, about your role as a coordinator of running events. I don't know how you become an organizer of running events. I'd also like it if you could explain to us a bit about, well, within the organization, what are the more complex aspects? Well, yeah, the things that lead to more complications for us. Well, how to become a race organizer in Zaragoza. Well, having a shop, a running footwear, running sportswear shop, that is one way when you meet clients who want to do races. With a small shop such as ours, we had this fantastic opportunity to organize races and organize a training as well. We have very small companies, but these are the basic areas of the company. We have the training groups, the shop, and the running events. And over 15, 16 years, it's the shop that has, given oxygen to the others, and the other events that have given oxygen to the shop. Because as you know, small businesses are going through a tough time at the moment. So with these three companies, we managed to keep moving forwards. And, one day we decided to organize a race. We had the opportunity to organize the Zaragoza Half Marathon in 2006, I think it was. Yeah, you were already there then, I think. But now we can't remember even what year it was. And this was organized with Juan Maria Artola the year before. So we got together. We were like the ping pong for races in Zaragoza. We have different but very complementary profiles. And in the following year, we had the opportunity to do the Zaragoza Marathon when the expo was being held as well. And it was seen that Zaragoza was perhaps the only city with over 500,000 inhabitants that didn't have its own marathon, so we had to have a marathon as well. And since we were the only ones organising long distance running races, then we were given this task of organising the marathon. So we were, circuit directors. We learned a lot, and we have continued on with that over 20 years. 20 years now since we opened the shop, and 20 years since we started with marathons. What is keeping us awake at night? Well, we organise the half marathon and the marathon, and now we're also organising the Ebro race, the 10K race that we do here in Zaragoza. We're increasingly organising more races, and we do that because other organisers have been abandoning the task, and they're saying, well, since you're there, why don't you do that? And we're very glad to. And they abandon these tasks because at the moment, the most difficult part of that is the relationship with public administrations. Every time you need to put more in advance, you have to ask for things 5-6 months ahead of the time. The demands are increasing ever more, and this is good. It does help us to improve and make sure that things are done better. Some things perhaps aren't done as well, but not everybody is prepared to do that work. And if you do that once a year, it's difficult to tackle that once a year. If we're doing that 5 or 6 times a year, we are more familiar with it. We know the different services in public administration. Everything becomes more straightforward. Well, that's the least difficult part of it, but obviously in the weeks before running up to the event, it's like a puzzle. You have all of the puzzle pieces distributed in front of you, and in the end you have to make sure all of those puzzle pieces come together and you can't be missing any of them. So in those 10 days beforehand, we are, trying to gather all these puzzle pieces with a race with so many different people, a huge number of people. Well, it can be chaotic, the water bottles. We were unloading thousands of pallets, all of these different technical points. They don't necessarily keep us awake. It's more the work with the public administrations. Well, no, it seems like you've been having a good day. Well, no, today I'm fairly calm, everything is fairly under control for the next event. We also have Isabel Macias here, who I'm sure is well known because of her sporting career, Olympic athlete at London 2012. sub-champion, silver medalist in the European Championships, often one of the winners in Spain, and one of the main Aragonese talents in athletics. And the lesser known part of her is that she has a degree in teaching and journalism, and in communication she's developed different projects. One of them, for example, a well-known one, or more seen more in the media, which is called Menuda Cantera. Well, you still see that on TV, but with the changes in public administration, then it ends up being a bit of a news item. She's also been the Director of Communication and Marketing for the Aragonese Athletics Federation, and also forms part now of the Spanish Athletics Federation, aside from many more things that she does. Being a mother, that's also an important role, and it also takes a lot of time. Certainly that's true. Isabel, as an athlete, I think it's interesting to understand that relationship between running, athletics, and seeing how... What do you think? I don't know if from that perspective, as a journalist, do you think that running is helping to change the social perspective of the sport, because it's a really popular sport? Well, good afternoon, everyone. Thank you for surviving this long day. Well, I've been lucky, or maybe unlucky, as an athlete, to see the boom and the birth of running. I think now it's more stabilized, but obviously this has done a lot for the sport in general, because running, although it's increasingly more expensive because footwear is becoming more technological, they don't have that starter price for somebody starting off running, and you need very little time to start off running. If you just start with half an hour, you go down to your local park, you can start running, and that means that it's a universal, accessible sport, and it also means that participation can increase in popular races. And I like that we call them popular races, because it's this field that continues to be promoted, although we can see that there's a difference between the elite and the popular part. The public administrations have seen the potential on a tourism level, and you can see cities such as Valencia have seen huge growth because it's become this running city. They're actually calling it that as a brand name, and in just 10 years it's been a real initiative there in that city. And the federational sport hasn't been able to reach the same level. We've not known how to link that participation that has been growing at a grassroots level. We've not seen that in an increase in number of licenses. People who are participating in running aren't asking for licensing. I imagine that these people might be parents of future athletes, and I'd like to think that there is something of a partnership there. We also, as an athlete, you have to learn to live with the opportunities that arise through running. I'm completely a track athlete, although I might do road running. My profile is very much one of track athletics. But there are, I've been with this sponsorship that sponsors Rock and Roll Madrid, and they've had so many different names now I can't remember what they are, but, you had to do a 10K, go there, spend a weekend with different activities, and then also, doing a 10K, which for me was really out of my comfort zone, but that was part of the business. And if you don't make the most of that's an error, because we're talking about running as an element that can involve more people socially, but we can see as well that it's a business. I know it's a business. It's a business that has to be respected as one that has a lot of work behind it, and it also offers a lot of economic benefits for the societies, for the companies, and for the public administrations, even though they complicate the task. So I can see that there has been a boom. There's been a lot of controversy at the beginning, thinking that this was going to be a bubble that burst, but it's really very universal. It's continued in that way, and races such as the women's race, it's fantastic to see. It's not a competitive race as such. It's for charitable purposes. And there are proposals that can reach many people and that other sports can't facilitate, because you can't assume, you can't take on the participation of that number of people, that huge volume of people. And also among women, I think it's done really important work, because it has allowed women to take part who haven't always, left their homes to take part in sports. And this is also reducing that gap with women in sports. So I think that's really beneficial, and I think it's something we need to keep on promoting, and let's hope that it continues to be part of the calendar, and that Zaragoza could please start to understand, like other cities do, that when they cut traffic for us to run, they're not trying to cause chaos, they're trying to benefit all of us. You've talked about the public and their profile, and we've talked about different aspects. I think it's an important point as well, and what you mentioned there, Isabel, is how that public has evolved. A while ago, it was identified that people that were going to run in races, they were all men of around 40 years old or slightly older. But this has been changing. Isabel, you mentioned now that there are increasing numbers of women running, but there's also a group of the public that is younger. You have that information. Maybe I'm not right. Well, yeah, we do have the data. In fact, one of the changes that we've seen in the races, which, 20 years ago, things were much easier, and even the registration was done on paper. So you couldn't get much data out of that, but everything is done through different electronic platforms. So you have all kinds of statistics, where the participants come from, average age, everything you want to know. And what we've seen is, in recent years, and this is relatively new, I think it's really from after the pandemic. Before the pandemic, if you asked us what the average profile was of a runner, we'd say what you just mentioned, a 40-year-old man. That would be the target. And now we've got races where the age group, which is separated every 5 years, and that's how it's done online. And if it was necessarily 30-35, 35-40, the most numerous 5-year age group was from 25 to 30 in the latest marathon event here at Zaragoza. And so we've gone down from 52 as the average age in 2013 to 39 years old. And female participation has gone from 20% to 43%, doubled. We've got races where more women are participating than men, and other events where we're seeing that those equal numbers being reached. We've still not reached that point in other events, but what we've seen is that, in the US and other cities in the north of Europe, where we're seeing marathons and half marathons taking place with more women competing than men. We're, slightly delayed, but it's arising here in Spain too. And at Ibercaja, Belén, you make huge investments, and that requires a method. Money isn't just distributed just like that, but it's distributed with certain criteria. For a long time ago now, we realized that running at that time, called footing, as it was called in Spain, or jogging, as we pronounce jogging in Spain, it was one of the most cross-cutting sports in terms of type of public, age, gender. It was really diverse. Ibercaja had a popular race, which is going to be turning 45 years old now. It was a pioneer in the world of running. So it was a popular race, which was very popular. There were, all walks of life competing there. Running experienced this, huge boom. You know this more than I do because you have different data. There was a moment where it exploded, and then it kind of plateaued, fell a little, and I don't know what you think, but in the last 2 or 3 years, it's, we're reaching a boom again. we see booms when there are crises. We saw that in 2008. You know, you can't go skiing because it's more expensive. And then the next crisis, which was the pandemic, was when we were more aware of what fresh air meant and looking after ourselves more, and it's the crises that cause this. So yeah, well, it's true that we're seeing how that is changing, but for a long time now we've identified how such a sport that reaches so many different audiences, which is affordable for everyone, and that it also reaches society very directly. Isabel, well, you mentioned this topic of the public. In relation to athletics, we've seen increasing numbers of elite athletes, not athletes in their retirement, but you know, in their peak performance, how they complement track trials with running events, 10Ks and so on. Is this a trend? What do you think of this trend? Because we're athletes, but we're not idiots, and that's where the market is. We have specialists coming to the track, and with, you know, people off the street, we see them on the streets in these different running events. So if people come to see a meeting of people who haven't had any contact with athletics, the people that come to see athletics, they do that because either they have a family member that practices it, or, you know, they have a child that is in athletics. So our way of, you know, approaching the public is with the running race in the neighborhood de Alicias here in Zaragoza. That's how you reach the public, and that's where you generate interest, and the brands sponsor these races. They don't sponsor the meetings. The money goes into the running races. If you want to live off this as a sport, people who have more of a profile of endurance sports are going to, you know, get more out of it, because it's more important for the relationships with the brands and with the relationships with people in their city. If you know, have a reference race in your own city, that's fantastic. It guarantees, for example, if Eduardo Menacho wins, he will be in the headlines, or he'll have a photo. He might have a photo on the front of the local newspaper saying that he has won that race, and he'll then perhaps be a champion, national champion. Obviously, it's a shame for me that there is that ignorance in athletics, but I think that, you know, the intelligent thing to do is that if you can approach them, they should also be able to approach you. As I say, you know, we're athletes, we run, but we're not stupid. We understand that this, you know, rather than being an enemy, this could be an ally. And, you know, we can see where there's potential for business there and in the long term. And we've also tried to establish synergies as well with people who like racing, who, you know, it's really fantastic to see people running, seeing them jumping. It's not the same seeing that on the TV. It's emotional then, but it's really difficult to get people to see athletics events. That's a problem of athletics. They don't know how to sell their product, but that's another topic of debate. Well, I think that's a fantastic topic as well, but I'll talk to you now about when, well, Isabel is giving me these topics, the topic here of money, which is really important. It's also where we are seeing this boom, social boom being reflected. We have a society where, you know, a lot is accepted for money, and if we had to decide, let's say, well, those of us who are working here with you, Belén, in Ibercaja, and we have certain proposals to sponsor new races, we have to decide whether to sponsor them or not. What would we be taking into account? How would we make that decision? If anybody here is thinking about that, to give you some clues, some hints. As I mentioned at the beginning, we assess the sponsorships based on 3 points: the notoriety, business, and the emotions, or the emotional connection that it might generate, both with customers and internally. And that's a topic I didn't mention yet, but it's also a really important part. When you access this sponsorship, it doesn't just stay as sponsorship. The investment isn't just what you're paying for the property. You also have to activate that. You have to activate resources, mobilize resources to activate that sponsorship and get the most that you can out of it. And one of the most important aspects of that activation for us, well, not the most important, but one of the most important, is the internal activation. In other words, in all of our sponsorships, we do a lot of work to activate this within, among employees at Ibercaja. So first we would be looking at the cost of this property and what returns it's going to bring in terms of notoriety. You have to assess the number of participants, how publicly this event is going to be shared. Many have advertising plans, campaigns, which also contributes a lot. It also depends on who's involved in that sponsorship. And so from this emotional connection, you want to connect to other companies that have the same values as you. That's really important. You have to also look at the number of sponsors there are. It's not the same giving your name to a race. We talked earlier about Valencia. We have, for example, the 10K Ibercaja Valencia. It's not the same being there as it is being part of a whole number of different logos. So you have to analyze the cost of that property, returns that it's bringing in these more objective terms, and then seeing how you can work on that emotional connection with participants, with the public, and internally with your employees. How many employees do you have? We have 5,125 employees. And your relationship with running, last year we distributed 700 bibs, running bibs, between the different running events that we've sponsored. We distributed these among our employees because there were no more, because we sold out. So that's a really high proportion. Yeah, definitely. In the half marathon, we had 130 employees that participated. We also sponsor the Zurich Rock and Roll, different series, Marathon of Madrid. It has so many different names now, yeah. We're also sponsoring that, and we'll have around 130 there too. The ESSEC race, which is done at the end of the year, the company's race, which we have the podium with the company that contributes the most participants. So we have around 100. So that's a high percentage. And also we are seeing lots of young people taking part, and the profile of the runners is becoming younger.
Vamos a eliminar David. We're going to leave Ibercaja out of the picture. So what's the relationship with the sponsors in the races? In general, with private companies, it's really good. And I'm not saying this because there are problems with public companies, but yeah, Belén was mentioning the activation of sponsorships and so on. Yeah, they have different motivations to be on the marathon or the half marathon, whether they want to, work on the relationship of their own employees with the company itself, to have team building activities. Sometimes we do training groups for people who want to start running, and they are disseminated all over the company. Sometimes hospitalities are done in the races. For example, in the half marathon, there's a hospitality position to just go there, going to the locker room with some other 600 or 6,000 people. Well, they're pretty, crowded. So sometimes you may have a physiotherapist just for you, or a locker room just for you, just for your company. So of course, you give them an experience. They get to live an experience. Of course, it's going to be something different if you give them a present to go for a trip with a hotel and the planes and so on. That's going to be way more expensive than this idea that they have in here. So, for example, they sponsored the half marathon in Lleida, and they decided to come here to sponsor the one in Zaragoza and to try to replicate the model of what they did in Catalonia. So, of course, each company has their own circumstances, but in general, the relationship with private sponsors are really, really easy. We just we don't discuss the agreement, we talk about it, and it's really easy like that. Isabel, as you have many different roles, I'm going to ask you to be on the role of the journalist. I don't know how you see the media coverage on the running events as compared to other sports. Whenever we see media, they talk about football, just 4 football teams, but running sometimes gets its own time, just sometimes. So what about the media coverage, about different mass media? What do you think about that? And as you are also really handy with social media, maybe this is not media per se, but other opportunities of dissemination for running through social media. I've asked you so many questions, so yeah, but don't worry, I'm coming back to the previous idea. We run, but we're not idiots. So of course, you have a great scenario, a great showcase, because social media, they give you a free platform that we didn't have before. So of course, brands take advantage of that. Of course, football is still the king. Now, you know, women's sports appear, but it's the same thing. It's women's football. And it's with the same problems with football, they are there, present with women's football. And 8% of the news on TV are news about women, just 8%. So given that 80% is football, 20% is rest of the sports, and usually the kind of news are not actually sports news, but cross-sectional things to sports, well, there are really, really few times for athletics. Zaragoza is a really different, it's a really difficult market, but whenever things work, it's a huge success. For example, the women's basketball team here in Zaragoza, Casa de Mont, we have a public TV that, of course, I don't share some things with them, such as my program not being there anymore. But Aragon Televisión has a really important platform and in our city, and I've seen some other regional channels which are not in the same quality. And for example, the southern one from Andalusia, there's nothing to do in terms of quality. Aragon Televisión has really committed itself to sports, and they have, for example, after the pandemic, they started disseminating sports. It took us 15 years, and we had to associate with a company from Madrid to make this possible. Because when we tried to explain that, they understood it, but we couldn't make it. We couldn't reach an agreement. We had 4% viewers in the first year. The last time it was 12.3% viewers, and it was just a half marathon. Maybe it's not that much for you, but it was the second most viewed program in the whole weekend. For example, general TVs do this really good. For example, I come back to the team of Casa de Mont Zaragoza, women's basketball team. When it was called Mindfilter, the previous team, there was not that degree of consumption on TV, but it was not the same degree of visibility or media coverage, and that's how people don't know about this. there's a video about Pablo Lolaso, a YouTuber, and they were talking about the final of the Queen's Cup in Spain. And he was complaining because on the second channel of the Spanish TV, they were just there was just a program of the under 21 football friendly match, something like that. It's like if you don't showcase that match on national TV, they don't have the same media coverage, and people are not going to get used to this. And so if I watch athletics on TV, my brother-in-law is running, and people from my family are running, of course, you see that there's more coverage. And after 15 years, you see you need to find your tools, such as, for example, social media. Of course, there are lots of information, and you need to fight against that. You need to find your position. Mass media are still important. I believe that we are lucky in Aragon to have a really good regional TV, which is taking lots of coverage making lots of coverage of sports. Of course, this is open to everyone. You can all ask questions if you want to, but in case anyone wants to make a question, I will be making one so that I can give you time to think about it. I don't know what are your views about the future of running, because you've mentioned a double boom. I don't know if the next thing is, for example, the bursting of the bubble. Of course, this is not squash, but I don't know, what are your thoughts? How can this evolve? We don't have a magic ball to see what is going to be. Yeah, I think it was really trendy a few years ago, that you had to participate in a running race. You had to post this on Instagram, things like that. So, but right now is I would say a more mature practice. People are coming along, women or younger people. That's why races are growing the way they are growing. And participants are choosing. Talking about road race, because trail has different specificities. In road race, big or long races are chosen with DJs, with different kinds of orchestras or things like that. So we have like a full package of experiences. And I think we will continue moving forward. It was hard for us to get tourism in the races, and 1,600 people were coming from outside of Zaragoza, from Barcelona, Madrid, things like that, in this last edition. So you have some 4,000 people on the city, with a 20% increase in hotels. So we see how public administration are seeing that the tourism sectors need to support races. It's just like a big concert, for example. They need to see this. And I think for a few years, it doesn't look bad, unless there's something bad discovered. I think it will keep going well. They've been talking about different things for the whole day, and they didn't mention anything bad, don't worry. I think the quality is going to be the key factor. There's no need to add lots of races throughout the year. And of course, you see, we're talking about the same thing. It's living an experience. Why do people want to experience these big races, these long races? Well, just for example, the goodie bag that they receive. If you have the TV that arts with the animation, or you go to the Carrera del Ebro, and you have tanks from the military for the to start the race, you're paying not so much, but you're paying in order to live an experience. And you see that athletes are more mature, they planify themselves, they need to planify with other groups, they know that they don't have to run every single weekend on a different race. And I think this is already settled. It can go up, it can be trendy again or not, but we know that it's going to going up. It needs to be going up or down depending on the age groups. But I think we already have pretty much experienced athletes who know that, well, the races know that they don't have to lower their quality index in order to not lose runners. Now we see that almost every village wants to organize their races. Right now, this is like the festivities, yes. And before you had the fronton or the pelota matches, but right now we have the races. The important thing is for people to know the race they need to organize. If they have enough population for that, for example, a village of 500 inhabitants, they need to organize a race for just 100 runners, for example, going to a sanctuary or things like that. The one in Borja is successful because they organized a different story. So of course each race needs to be telling a different story, and I think that's good. That's a great base. And from your point of view, Belén, what do you think? How do you see the future regarding the sponsorship of these sports events? I think that there was a boom in running, and we saw it for the increase in the price of properties. Not many brands were associated to running. And so, for example, we've been sponsors for many years to the New Year's race in Madrid or the Marathon of Madrid. We were the main sponsors. And when that was so trendy, the prices got really high, went over the roof. And so, for example, with our resources, we saw that we couldn't make it. I think races are in really good health right now. And as Isabel mentioned, it's important that everyone knows where they can get to. And we see this in Zaragoza as well. There are really big races, such as the half marathon or the marathon, and there's huge logistics behind, huge organization behind. There are also, really small races in the neighborhood park or things like that. And this is really cross-sectional. And it lets you enjoy it. And I think it came here to stay. And people start before every time. We saw that in our own employees. They are younger every time. And they're really, really connected to this. They feel the connection because in the beginning you think it's something personal, individual, but people start making groups, they gather together, each one has their own goals, and they try to compete with each other in a healthy way, and I think this is not going back. Any questions on the audience? Let's see if David can tell us anything about the innovation. We have the marathon of Zaragoza on the 6th of April, so in just 10 days. Well, innovations, I mean, we can share that we're going to try. We're going to be depending on the wind. And because of the wind in this city, we said we need to organize indoor activities. So, if everything is going well, we're going to beat the previous records on the marathon and on the 10K. We have changed one of the parts of the race with one change of direction of 180 degrees. Every year we make the standardization with the federations, and we have really good tracks on our mines, but we need to coordinate that with the local police or the city council and things like that. And of course, they may say this is not possible because of this or because of that. So we changed 180 degrees change of direction. We will change another one next year and in the marathon as well. So these are some of the news. And for next year, we will have lots of different news because all the races go through the same streets, and one of them they're going to have public works on there. So of course we need to change the routes. And you see on kilometer 32, they are going uphill, and we're trying to make it on the 10th kilometer or the 12th kilometer, and it's not the same thing. You always need to go uphill sometime in a specific time, but we prefer that to be on the 10th or the 12th kilometer rather than the 32nd. I'm sure everyone will be pleased with that, and people will not be talking behind my back. You see, he will be saying, okay, they're already uphill. They're already uphill. Well, thank you very much to all three of you. We wish this to be a huge success, this edition and the following ones, and lots of luck for your own roles in order to promote sports or running to this social dimension that is usually a bit hidden. But it's important to promote these personal attitudes or competitions, popular races, and without that, this is not working. So thank you very much, and thank you to the audience for your attendance, and we will continue tomorrow with a conference, with more panels, with more workshops and more content. Thank you very much.
Y ahora me voy.